Avery, that'd be great. Looks like we're now live. So welcome everyone to the Committee on Taxation. We're going to have public hearings on 5 bills today. We'll start with introductions, and based on who is here, we'll start with Representative Gramlich.
Thank you, Senator. Good morning, everybody. My name is Lori Gramlich, and I represent House District 13, which is the lovely seaside community of Old Orchard Beach. And I'm apologizing in advance. I'm going to be popping in and out today as I have competing priorities in other committees. Thank you.
Great. Yeah, if you can stick around just until we start the public hearings, until we got our 7 members, that'd be great. Representative Carmichael.
Thank you, Mr. Chair. Mickey Carmichael. I represent House District 137, which is 22 communities in counties of Penobscot, Hancock, and Washington.
Excellent. Representative Kryzak.
Thank you, Mr. Chair. I'm Ted Kryzak. I represent District 20, Acton, Lebanon, and part of Shapland.
And Representative Matlack.
Good morning. I'm Ann Matlack. I represent House District 92, which includes the communities of Cushing, Thomaston, South Thomaston, St. George, Matinicus, Creehaven, and the Muscle Ridge Islands.
Great. And Representative Perry.
Good morning. Thank you, Mr. Chair. I'm Joe Perry. I represent part of Bangor and part of Orono in the main house.
And Representative Sachs.
Good morning, everyone. My name is Melanie Sachs. I'm honored to represent House District 48, which is Freeport and part of Pownell.
And Representative Collings.
Good morning. I'm Benjamin Collings. I represent House District 42, part of the city of Portland.
And I'm Senator Ben Shipman. I represent Senate District 27, which is part of the city of Portland, serve as Senate Chair of the committee. Other members will be joining us through the morning, but just so folks know out there in the public that people will be coming and going, as with other places that we need to be sometimes to introduce bills or attend work sessions on bills and other committees. We also want to let everyone know Avery Page is with us, our committee clerk, as well as Julie Jones, our committee analyst. And before we begin the public hearings today, since we have quorum, I'd like to ask if someone would like to make a motion to go into work session on LD 1283. This is a bill sponsored by Representative Martin that we had taken up yesterday, and he asked us to vote the bill down, but we didn't have quorum at the time to do that. So if someone would like to make a motion to go into work session on LD 1283, that would be great.
I'll make a motion to go into work session on 1283.
I'll second.
A motion by Representative Gramlich and seconded by Representative Matlack. Any discussion? Seeing none, all those in favor of going into work session, please signify. That's unanimous of all members present. So would someone like to make a motion on this bill? Go ahead, Representative Sachs.
I move and ought not to pass.
Is there a second?
Second.
Second. So motion made by Representative Sachs if ought not to pass on LD 1283, seconded by Representative Carmichael. Any committee discussion? Seeing none, all those in favor? That appears to be unanimous of all members present. Thank you for that. So with that, we'll now open up our public hearings. And just so folks know, we're taking the bills out of order today from how they're listed at requests of sponsors that we received. We'll be taking up first LD 1677, sponsored by Speaker Fecteau. Second bill we'll be taking up is LD 1423, followed by 1382, 1524, and finishing out with LD 1638. So with that, we'll open up the public hearing on LD 1677. This is an act to support frontline workers by adding a temporary tax bracket affecting high earners, sponsored by Speaker Fecteau. We'll hear from Speaker Fecteau to introduce this bill, and then following him, we'll hear from those speaking in favor, beginning with Adam Good. So is Speaker Fecteau with us?
I'm looking for him in our attendees list.
Okay.
Oh, I see him. All right, there we go.
Welcome, Speaker Fecteau.
Good morning, Senator Chipman, Representative Terry, honorable members of the Joint Standing Committee on Taxation. I am Ryan Fecteau, and I represent part of my hometown of Biddeford, and I also have the distinct honor of serving as Speaker of the Main House. I'm here today to present LD 1677, an act to support frontline workers by adding a temporary tax bracket affecting high earners. This bill would invest in our frontline workers who continued serving our state throughout this pandemic. This bill would help workers who are not able to stay home during the pandemic, such as grocery store workers, retail workers, nurses, bus drivers, and janitors, recognizing the incredible stress and sacrifice of frontline workers that contributed to Maine's economic and public health recovery. During this pandemic, frontline workers, many with low incomes, pitched in by caring for children, stocking grocery store shelves, working as first responders, keeping our restaurants and hotels open, and providing in-home care to seniors and persons with disabilities, to name just a few. In times of crisis, these workers stepped up. Those with the greatest means, the high-income earners and large corporations, we must ask them to step up too. Stepping up should mean paying their fair share so we can address the needs of the people experiencing real hardships. This proposal makes sure we don't leave those frontline families behind in our state's recovery. This bill requires the Department of Labor to create the Frontline Worker Support Program to provide grants to frontline workers, those workers who ensured the continuity of critical functions, including healthcare workers, firefighters, law enforcement officers, corrections officers, food and agricultural workers, United States Postal Service workers, manufacturing workers, grocery store workers, public transit workers, and persons who work in the educational sector, such as teachers, janitors, support staff, and childcare workers. The question of how to provide this support for our frontline workers should not be controversial. Most Mainers already know the tax code unfairly favors the wealthy and large corporations. As a result of lobbying from special interests, loopholes, and other changes that tilted the system in their favor, which have taken root in our tax code. We saw the impact of those inequities this year as the highest earners had a record year despite a global pandemic. Our current tax code puts a single filer earning $51,000 in the same bracket as a single filer earning $500,000 or even more. People who earn $51,000 probably haven't felt like a millionaire as they try to make ends meet and provide for their families. Yet our tax code treats them as if they are. Building a strong economy for all requires not only the contributions of frontline workers, their hours, hard work, and labor, but it also requires contributions from the top. The temporary tax increase proposed by this bill would impact only the top 1% in our state. The grants dispersed by the treasurer of the state based on the eligibility criteria developed by the Department of Labor would be funded by a temporary 2-year surcharge on the wealthiest Mainers of 3% on adjusted gross income in excess of $500,000 for joint filers, $200,000 for single filers, or $350,000 for heads of households. Maine is at a crossroads. We can build strong communities, good schools, and a good quality of life through a strong, fair economy where everyone has a chance to succeed, not just those with disadvantage. This bill shows our commitment to working families. While I'm thankful for the federal pandemic relief funds coming into the state, we here in Maine also get to make choices about how recovery should work. We know who needs the help getting back on track. Maine's recovery requires equity, and our efforts to lift up the countless families that struggled while working in sectors such as manufacturing, seafood processing, retail, and farming, they kept Maine moving forward. And that's why I hope you'll move this policy forward with a favorable ought to pass vote. Thank you, and I'm happy to answer any questions.
Excellent. Thank you, Speaker Fecteau. We have questions from members of the committee. I believe Representative Kryzak first, followed by Representative Gramlich.
Thank you, Mr. Chair. Good morning, Representative Fecteau. Thank you for being here today.
Good morning.
I just have a question. It's my understanding that under the federal funds that are going to the communities, they're allowed to pay up to $13 an hour for everybody that worked during the pandemic for a total of $25,000 each. Why would we need to give more than that to those folks when it's already been taken care of?
I'm not aware that the American Rescue Plan funds have been allocated or dedicated in such a way that there will be a direct payment to frontline workers who were working over the past year. So I'm not familiar with that particular provision. Certainly happy to explore what it is that you're talking about, and I obviously would rely on your analyst and those who have a better understanding of the many layers of the American Rescue Plan and what's included.
Yeah, there's things you can do and things you can't. One of them is you can pay anybody that worked during the pandemic can be paid up to an extra $13 an hour over what the communities paid them for a total of $25,000 each. So that's already in the process. So I guess I don't understand why we would need to tax people to give them even more than that. So yeah, I look forward to hearing more about that for the work session. Thank you.
Representative Youngman.
Thank you, Senator Chipman. Good morning, Speaker Facto. How lovely to see you in the Taxation Committee this morning.
Nice to be here. Thanks for having me.
I have a couple of questions. In the bill, I know there is some specificity around particular workers that are considered frontline or essential. And as we've seen over the past 17, 16 months, this pandemic has taken quite a toll on folks in need of mental health services. And I know the bill said without limitation. So I'm curious, I have two questions related. One is, I'm going to continue to advocate for my profession. So I'm curious if this includes folks that have been providing very much needed mental health services, such as social workers, who have been struggling immensely and have had to work throughout the pandemic. And is it specified by profession or rather by income?
Yeah, so in terms of, I should say some earlier iterations of this bill contemplated listing out all of the various professions that'd be covered by this. That turned into quite a significant undertaking, and I think what we ended up deciding on was allowing the Department of Labor to contemplate who would be eligible for these grants. And so the bill does not specify, every single profession in a laundry list. There are other states that have done enacted similar programs. Vermont had a program for providing one-time funds to frontline workers. I believe early on in the pandemic, Mississippi also had a program that provided one-time funds to frontline workers. And so I think what I hope is that the Department of Labor will work with the information that they can gather from what other states have done already, and perhaps mirror some of the eligibility based on what we've seen across the country. And I think taking into account, a person's income is probably important as well. Obviously, the goal is to make sure that we're providing frontline workers with a substantial one-time direct payment, something that would have a difference in their lives. I think the challenge is making sure that we're not including so many people that the eligibility becomes so expansive that the one-time direct payment is not a tangible is not a tangible benefit in someone's life. I think there's a difference between having so many people who are eligible that the benefit is $50 versus having it be $500, $600, or $700 or something like that, where someone can actually, use that money to actually have, a substantial impact in their lives, whether that's paying a bill that they're behind on, or being able to catch up on bills, or whatever it is, the repair that they've been putting off in their home, whatever that might look like for them. But I think, making sure that this payment is substantial is really important to me. And I think that's why we decided that it would be important for the Department of Labor to sort of set the standards rather than prescribing them in the bill.
Thank you, Mr. Speaker. I look forward to pulling up our sleeves and doing some work on this in the work session. Thank you.
Yeah.
Any additional questions from members of the committee? Seeing none, thank you, Speaker Fecto, for presenting.
Thank
this
you.
to us. It's
Good
great to see you
morning.
today. We'll now be moving to testimony from those in support of the bill. And just so folks know, we're going to be keeping a 3-minute limit as a standard for most of the committees when there's a lot of people signed up to speak. And certainly there is today on several of our bills, people signed up to speak in numbers. So I want to ask folks to please keep your comments to 3 minutes. Once we approach 3 minutes, if you're still speaking, we'll ask for a final thought. And by that, we mean a sentence or two to conclude your testimony. So your help on that's much appreciated. So we'll now hear from Adam Good to speak in support, followed by Ann Danforth. Welcome, Mr. Good.
Good morning, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Adam Good. I'm the Legislative and Political Director for the Maine AFL-CIO. We testify in support of LD 1677. In the future, I know I have a debt of treats or tributes to bring to this committee, which I will save for an appropriate time. I would love to read all my testimony. I doubt I'll get it out in 3 minutes. I did want to start by attempting to answer Representative Kryzak's question. Yes, there are, it is an option to use federal money for hazard pay. And in the past iterations of coronavirus aid, there have been options to use money for hero pay, so to speak, but it's certainly not required that that money will be used for hazard pay. And in our experience, there just have not been a lot of states or municipalities that have gone that route. So we think this is a great idea. And we think that it is definitely no guarantee that any of the federal money that's being used coming into the state will absolutely go to frontline workers. So, and that being said, I think everybody knows that the COVID-19 pandemic has caused widespread harm to lots of people, including loss of life and health and deep impacts. Despite there being universal difficulties, the opportunity to avoid the virus and to avoid bringing it home to somebody's family is not a privilege that all workers enjoy. If you're an essential worker, a low-income worker, a Black or brown worker, you work in the service sector, you're far less likely to be able to work from home and to avoid the virus than other workers. As you all know, the bill seeks to provide two things that essential workers need the most. One is appropriate compensation for the sacrifices they've made, and policies that close the staggering wealth and income inequality gap. The establishment of grants outlined in this process will help lots of folks that are union members and non-union members, will help nursing home workers, firefighters, postal workers. These are largely folks that provided services throughout the COVID-19 pandemic to help people of all backgrounds. And we think that they're a higher priority than protecting the wealth of the elite. Before the pandemic, more than 1 out of every 6 Maine adults couldn't afford a $400 emergency. A lot of these essential workers rely on schools that have been shortchanged over the last 10 years. A lot of them either work in or provide public services that have missed out on support in that time frame. We think that the one way that the wealthy can pitch in is through a temporary 2-year surcharge of 3% on annual Maine adjusted gross income in excess of $200,000 for single filers and $500,000 for joint filers. We think it not only would fund grants that help these workers, but it would fix existing problems in our tax code and pay for grants to help essential workers. As the speaker said, it is preposterous that working class Mainers have rolled up their sleeves. They've helped everyone weather the pandemic, and wealthiest households have largely made no sacrifice in their income and are far less likely to be exposed to COVID-19 in the workplace. We think that's a kind of a two-headed monster. You know, you get to stay home, you get to see your investments increase, you get to make more and more money. You never have to worry in the same way that you will get sick based on your workplace, that you'll never bring it home to a family member based on your workplace. And we have a tax code that is lopsided, that protects the wealth of folks that have this much money to begin with. So someday we'll see another pandemic. We think it'd be great if in the future, when there is another pandemic, we can look back on this time as a moment when we conquered a pandemic, recognize the sacrifices of essential workers and reduced income inequality. And for those reasons, we ask you to support this bill.
Great. Thank you, Mr. Good. Any questions from members of the committee? Representative Gramlich.
Thank you, Senator. Thank you, Mr. Good. It's great to see you in our committee. We will be in Augusta next week at the Civic Center, so you certainly can take advantage of that opportunity if you so desire. But I just want to just make sure that I'm clear in that, and that the committee and folks listening is clear. As I've read the bill and as the speaker identified, and I think I heard you identify, this is a temporary surcharge that would be appropriated onto higher income wage earners. I want to make sure that I'm correct in my understanding of that in terms of moving forward. If this is enacted, it will basically sunset and no longer be effective. Am I getting that correctly?
Yeah, that's how the bill is. That's how the bill is written. Certainly, we hope that we're not in a scenario where there's hero pay and hazard pay that goes on into perpetuity for essential workers. We hope that things will be normal again. And yeah, so that is the intent of the bill. And I think really, like, everybody, I think, agrees that there should be something more than just a sign on the side of the road that says we appreciate the work that you do. That there is no amount of compensation that makes up for getting sick at work, getting sick and dying because of something you did for work. But I really think that the other kind of important point of this bill is that we shouldn't provide hero pay, but have it come out of some type of regressive tax increase. It wouldn't make sense to raise the tobacco tax and use that to fund hero pay. Like, there needs to be hero pay and there needs to be some type of hazard pay, but it shouldn't come from the same people that we're giving the essential funding to. So that's an important aspect of this bill.
Thank you.
Question from Representative Bickford.
Thank you, Mr. Chair. Good morning, Mr. Good. It's good to see you.
Good to see you.
My question is, can you describe hero for me? Who is the hero?
Yeah, it's a great question. As the bill is written, it covers folks who work in manufacturing, folks who drive buses, folks who are postal workers. The definition is a hard part of defining who is an essential worker. That's a tricky thing to navigate throughout the labor movement. I think that the professions where people were expected to go to work during the pandemic and they could not work from home and they had to go and it wasn't an option for them, that feels like the important delineation. I think the bill tasks the Department of Labor for figuring out who those people are. We don't deal with Postal Service a lot in the state legislature, but that is something that I think of regularly. There were at least 60 postal workers that died from COVID, I think at this time last year, and they were largely helping people who did not want to go into stores get the things they want and need. And I think that really illustrates what was happening. I was working from home, still making my salary, still getting by. And if I wanted to buy a birthday present for a family member, I didn't have to go to a store. I could count on a postal worker who was potentially being exposed to this to deliver a package that I ordered online. And I think that's the delineation, is there were certain people that were doing things every single day in order to help another class of people live a much more comfortable life.
So convenience stores, supermarkets, department stores, all those essential workers?
Yeah, and the bill covers grocery store workers, food and commercial workers. If you were at Hannaford bagging groceries during all this, I think that counts. Yeah. And how much, so the bill is also set up where how much people get depends on, I believe, how much will be raised from the surcharge. So if, for example, that all of a sudden there were no people who made over $200,000 adjusted gross income, there wouldn't be that much money to disperse to people. But as things stand right now, I think this would be a pretty helpful disbursement based on the amount raised.
Okay, and finally, I just want to ask you, you were speaking of the more affluent, saying that they didn't deal with customers face to face. Do you have any data that supports that claim, or is that just anecdotal?
Well, I think the data is in the revenue forecast and the revenue from the state. I mean, this time last year, we all thought that there would be massive revenue losses. And what we've seen are that revenue has gone up. It's the opposite type of state revenue response that we expected from all this. And I just can't imagine that people who are making $200,000 or $900,000 a year, $600,000 a year, are going face to face in terms of their workplaces during the pandemic. I really doubt that. I'm sure I can find information that says that. I doubt that that's the case, though. I think that it's largely very white collar, very high professionalized workers. Yeah, maybe there's some doctors or some medical professionals that were performing certain types of medical procedures that would fall into that category, but I can't imagine there's that many.
Okay, and the reason I ask is because it's really easy for us. I mean, you and I don't make that kind of money. It's really easy for us to say they can pay because it's not us. And I could never support a bill that taxes, a specific group unfairly. Thank you.
Thank you for that question, Representative Bickford. We have a question from Representative Matlock.
Yes, thank you, Mr. Chair. Good morning, Mr. Good. Welcome back.
Hi.
I was wondering if you, by any chance, have bumped into a think tank at Harvard University called Opportunity Insights. About 6 months ago or so, they did come out with a study that speaks exactly to this one. So I was wondering if you might have heard of them. It's run by Raj Chetty and a couple of other economists, and it might have some information that you might be looking for.
I've not heard from that. I always look for things that I can use as citations in my testimony. So it's good to know.
Additional questions to members of the committee? Seeing none, thank you for being with us, Mr. Good. Good to see you.
Enjoy your day.
We'll now hear from Ann Danforth, and then if we can promote Al Moots. I'm having a hard time pronouncing that. From the New Mainers Alliance, Mr. Abdurrahim. And then Gregory Olson and following him. Welcome, Ms. Danforth.
Thank you. Good morning, Senator Chipman, Representative Terry, and members of the Committee on Taxation. My name is Ann Danforth, and I'm a policy advocate at Maine Equal Justice. We are a civil legal services organization working with and for people with low income, seeking solutions to poverty through policy, education, and legal representation. Thanks for the opportunity to testify in support of LD 1677. As I've noted in this committee before, COVID-19 has made it really clear that our economy and our governmental systems are failing many low-income Mainers, particularly those from Black, Indigenous, and communities of color. Even before the pandemic, many Mainers were struggling to meet their most basic needs, and COVID-19 has made these hardships even more acute. Now, nearly 1 in 3 Mainers report having trouble covering usual household expenses. Many of the people who have been providing essential services during the pandemic are working low-paying jobs and have little option to work remotely. According to a MESIP analysis, frontline workers are often paid less than other workers, and frontline workers are also 31% more likely to be Black workers compared to the full workforce. And Asian Pacific Islanders and immigrant workers are also overrepresented in frontline industries. As we look to rebuild our economy, we have the opportunity to create a more equitable future for the children and families in our state. And an important first step we can take is to adopt a tax code that increases taxes on the wealthiest, many of whom have become even wealthier during the pandemic, while putting those resources into supporting those who have been on the front lines during the pandemic, and many of whom are low income. In conclusion, Maine Equal Justice supports this bill because of the opportunity these changes to our income tax code afford to make Maine's tax laws more equitable and invest that money in supporting frontline workers who have been providing essential services during the pandemic and who are disproportionately low income. Thank you for the opportunity to express support for this bill, and I'm happy to answer any questions I'm able to.
Great, thank you, Ms. Danforth. Is there any questions? Question from Representative Bickford.
Thank you, Mr. Chair. Good morning, Ms. Danforth. Can you please provide data that supports your claims that the lower income brackets are primarily people of color? I hear that all the time on this committee, and I need to see data that supports that. Thank you.
Sure, I would be happy to get that, and we'll make sure you all have it for the work session.
And also, you must have access to the rest of New England. Can you tell me what other New England state is doing a similar program?
Sure, I can look into that and we'll get you all that.
Okay. The reason I'm asking is, again, as I said yesterday, Massachusetts' top tax rate is 5%. Our lowest tax rate is above that. Thank you.
Yeah, question, Mr. Representative Bickford. Question from Representative Collins.
Yes, thank you, Ms. Danforth, for being here. And I'll also look to see what, let me know what data you can find about the percentage of different workers, because I think I might have some stuff too. And I can't, by my own personal experiences, make a scientific statement. So I'll get the data with you to find that. But I know in my district, many of the workers are refugees and immigrants, and I know many of them that are working, and I see them when I go to the store, when I go to the restaurants, when I go to the coffee shops. So there is a high percentage of those Black people of color that are working in restaurants, specifically in my district. Many Somalians and people from Western Africa that I know personally, that during the whole pandemic were working one, if not more, jobs in many of these industries. So I'll as well try to find some information to supplement what you have. Thank you.
That's great. And I do have one citation in my testimony, but we'll be sure to get that as well as others to you all.
Additional questions from members of the committee. Representative Bickford.
Thank you, Mr. Chair. Ms. Danforth, could you also provide data for the higher income earners? What percentage of people of color are in the higher pay? And the reason I'm asking is, again, as Mr. Collins, Representative Collins said, he sees a lot of people of color in lower paying jobs. I see a lot of people of color in hospitals making extremely good money. So I'd like to have both sides of that equation. Thank you.
Certainly.
Additional questions from members of the committee? Seeing none, thank you for being with us, Ms. Danforth. Good to see you. It looks like Almatz Abdel Rahim is not with us to speak. So if he does come into the waiting room, we can bring him in. But for now, we're going to hear from Gregory Olson, followed by James Durkin, if we can promote James Durkin to speak next. Welcome, Mr. Olson.
Thank you for having me, Senator. Senator Chipman, Representative Terry, and honorable members of the Joint Standing Committee on Taxation. My name is Gregory Olson, and I'm the Deputy Treasurer of the state, here today on behalf of Treasurer Henry Beck to testify in support of LD 1677, an act to support frontline workers by adding a temporary tax bracket affecting high earners. 2020 was a unique year. I don't think I need to explain that much to anybody here, and one that highlighted the vital role that frontline workers perform in our communities. While many workers in Maine and across the country were able to relocate their place of employment to their homes, healthcare workers, firefighters, law enforcement officers, food and agricultural workers, postal, manufacturing, grocery store workers, and others were not. These workers put themselves and their families at considerable risk, and we owe them our gratitude. The state treasurer supports efforts to compensate these workers for their sacrifice, and we will do our part to implement this program. In 2020, as part of the Act to return funds to Maine property taxpayers, our office distributed 305,000 payments to property taxpayers across Maine, totaling over $30 million. This experience makes us confident that we'll be able to comply with the outlines of this program and distribute the grants as determined by the Department of Labor. Our office understands that we bear responsibility for promoting this program to Maine workers. We can do this within existing resources. However, we would likely reach more eligible participants if the committee recommended an appropriation to allow for further advertising. Thank you again for the opportunity to testify in support of this bill. We look forward to working with the committee and hope to answer any questions or concerns that you may have.
Great, thank you, Mr. Olson. Question from Representative. Just wanted to remind committee members, that obviously people have questions, but if you can try to keep our questions to strictly questions as opposed to commentary or discussion, which we'll obviously have plenty of time at the work session for. And I only say that because we've got literally like 20 people signed to speak on the next bill, and we've got a lot of people still left on this bill. So we just to make the best use of our time. If we can just strictly ask questions, that would be great. And I think you had your hand up, Representative Bickford. Do you still have a question?
Yes. Thank you, Mr. Olson. Wouldn't this be similar to if you owned a house in a community and it was valued at $200,000 and you petitioned City Hall and the City Council to increase property tax mill rates only on homes valued at $250,000 or more? It wouldn't affect you, so you would be all in favor of it, and everybody that owned a $200,000 house would be in favor of it. But it would go against everybody that owned a house over $250,000. Explain why this isn't like that.
My understanding is that we have a progressive income tax that allows for that type of taxation, but I believe property tax cannot be done in that fashion.
How many states in New England do this? We compete with other states, is that correct?
I'll defer to the policymakers on that, sir.
Great. Thank you for that question, Representative Bickford. Representative Kryzak.
Thank you, Mr. Chair. Thank you, Mr. Olson. Just a quick question. In the discussions of how we're going to spend the 1.1 billion, has it ever been discussed about doing this with that money rather than raising taxes to do it?
I'm not familiar with those discussions, but would defer to others. Our office stands ready to distribute funds to people who are determined eligible, and defer again to the policymakers on the funding source for that.
Thank you.
Additional questions from members of the committee? Seeing none, thank you for being with us, Mr. Olson. Good to see you. We'll now hear from James Durkin, followed by Jeff McCabe. Welcome, Mr. Durkin.
Thank you, Mr. Chairman. Members of the committee, for the record, Jim Durkin, Legislative Director for AFSCME Council 93. We proudly represent more than 2,600 hardworking state, county, and municipal employees here in Maine, and I'm here today on their behalf to not only express our strong support for the legislation, but also to thank Speaker Fektow for remembering these frontline workers and making an effort to recognize and reward their selfless contributions over the past year. I'm going to be brief, but I want to say in March of 2020, I was standing in the Maine State House when I received a call that we'd be shutting down our offices in response to the pandemic. And as I was making the nearly 4-hour drive back from Augusta to my home in Lowell, Massachusetts, I remember worrying about the people we represent. And I remember thinking how fortunate I was to have a job that I'd be able to do from my home. Like many people over the next several months, I'd have the ability to shelter safely in the confines of my home, to insulate myself from this deadly virus, and still be able to do my job and support my family. The men and women we represent in Maine and the thousands of other frontline workers did not have that luxury. They were needed on the job. They were needed to provide skilled, compassionate care in our state mental health facilities, needed to guard dangerous criminals in our correctional institutions, and needed to maintain vital public infrastructure, clean water, snow removal, road maintenance, and much more in our municipalities. They left their homes every day. They did their jobs with minimal or no access to adequate PPE. We have to remember that. And they returned home wondering if they had contracted a deadly virus in the course of their day. And even more frightening, wondering if they had brought that virus home to the people that they love. Now, it's important to note that for a limited time, we were able to secure some short-term financial recognition, or hazard pay, as they call it, for some of these brave men and women in our 4-state region. But it didn't last as long as it should, and it didn't cover everyone who should be covered. So as such, we applaud this legislation, and we support any effort, any creative idea like this one, to recognize and reward these workers for their sacrifices, their bravery, and their dedication. I thank you for your consideration, and I'll do my best to answer any questions you may have.
Thank you, Mr. Durkin. Good to see you. Questions from members of the committee? Seeing none, thank you for being with us this morning. We'll now hear from Jeff McCabe, followed by Michael Bailey. Welcome, Mr. McCabe.
Good morning, Senator Chipman, Representative Terry, members of the Committee on Taxation. I am Jeff McCabe, the Director of Politics and Legislation for Maine Service Employees Association. We are a labor union representing over 13,000 workers and retirees, mainly in the public sector statewide. We're here today in strong support of LD 1677. And first, I wanted to say that the irony and privilege of being able to testify on this bill remotely needs to be pointed out. Throughout this last year, we have seen time and time again just how essential frontline workers are. They've kept us safe. They've cared for our loved ones when they've fallen ill. They've ensured we all can eat, delivered our mail, educated our children. And these are just a few of the ways that these frontline workers have become the backbone of our society in the last year. Not only this, but these workers have risked their health, their safety, time and time again, as well as the health and safety of their families by reporting to work each day. While some frontline workers have received hazard pay, the increased risk they face, many have not. When the pandemic hit in March 2020, many state employees were transitioned to work from home in order to mitigate the risk of catching COVID-19. However, there were a number of these jobs that required employees to continue reporting to work, often in a public-facing job. Many of those workers are eligible for hazard pay throughout 2020, including in corrections, caseworkers, those folks in the state hospitals, among others. On December 23rd, 2020, we received word that those various hazard pay agreements of our members in state government would be terminated. Despite our state being in the depths of one of the largest COVID-19 surges of the pandemic at that time, these employees deserve to be compensated for the additional risk. Hazard pay agreements only covered a small portion of our members who continued this day in, day out, and continued to risk being sick. Other union siblings and essential workers have received praise and thanks, but no additional compensation for their ongoing risk. Frontline Worker Support Program would compensate frontline workers for the additional risk and danger that they have faced over the years, or over this year, I should say, even before the pandemic began. Many of these workers were underpaid and their jobs only got more challenging during the last year. I'm happy to answer some of the questions that were asked as well. I think that the question earlier in regards to municipalities is something we can provide clarity on. I also just want to flag for folks that there is no hazard pay agreements in place for the folks that are doing this front-facing work, the folks that are under sort of your direct jurisdiction as state workers, but also beyond that, there's all these private sector workers who, many of you have recognized for their efforts in the last year, but there's been no sort of effort made to compensate, to sort of address, the risks that they continue to face. And I also think for the work session, it might be helpful to look at, as we're comparing other states to Maine, we might want to look at the Vermont model for the distribution of hazard pay grants as a possible model for either the Treasurer's Office or the Department of Labor to use. But also, I would suggest, based on the comments today in questions, that we look at the average salary of Maine versus Massachusetts. We look at the population of Massachusetts and just think about that. And I did want to leave you with one other fact. We did pull some information recently, and currently within the state government, there's hundreds of state employees that make under $15 an hour, just to put things in perspective. And with that, I'm happy to take any other questions.
Great, thank you, Mr. McCabe. We have a question from Representative Terry.
Thank you, Mr. Chair, and thank you, Mr. McCabe. Can you, I heard you say that Vermont has a grant program. Are you very familiar with that program? And if so, can you just give me a quick synopsis on how that works?
Yeah, thank you, Representative, for the question. To briefly describe that program, that was a program that was available through the state for businesses to actually apply for grants to provide hazard pay, was the aspect I'm a little bit more familiar with. I know that, Vermont was very public in the way that they went about spending their federal funds that have come into the state. So I can provide that information to the analysts. They actually have sort of a dashboard on a website, and they, specifically spell out, how the funds have been spent, but also some of these programs that they've established that appear to be programs that, that may go on for a little bit, which is another component of this bill. I think that while we're hopeful things are trending in a different direction, while we all are doing our part, we're just sort of concerned, what this summer and fall could bring for these essential workers.
Thank you.
Thank
Question
you.
from Representative Gramlich.
Thank you, Senator. Thank you, Mr. McCabe. I had a call I had to take, so I was a little bit in and out, and you might have mentioned this in your testimony, but I'm curious if you did or didn't, you could elaborate about how this bill might impact overall wages, or you could speak to wages in terms of how that impedes businesses in terms of recruitment and retention of workers.
Yeah, thank you, Representative. You know, I think the information that's sort of fresh in my mind is the information from sort of the public sector right now, especially the executive branch, just because we're sort of in the throes of bargaining with the state on the next contract. So it's very interesting for those public sector workers to look at their wages already being below, you know, in some cases 15% below their private sector counterpart. But at the same time, what we're seeing across the state is, you know, wages just not being competitive in many positions. I just was watching a conversation this morning on social media of a local fire department that was having a hard time recruiting applicants to apply for a position, which was very eye-opening. Just knowing that that's a department that often doesn't have a lot of positions. It's in central Maine, but they're just not receiving applicants, and people were directly relating that to the wage aspect. You know, this is something I've seen in Department of Corrections. I saw an email that was shared with staff and Department of Corrections within the last few weeks, where folks are not being hired in at the first or second steps of the salary range, but yet they're recruiting people at step 3 just to get people in the door. You know, recruitment and retention across all industries is just an extreme challenge right now. You know, and I would directly correlate that to wage and benefits. You know, we're seeing folks within state government who can't afford healthcare coverage for their family because, you know, their wages are just stagnant, and you know, the cost of that continues to raise for them, as well as, you know, out-of-pocket expenses. So, you know, I think what we saw with the hazard pay agreements, we have some folks within the private sector as well that had hazard pay agreements that were providing direct care. You know, that was an issue of trying to keep people on the job and provide those services. The same within corrections. You know, we had people throughout the pandemic that have continued to risk being sick. You know, it's should be no surprise to folks here that, you know, corrections continues to be a place where COVID-19 outbreaks continue to occur, you know, and that's, you know, that's extremely troubling to us.
Additional question from Representative Collins.
Yes, thank you, Mr. McCabe. I want to ask you a few questions here. First, so just so we're all clear, you represent people in corrections. You represent people that work for Health and Human Services, such as caseworkers that have to go into homes. You represent people that work on the highways, the tolls and whatnot. Is there anyone who I'm missing that has to be out there working with the public on a daily basis?
Yeah, thank you for that. I think that we also have units such as, you know, the great folks at Preble Street, you know, doing just amazing work, you know, feeding, housing, providing social services to some of Maine's, you know, most vulnerable, to also, you know, doing some great work with veterans. You know, we have some other healthcare folks. There is a number of folks, and I can actually provide the list to you, Representative, and to the committee, just so that you have sort of a, you know, a clearer definition of the folks that we represent. We also represent the nonpartisan staff within the State House complex and within the legislature. We represent folks in the judicial branch. I should have my little cheat sheet here today, so I don't leave anybody out. But it's definitely a wide and sort of growing universe that we represent. We have some folks in municipal government as well, in Lewiston, in the city of Auburn. We also have folks in York County government as well. So it's quite a selection of folks that we have. We also have joined forces, I would say, during the pandemic, more so with other public sector counterparts, as well as folks, the nurses, AFT, which represents nursing home workers, just so that we can sort of collaborate and share resources, which I think has been extremely, extremely helpful. Working on issues like this, advocating with the governor's office on so many other aspects as well. So.
And also, I wanted to follow up by saying, I know that several people that work for the state in child protective services did have COVID-19 and called me multiple times asking about why aren't they getting more pay, and they were asking if I could help advocate for them to get vaccinated early. To my knowledge, any of these workers that were interacting, even contracting COVID, couldn't get the vaccine until it got to their age group. So at any point, was there any expedition of letting those people get, or did they have to wait until they got to their age group? So if someone was 28 or 32 and they got COVID right away, they probably would have had to wait to just recently to get a shot. Is that true?
Thank you for the question, Representative Collins. We did see a number of folks within DHHS that did get sick. We did have folks that had to quarantine. I believe we had folks that quarantined multiple times. And as far as the vaccinations, we did advocate, and those folks did have to wait. They did wait in line. That was the case for child protective workers, adult protective workers, and these are individuals who are going into people's homes. So, while the work of child protective and adult protective workers, may have stalled in some areas, those folks are facing an extreme backlog, because the way that folks often report those types of cases, is through individuals going to doctor's offices, individuals, who cases that might be reported through schools and other actions of reporters and mandated reporters and others. So, I think the ripple effect for just the sheer backlog of work that those folks will have will continue on into the future, and will continue to compound this issue of recruitment and retention within those caseworkers, work and workload. So I appreciate the question. There's a number of positions that we attempted to advocate for to try to identify those folks as frontline workers, also as providing services very similar to healthcare workers. So yeah, those folks did have to wait until they fell into the age bracket categories.
Additional questions from members of the committee. Representative Krasik.
Thank you, Mr. Chair. Thank you for being here today. You say you represent the folks that work at the prison and jails?
So thank you, Representative, for the question. We represent folks, I'm thinking off, just to make sure I get this correct, we represent folks that work in the state facilities, so the correctional facilities. We have folks within county government, but I think those associated with the jails would be admin folks. For York County, that would not fall under corrections officers and others. In the state prison system, we actually represent supervisors and support services. So folks that the folks outside of correctional guards, those folks are represented by AFSCME. We would have the supervisors, as well as a lot of those folks providing support staff, teachers, admin, in some cases probably food services, maintenance, and a number of positions. And I do just want to say that those folks were deemed essential, and those folks continued to report to those facilities. And I think there was a number of those folks who felt maybe those services were not necessarily essential in the beginning of the pandemic, but also all of those folks working in the facilities became such an important link in the possibility of what could happen and what did happen with outbreaks. People within the prisons got sick, and other folks had to step up. And there was folks that were, on call or expected to do things that were probably outside, their normal scope of duties. Also, these are folks that could not get all the necessary PPE at times. These were folks that were given masks and suggested that they ration those. This is for those folks literally to get notice on December 23rd, 2 days before Christmas, that because of federal funds expiring, that they would lose hazard pay on January 1st is just, something that bothers me every day.
So that was what I was looking for. So the prison guards in the state prison got hazard pay during the pandemic. Is that correct?
They did for a portion, Representative. That has since expired.
Now it's stopped. Okay.
It stopped. And I can provide that information.
This was under the previous funding that we got, but none of that money went to any of the jails. Is that correct? Or do you know? The jail guards were not giving hazard pay.
Representative, I can't speak to that. That's a great question. I can check with some of my counterparts that represent folks within the counties. That's an interesting question. I don't know if counties had to do something, to keep staff. I believe, if you look at some of the outbreaks, they were pretty large outbreaks within in county facilities. So I'd be curious to see how they kept people coming to work, and what the status of recruitment and retention is within that sort of work location. Because I just can't imagine. Some of those facilities have had multiple outbreaks.
Yeah, I'm not finished, if I may.
Go ahead.
Thank you. It's also my understanding that during this time when they made the state prison guards, gave them the hazard pay, that they also were holding any prisoners that were state prisoners that were being rearrested in the county jails to quarantine them for 14 days before they could come to the state prison. Are you familiar with that?
Representative, I am a little bit familiar with attempts to limit the I would say transportation or movement of folks within the correctional, system. And I think that both the county and the state, was making very hard decisions working with the CDC because, just trying to not move people around within the correctional facilities is something that I feel like it was one of those situations, sort of building the plane as you're flying it, because, as these outbreaks were occurring, trying to figure out how, it was getting into facilities was sort of fascinating to hear, folks from corrections talk about that, or as they tried to identify that. Also, if you go on to the Department of Corrections website, you'll see they have a tracker. It was originally a daily, updated daily. It was a COVID tracker, and it's a dashboard. And I think that you might find that eye-opening as far as the number of tests given. But I definitely would like to talk to you more about this, because this is one situation. We could find ourselves in the future, dealing with another pandemic here in the state of Maine. And I just feel like we need all the tools that we can possibly think of to make sure that, we have adequate staffing, we're meeting basic needs, and also we can recruit and retain qualified people.
Thank you.
Thank you.
Question from Representative Gramlich.
Thank you, Senator Chipman. Representative Kryzak just, thank you, prompted a question. I'm curious, and maybe you mentioned it, Mr. McCabe. When you were talking earlier about DHHS employees, particularly those who are going into homes, Child Protective Services, Adult Protective Services, those state employees who are really on the front lines protecting our most vulnerable, our children and our older adults in Maine, who, thank God they're there, quite frankly. And I'm a former DHHS employee, so I'm a little bit biased, but do you know whether or not, Mr. McCabe, those folks received any hazard pay?
Representative, thank you for the question. Yes, they did. And I can send you, and we have on our MSCA website, the hazard pay agreements that we were able to get. Those hazard pay agreements were, in some cases, tied to the state of emergency. It was defined as the hazard pay would continue during the state of emergency. Others were tied directly to that last round of funding for federal funds. So like a bill like this is a great example because the money ran out and there wasn't a mechanism to pay for it. So we look at this and the short-term solution as something that, could have continued to provide much needed and necessary hazard pay, from January until this pandemic is deemed under control. I think there's a lot of folks that just feel like, things are looking better, but our numbers in the state of Maine, the outbreaks that we're seeing, we're also seeing a number of outbreaks within Department of Transportation. Those are situations where the folks that work at the DOT camps around the state, those women and men, they work, they interact in situations where social distancing may be hard. They're riding in vehicles together. The folks that work on the ferries, that's another example of where folks are working in, confined space. They're also dealing with folks from all over the country in some cases, having sort of face-to-face contact, coming into interaction with people that are in vehicles. So it goes beyond just sort of, what we necessarily think of as frontline workers. And while I'm fortunate to work for these people, I also think of those heroes that work frontline in retail and elsewhere. So.
Mr. Chair.
Yeah, go ahead.
Thank you. For the work session, if we're able to get some sort of a breakdown of what those figures look like in terms of hazard pay, particularly for your shop, Mr. McCabe, in terms of state employees, I think that would be really helpful to do, and putting this on Julie a little bit, but an analysis of what folks had been receiving in terms of what this might look like moving forward if this bill were to be enacted, to see what folks could potentially receive in terms of hazard pay. And as a side note, to your point on retail workers, you may not be able to be best to answer this, but do we know what did those workers, did the person that the 60-year-old that's at the checkout lane bagging my food at Hannaford, did they get hazard pay?
Yeah, thank you, Representative. I know that there are some businesses that chose to provide hazard pay to their workers. I think that, there was a point made by a previous person earlier today that, many of these businesses have seen, just increased revenue. This pandemic, there's individuals and businesses who've done extremely well. And then there's folks who are frontline workers who, have not and just been burdened with, more work, dealing with things at home. So we can provide that information. I will say in full disclosure, we have grievances due to those expirations of those hazard pay agreements and just the abrupt ending of those. So, we are pursuing sort of a bargaining, as well as a grievance process around those agreements. But I would happily provide information to the committee as far as the amounts that those hazard pay agreements were for individuals, as well as the language of those hazard pay agreements, if it's helpful.
Appreciate it. Thank you very much.
Yeah. Questions from Representative Terry.
I don't want to drag out a public hearing longer than it needs to, but I have a child that is one of those retail workers. They had hazard pay for, I want to say 3 months, and then it was taken away. And of course, the pandemic got considerably worse well after that, so we can have that discussion in the work session.
Great. Any additional questions from members of the committee? Seeing none, thank you for being with us, Mr. McCabe. We'll now hear from Michael Bailey, followed by Mariah Gear. And just so folks know, just to give a check-in of where we are, we've got 6 more people left to speak on this bill. And then on the next bill, there are 22 people signed up to speak, followed by hearing on 3 more bills after that. Welcome, Mr. Bailey.
Thank you. Senator Chipman, Representative Terry, and honorable members of the Joint Standing Committee on Taxation. My name is Michael Bailey. I'm a resident of Orono, and I'm here today to testify in favor of LD 1677 and LD 1524. Both LDs address the crisis of income inequality and support the common Mainers who have kept the state afloat not only during the pandemic, but always. That is working class Mainers. The nurses who keep us safe, the teachers who educate our children, the agricultural workers who keep us fed, the first responders who keep us safe, the postal workers delivering increased volume to keep us all connected, and the service workers who risk their health to serve you. The pandemic has not created new problems in our country or here in Maine. It has just exposed the old ones. It has exposed how little the society values service work, care work, people who work. Essential workers, the people who kept the state, country, and world running, were the first to risk their well-being for long hours, poor pay, and hazardous conditions. It has also exposed the crisis of income inequality. While we have all struggled to pay our bills, to feed our families, the super wealthy have gotten richer. It is long past due that we ask them to pay their fair share. It is not only moral, but necessary for us to build a better, more sustainable state. Like thousands of my peers, I grew up poor in a state with no jobs. Sometimes we had no heat, and sometimes we had no food. This is a policy failure. It was not a personal failure of the single mother who raised me. We can build a better Maine if you have the courage to tax the rich. An income tax and estate tax are efficient, fair means of raising the revenue we need to fund the infrastructure and social services that this state needs, and to recognize the invaluable contributions of frontline workers during the pandemic. If Maine is going to recover not only from this pandemic, but also the past 40 or so years of deindustrialization and immiseration, it must invest in infrastructure and the people who keep this state running. This proposed legislation would do that efficiently and fairly. LD 1677 in particular would recognize the invaluable service of frontline workers. Thank you.
Great, thank you, Mr. Bailey. Question from Representative Bickford.
Thank you, Mr. Chair. Good morning, Mr. Bailey. Would this 3% surcharge, would this cost you any money?
It would not.
Okay, thank you.
Additional questions from members of the committee? Seeing none, thank you for being with us, Mr. Bailey. We'll now hear from Mariah Geer, followed by Sarah Austin.
Good morning, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Mariah Geer, and I sit on the Policy Committee of the National Association of Social Workers Maine chapter. I'm here today representing Mainers for Tax Fairness. MTF is a coalition of 22 organizations, including my own, that represents teachers, healthcare providers, policy experts, workers, small business owners, advocates for children and families with low incomes, and other groups fighting to improve tax fairness and build a stronger, more inclusive economy for all Mainers. The pandemic has been unprecedented public health and economic crisis. All along, frontline workers have been there to keep our society running. They have kept grocery stores stocked, kept our kids' education on track, and worked often harrowing shifts, saving lives in our healthcare centers and hospitals. We should do what we can to recognize their contributions during this crisis, especially because in many cases, frontline workers are the very same Mainers who have been held back by growing economic inequality. While more and more of our society's wealth accumulated at the top, many of these workers already faced stagnant wages, ever-increasing childcare costs, and inadequate benefits, and volatile schedules. The pandemic affected every single Mainer, regardless of where they come from or how big their bank account is. And in a crisis, all of us are asked to contribute. For teachers, that meant finding new and creative ways to carry the torch of education. For grocery workers, it meant going to work every day to ensure all of us could be fed, interacting with hundreds of people, even when they knew it was exactly that exposure that put people at risk. For nurses and care workers, it meant taking care of our health and well-being and doing everything they could to stem the tide of illness and death. For those with the highest income, most of whom saw their wealth grow during this pandemic, as we've already heard today, it should mean chipping in more in taxes. The income tax can be one of the fairest types of taxes. Unfortunately, after years of policy changes that primarily benefit those at the top, Maine's income tax today treats those with the highest incomes the same way it treats middle-class families. The top income tax rate is the same, whether you're a special education teacher or a millionaire CEO. The choice to keep taxes low on the highest earners is the reason that, according to the Institute on Taxation and Economic Policy, those at the top in our state pay a lower overall tax rate than middle-class Mainers. As we've said in testimony before to your committee earlier this year, Mainers for Tax Fairness supports efforts to fix our income tax. Asking the wealthiest to chip in a little more would improve tax fairness in our tax code and raise revenue that can be invested directly into Maine communities. This bill would use that revenue from a temporary income tax increase on the highest earners to fund what is essentially hazard payments to the frontline workers who've put themselves and their families in harm's way for more than a year. It would ask just 3 cents on every dollar earned above $200,000 to help recognize and reward the hardworking men and women who helped all of us survive in this unprecedented crisis. LD 1677 shows that we can do better. By asking those at the top to contribute their fair share, we can move past good enough budgets and enact policies that help the people who build our economy and our prosperity from the bottom up. We urge you to support this bill. Thank you, and I'm happy to answer any questions.
Questions from members of the committee. Representative Bickford.
Thank you, Mr. Chair, and good morning.
Good morning.
Will you be affected by this 3%? Will you be paying 3% on anything?
Excuse me,
No,
Mr.
sir, I will not.
Bickford, I'm gonna insert myself here. Asking personal questions of that nature are inappropriate questions for.
No, this is
if you want to
very
ask about, if you want to ask
tact,
about policy,
Mr.
but
Chair.
asking
I'm going to
someone-
ask everyone this question.
Well,
I
I'm not
want to
gonna
know
let-
why. I want to know why everybody that makes less than $200,000 thinks it's okay to charge everybody that makes over $200,000. It is a fair question. I'm going to continue to ask it.
Asking a question about what, generally speaking, people. that
I'm not
make-
asking their income.
more
I'm
or less.
asking if they will pay that 3%.
Yeah, but asking someone.
I'm
a
going to
personal
continue to
question-
ask it.
Well, that's inappropriate. Asking a
It's
question,
not.
like a certain group of people will pay versus another is fine, but asking a personal question of a person who's here to testify.
It's
whether
not
they-
inappropriate,
Well,
Mr.
it's
Chair.
inappropriate. It is. And I'll ask Representative Terry if she wants to weigh in on that. But I think that asking someone a personal question of that nature is not appropriate for committee. If you want to ask about policy or whether one group of people should pay more or less than another, that's fine. But asking an individual person a personal question of that nature is inappropriate, I would say.
It's because everybody that makes over $200,000 is not going to testify in support. That's why you won't let me ask it.
Representative Bickford, we have had plenty of conversations with people with better means that have testified like this on multiple occasions. It is not appropriate to ask someone a personal question like that.
Additional questions from members of the committee? Seeing none, thank you for being with us to testify, Ms. Gear. Appreciate your testimony. We'll now hear from Sarah Austin, and then following her, we'll hear from Adam Zuckerman if he's in the waiting room. Welcome, Ms. Austin.
Good morning. Good morning, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Sarah Austin. I am a tax and budget policy analyst at the Maine Center for Economic Policy. And despite my income, I do hope I'm allowed to have a position on this bill. So I am here to testify in favor of 1677. This bill would instate a temporary surcharge on high-income households to deliver hazard pay to frontline workers who have continued working through a dangerous and unprecedented pandemic, and many of them for low wages. This bill would apply a 3% tax on single income over $200,000 a year, head of household income over $350,000, and joint married income over $500,000, and return the revenue through direct payments to frontline workers. The tax would be in place for tax year 2021 and 2022. The 2021 tax would deliver a payment to workers who served in frontline jobs in 2020, and the following year's tax would deliver a payment to frontline workers who served in industries this year. This tax would raise roughly $96 million a year and send out payments to frontline workers. Wealthy households have remained economically stable or done better throughout the pandemic. High-income workers in Maine experienced relatively few job losses, and their job markets are now doing better than they were before the pandemic started. And yes, there is data to back that up that's been cited. Wealthy households have also benefited from huge gains in stock markets in 2020 and are most likely to have been able to work safely from home in the pandemic. This bill would ask a little more of the top 1% of Maine households to create a fund to give back to workers who had to show up for work despite dangerous conditions and too often for low wages. Even in the earliest days of the pandemic, when we knew so little about the virus and which transmission prevention strategies would be most effective, some industries never shut down or went remote. Grocery stores, gas stations, hospitals, and many food and manufacturing workers stayed on the job so that others could stay safe in their homes. Teachers and childcare workers have upended their systems and schedules to deliver quality care and education for our children, many of them having at least a portion of their jobs working in person with the children that they serve, many of which cannot wear face masks. And this bill would recognize the service of these workers in the face of great uncertainty and elevated risk of deadly illness. Many of these industries are overly represented by women, many of whom had to juggle harder to find childcare and more expensive to find childcare. And if states, including Vermont, Pennsylvania, and Louisiana, have administered grant programs to frontline workers, and Maine should follow suit. MESUP supports LD 1677 for just 3 cents on of tax on every dollar above the income level. This bill would advance tax fairness and recognize the workers who have kept our economy running through crisis. We do suggest that the committee amends the bill to make it really clear that building cleaning and janitorial workers, a small workforce of less than 4,000 workers in the state, are certainly included in this. They've taken on very risky work and much higher workloads to keep us safe and cleaner indoor spaces. And to answer some of Representative Gramlich's questions, the industry code for healthcare, there's a big umbrella for that is healthcare and social services that are industry codes starting with 62. That includes social workers, it includes home health aides. So there's certainly a way to make sure that this is recognizing all of the people who've had substantial face-to-face interactions in this dangerous time we are living in. So with that, I urge the committee to vote to pass on this bill, and I'm very happy to take any questions.
Great, thank you for your testimony. Question from Representative Gramlich.
Thank you, Senator. Thank you, Ms. Austin, for coming and providing your testimony. I have 2 questions. One which might be relevant for the work session, but correct me if I'm mistaken. Currently, the minimum wage in Maine is $12.15. Am I accurate in that? Do you know that if that's what we are at right now?
I believe so. I think that's
yeah.
Right.
And so,
index,
do you
yep.
know? Does your organization have data relative to what the wages are for workers working in retail and other what we consider essential frontline workers in terms of, the Hannafords where we need to get our groceries and all that kind of stuff? I'm curious to know what the breakdown is of those, that population. So that's one. And then 2, perhaps for the work session, I don't know if you've done any analysis on what the implications are specifically for that 3% charge for the various income levels. If 3 cents on the dollar, we could get that like real life data. Like, what does that mean for somebody that's earning $500,000, which is a wage I'll probably never see in my lifetime. But I think that might be helpful to have that kind of data as we work through this at our work session.
Happy to do that. And I do have the breakdown on frontline workers that we did early in the pandemic that I can certainly share with the committee.
Additional questions from members of the committee? Seeing none, thank you for being with us, Ms. Austin, providing your testimony today. We will now hear from Adam Zuckerman to speak in favor, and then following him, we'll move to testimony in opposition with starting with Jessica Lilliberti. Welcome, Mr. Zuckerman.
Great, thank you for having me. Senator Chipman, Representative Terry, and honorable members of the Joint Standing Committee on Taxation. My name is Adam Zuckerman, and I'm the lobbyist for Maine People's Alliance. Our 32,000 members stretch from Kittery to Fort Kent. I'm pleased today to strongly testify in favor of 2 revenue bills that your committee is hearing. Speaker Fecto's LD 1677 and Representative Coyling's LD 1524. This pandemic has affected us all, regardless of where we come from or how much money we have. As someone who has the privilege of working from home, my life has changed, but not dramatically. I've cut out travel, eating at restaurants, and gathering indoors with friends, but our essential workers have sacrificed so much more. They've put their own health and even their lives at risk to feed, educate, and care for and heal the rest of us. For grocery workers, this meant going to work every day to ensure that all of us could be fed, interacting with hundreds of people, even though we knew it is exactly that exposure that puts people at risk. For nurses and care workers, this meant taking care of our health and well-being and doing everything they could to stem the tide of illness and death. As a society, we give essential workers a lot of generic praise, but have done little to nothing to actually thank them for their sacrifice. LD 1677 is a chance to put our money where our mouth is. For those with the highest incomes, most of whom saw their wealth grow during the pandemic and were able to work safely from home the whole time, it would mean chipping in a bit more in taxes. We are also in strong support of Representative Coyling's LD 1524, an act to amend the main exclusion amount in the estate tax. Over the years, Maine's estate tax has been watered down again and again, allowing more and more wealth to accumulate at the top tax-free. Wealth inequality is growing fast and is even more concentrated than income inequality. As of 2019, the top 10% of families owned 76% of the wealth in our nation. How much do the bottom 50% of families in our nation own? Just 1%. That's 1% of our nation's wealth for 64 million families. That is because more than half of all wealth is inherited, not earned. The status quo perpetuates inequality across generations as the wealthiest families leverage their abundant resources to increase their share of the socioeconomic pie and pass their wealth on to their heirs. This system also makes racial inequality worse. It deepens the legacy of discrimination and of racist policies such as redlining and segregation, which reduce the ability of people of color to accumulate wealth and thus pass that wealth on to their children. Today, white families are more than 3 times as likely as Black families to receive an inheritance, and when they do, the inheritance received by white families is almost triple what Black families receive. Wealth inequality hurts us all. The OECD found that rising inequality in the US from 1990 to 2010 reduced our cumulative GDP by about 5 percentage points over that period. They wrote the main mechanism through which inequality affects growth is by undermining educational opportunities for children from poor socioeconomic backgrounds, lowering social mobility, and hampering skill development. That quote perfectly encapsulates the choice we face here in Maine. One option is to stick with the untenable status quo. The other is for the wealthiest families in our state to pay taxes on their inherited wealth and level the playing field for our state's young children. I urge you to choose the latter. Thank you. And I'm also glad to answer any questions that folks may have.
Thank you, Mr. Zuckerman. Any questions from members of the committee? Seeing no questions, appreciate you being here today and offering your testimony on both 1677 as well as LD 1524. So that concludes the testimony of those in support of this bill. We'll now move to testimony in opposition. I believe Jessica Laberde is not with us today to testify. So we'll now hear from Linda Caprara, and following Ms. Caprara, we will close the public hearing on this bill and we will move into opening up the testimony in LD 1423, which time we'll hear from Representative McCrate. Welcome, Ms. Caprara.
Hello. Long day you guys have ahead of you. My name is Linda Caprara. I represent the Maine State Chamber of Commerce. Good morning, Senator Chipman, members of the committee. I'm also a resident of Winthrop. We are speaking in strong opposition to LD 1677. You've had a number of bills before you this year, this session, that would increase, income taxes on high earners. We oppose this bill as we've opposed all of the bills. I will be submitting written testimony that really doesn't differ from what we've said in the past. This bill is going to punish success, punish hard work, and really affect small businesses that are pass-through entities around the state. We are very grateful to frontline workers. But if you really feel, the legislature really feels that these folks should be compensated above and beyond what they are, then you have the $1 billion. You have money available to do that. You don't have to, go to folks and just redistribute from one segment of the population to another. And really, I think this just is very poor tax policy for Maine. So I'd be happy to answer any questions. Again, I will be submitting testimony, but our position is no different than what we've had on the other 9 or 10 bills that we've testified previous to this.
Great, thank you, Ms. Caprara. Any questions from members of the committee? Seeing none, thank you for your testimony and being with us this morning.
Thank you.
So that concludes the testimony of those in opposition. We don't have anybody to speak neither.
Senator.
Oh, go ahead. Oh, we do have somebody.
Yes, Mr. Murray is here to testify against the measure.
Oh, okay. He wasn't on our sign-up list, but we're certainly willing to hear from him. Welcome, Mr. Murray.
Thank you. Good morning, Senator Chipman, Representative Terry, members of the Taxation Committee. I submitted some written testimony here, but have just heard some things in this hearing that I wanted to address. I think it's a very noble goal to make sure that these essential workers have frontline workers have hazard pay and are reimbursed for the danger that they undertook. I think it's important to understand that they took on an exceedingly greater risk than other members of the public who could work remotely. And that's been mentioned. So in that way, in the way that we treated this virus and the governor shut down every business except for those who were deemed essential, in effect treated the risk to everyone equally, which we know is false. We know this virus does not affect everyone equally, especially by age, yet the policy was to push every essential worker, regardless of age or health status, into that position, whereas non-essential workers, for those who could work remotely like you and I, didn't have to face any infection risk, even though we may have been young and healthy. And so I just want to make that point and just allow you to think about that. I think it is ironic that a legislative committee is pursuing a policy that has been in the hands of the governor for over a year. Over $1 billion from the federal government passed through her hands. Some of it went to state agencies to provide hazard pay. Some of it went to Maine General Medical Center, MEMA, through DAFs. Not all in all, but 160 million of that 1.25 billion was rerouted through those agencies to provide some measure of hazard pay. That's only for state workers. She could have diverted some of that money to the private sector to provide aid for frontline workers. I don't believe that was incongruous with Treasury guidance, but I think it is ironic that a legislative committee is pursuing this to try to tax the people of Maine more for money that has more than enough has passed through this state, but through the governor's hands alone. The legislature has a mechanism by which it can end the state of emergency and retake appropriations powers that it is constitutionally granted, yet it has not. But now we're speaking about another tax bill that would make Maine less competitive regionally and nationally to provide this money that, as I said, is a noble goal. So to me, this seems like a rerouted effort to raise taxes by pointing to a problem that could have been solved by the governor and the administration through the enormous amount of federal funds that were available to them. So I hope the committee takes these things into consideration. They weren't all in my written testimony, but just due to what I've heard, I wanted to share them. So thank you for your time.
Great. Thank you, Mr. Murray. Questions from members of the committee? Seeing none, thank you for your testimony this morning. Is there anybody else that is signed up or wants to speak in opposition? We don't have anybody else on the list, but is there anybody else in the waiting room that we know of that needs to speak in opposition or neither for nor against on this bill?
That I can find. I think we're all good.
Okay, so we'll now close the testimony on LD 1677.
Mr. Chair.
Go ahead, Representative Fryza.
Thank you, Mr. Chair. Before you close it, could I ask for the work session that we get figures on if we were to give everybody, the essential workers that worked, the 12.5%, was it 12.5% tax break that we gave everybody that got unemployment? Could we get those figures? And so we could see how much money would go into the essential workers pockets compared to the, what's in this bill? What is it, $600 or $700 per person?
Who are you asking that information to be provided?
MRS. How much folks would get in their pockets if they got the same tax deduction that everybody that was on unemployment got for this year?
Okay, great. Julie, put your hand up.
Yeah, I'd only mention that there's some complication in doing that. The bill as it's drafted defines frontline workers as including without limitation a variety of people. it's actually up to the Department of Labor in the bill to come up with a program which will define what constitutes a frontline worker. So it would be hard to know, I might be able to estimate how much money would be raised from the 3% surcharge, but I don't think at this point, until someone has defined how many workers come under it, we wouldn't be able to know how much they would receive either from the surcharge or from a payment similar to the unemployment insurance amount, simply because we don't know how many, there's no way to know how many people would be included in that category until the Department of Labor has come up with a definition of everybody that would be included, and then someone would have to identify how many of those people there are.
Okay, great. Thank you for that, Julie. So we'll now open up the public hearing on LD 1423. This is sponsored by Representative McCrate. Welcome, Representative McCrate. And following Representative McCrate, if we can please promote the next two speakers, which will be Allison Perrone Drag and Annie Coates, to speak in support. Welcome, Representative McCrate.
Thank you. I didn't go through the wormhole this time.
Okay.
Senator Chipman, Representative Terry, esteemed members of the Taxation Committee, I'm Jay McCrate, representing Harpswell, West Bath, and Northeast Brunswick in the House. I'm here today to present LD 1423, an act to prevent and reduce tobacco use by providing adequate funding and by raising the tax on tobacco products. The proposal before you raises the tax on a pack of 20 cigarettes by $2. And because in Maine law, we tie taxes on all tobacco products together, taxes on other tobacco products will change by the same relative increase. I offer to you that this is sound tax policy and sound public health policy. Tobacco use causes serious health consequences that cost the Maine economy over $1.45 billion annually in medical expenses and lost productivity. Nicotine is addictive. Almost 90% of those who smoke tried their first tobacco product by 18. Young brains are particularly susceptible to becoming addicted to substances, nicotine included, and early use can increase risk for addiction to other drugs. Addiction to a substance, as we know, means quitting is extremely difficult. The goal of this proposal is to help prevent people from starting use and to help those trying to stop to have access to resources to help them quit. Evidence shows that significant increases in the price of tobacco products results in significant reductions in use, especially when combined with funding for tobacco cessation. This bill provides funding for prevention and cessation programs to help stop the addiction before it starts and to deal with it if it does. As older smokers die, the companies producing and selling these harmful products are aggressive in finding new markets. They promote their products to kids and to vulnerable populations, and typically these are the same populations who have less access to healthcare and poorer health outcomes. The preventable diseases with direct links to tobacco product use include cancer, diabetes, heart disease, and respiratory diseases, all of which reduce quality of life and all of which are too often deadly. One of the arguments you'll hear is that this will be hard on those with lower incomes, yet this is the same population that experiences a disproportionate share of tobacco-related illnesses and death. And it's the same population on which the tobacco industry spends a disproportionate share of their marketing dollars. The cigarette tax increase proposed in this bill is estimated to generate $48 million in state revenue annually and to save $300 million in long-term healthcare cost savings. This bill addresses these issues in several ways. Raising the price disincentivizes people from starting to use tobacco products. Funding is provided for prevention and cessation, and it also provides funding specifically for use by the Maine CDC to research, identify, and reduce healthcare outcome disparities based on ethnicity, sexual orientation, gender identity, income, educational attainment, or zip code. For so many of us, the harm tobacco products cause is personal. I lost my dad and my only uncle to lung cancer. Before lung cancer took my dad, he suffered 2 heart attacks. I saw the power of the grip of this addiction through his experience. He became addicted after being given cigarettes in his rations while serving in the Navy in World War II. And he smoked throughout my childhood. As an adult, on a visit to my parents, I noticed that my dad was checking his watch constantly. Dad, do you have somewhere you need to be? His response was, I'm checking to see when I can have my next cigarette. He was trying to quit by spacing out his next smoke and counting out minute by minute until he could have the next one. This consumed his every waking moment. He was eventually able to quit, but not nearly soon enough. He developed diabetes and then inoperable lung cancer. My dad was deathly afraid of drowning. Ironic, since he chose the Navy. Ironic too, because lung cancer caused his lungs to fill with fluid and he basically did drown. A horrible death no one should suffer, especially when it's preventable. He never met his great-grandchildren. He missed graduations, weddings, and all those events families treasure. You might hear the argument that my dad and others have choice about use. Hard to choose for my dad's generation when the truth about cigarettes and other tobacco products was purposely hidden by tobacco companies. They knowingly lied and deceived the American public, as proven through a congressional hearing and which sparked the Tobacco Master Settlement Agreement of 1998. Hard to choose today when ads and discounts target those they perceive the most vulnerable populations. It's not about choice when most tobacco users become addicted before their 21st birthday and then are in the grip of the addiction. Hard to talk about choice when people don't choose to have tobacco-related health problems or to die of horrible preventable diseases. It certainly was not my mom's or my choice to lose my dad when he was only 76, or my uncle who was even younger. I asked the committee to think beyond the arguments of those who profit off getting people hooked on these deadly products and think about what tobacco companies are really pushing and the harm to our health, our families, our communities, and our economy. I ask you to support this bill to prevent people from starting, to help people from using, to help people stop using, and to work to address the inequities in healthcare outcomes. Attached to my testimony are some references, and thank you for your attention. I'll do my best to answer questions. Others who follow me will be helpful as well.
Great, thank you, Representative McCrate. We have a question from Representative Bickford.
Thank you, Mr. Chair. Good morning, Representative McCrate, and condolences on your dad. I saw my mom and dad both go with drowning. It's not easy to watch, and neither one of them ever did smoke. But my question is, what do you say to the convenience store owners like Representative Perry and others that have to come up with, most of these folks will sell 150 cartons a week of cigarettes. They're going to have to come up with a one-time additional cost of $3,000 to replace that 150 cartons, along with the other $3,000 they're going to pay on the current $2 a pack price. What do you say to them?
Thanks, Representative Bickford. I'm not a convenience store owner, and I understand your concern and that question, but I have to point back to the devastation this causes on all of us, whether we directly or our families or our communities are affected. And I don't mean to be flip, but perhaps there's a better product that could sell.
I don't disagree with that. I have the effects of smoking myself, and it's not pretty. But my other question is how do we reach the people that are so addicted that before they buy groceries, before they buy healthy groceries, they have to buy their cigarettes first because they have an addiction. They have to buy the cigarettes first. That is their absolute top priority. Kids come second, family comes third. Can you explain how do we reach them and get them to change their ways? Because I don't believe it's going to stop people from smoking. Can you respond?
Thanks, Representative Bickford. Others following me can give you statistics on the fact that this does cause people not to start, and it does incentivize people to use the programs to try to stop. We do have prevention programs. This would add to them, and cessation programs. But you're making the point very well that addiction is terrible. Addiction to any substance is terrible. And addiction to nicotine, I think, is one of the hardest ones to overcome. So we need to help people to overcome it. And this bill provides two ways of doing that: by disincentivizing from starting and encouraging people to use programs that help them stop. Because it isn't easy. My example, my dad tells you how hard it is. And certainly, I don't mean to say he's alone. Thank you.
Great. Question from Representative Gramlich.
Thank you, Senator Chipman. Thank you, Representative McCray, for bringing this legislation forward and for sharing your very personal story about your dad. I'm sure that was not easy. So thank you very much. I too lost my mom at a very young age. She had just turned 72 to lung cancer as a direct result from nicotine addiction. And we do know that nicotine is one of the most addictive substances next to heroin. So it is pervasive. So thank you for sharing your story. My question is, I think I saw in your bill, and this might speak a little bit to some of the line of questioning that my colleague, Representative Bickford, was going down. I thought I saw in your bill, Representative McCray, that there would be an allocation for prevention and cessation as a result of this revenue, because we know that prevention is key, prevention is critical, so that if we never have particularly young people becoming addicted to this terrible substance, then ultimately they're not going to be buying cigarettes at the store. So that would also be a revenue loss. So is that accurate in that you have appropriated within your bill money towards prevention and cessation?
Yes, that is accurate. Both would be provided. The bill provides for, disease control and prevention would receive $7 million from the revenue that's estimated, and also $10 million, that would be for cessation and prevention, and $10 million to deal with health disparities. Where did you go? Your boxes keep moving. I can't find you. And then additional revenue would, unless the committee or we as a legislature decide to direct it specifically, would go to the general fund.
Follow up, if I may, Mr. Chair.
Go ahead.
Thank you. This may not specifically be for you, Representative McCray, but it might be something for the work session. I think it would be really helpful. And perhaps you do know this, but I'm curious about the healthcare costs that we as a state see in terms of addiction and the byproduct of like both of our family members dying to lung cancer. Those kinds of healthcare costs, what the toll that is on our healthcare system, because that money is still money that's being spent out. So I don't know if you have any of that data, but certainly I would like to have a little bit more information about that so we can do a really accurate cost analysis for the work session.
Thank you, Representative Gramlich. In my testimony, I mentioned that we would save over about $300 million in long-term healthcare costs. And again, the people most susceptible are those with poor healthcare coverage and of our lower income groups. But yes, you're right. I think others following me will be able to be more specific. Thank you.
Question from Representative Kryzak, followed by Representative Collins.
Thank you, Mr. Chair. And thank you, Representative McCree. And I'm sorry for your loss. I was just wondering, do you know where we stand with the program the state has from the tobacco settlement, as far as whether that's still operational, whether there's still money there?
Can I defer that to people following me who can
Absolutely.
be more accurate? Thank you.
Absolutely. Thank you.
Question for Representative Collins.
Yes, it's still morning, I think. Is it still morning? I got lost here in committee, but I think I'll say good morning, Representative McCray. And I'm very sorry to hear that experience. I know it's something that impacts so many of us, losing a loved one to smoking or other addiction. And I appreciate you, going forward and sharing that very emotional story with us. So I know that wasn't easy. So I do know that it's been proven since money has been directed, from the national level down to the states to prevent smoking cessation. And I mean, that's just a proven fact. So I'm not going to get into a debate about that. But what I do want to ask is, knowing that it's very successful and knowing that tobacco companies like to get children started smoking early, and when the U.S. started to crack down, they went to other countries to get, foreign youth to start smoking. We all know that as well. With that in mind, I was wondering if any of this money could go towards after-school programs, which attract children to, not be hanging out on the streets. But there's at least 17 to 20,000 youth in Maine that do go to after-school programs, and they're always really in need of funding. So they do a lot of preventative techniques and classes and trainings in these after-school programs. Would any money potentially go for that, so we can just help to continue these programs so children can learn about this, get educated, and learn the to basically would help mitigate this issue of young people starting to smoke and do get involved with other substance abuse?
Thank you, Representative Collins. I know that's a passion of yours. And in my work as a social worker in public schools, I was closely tied with the Boys and Girls Clubs. A lot of the kids I worked with had the safety and security of the Boys and Girls Clubs after school. So I think that's something that the committee, the legislature as a whole, could certainly decide. There would, based on the estimates that I've given you, there would be funding beyond what is specified in the bill. So I think those are the kinds of things we should talk about, definitely. And I saw that in the testimony the Boys and Girls Club is providing as well. They're a great organization. Thank you.
Thank you.
Additional questions to members of the committee. Representative Kryzak, did you have an additional question?
No, I'm sorry.
Okay. Seeing no additional questions, thank you for introducing this bill to us, Representative McCrate. Look forward to working with you in the work session on this. We'll now hear from, I misspoke earlier about who would speak next. We need to hear from other legislators before we go to the public, I guess, is the order of things. So we'll hear from Representative Zager, and then following him, we'll hear from Allison Perrone-Drag. Welcome, Representative Zager.
Thank you so much, Mr. Chair, Senator Chipman, Representative Terry, honorable members of the Taxation Committee. I am Sam Zager, honored to represent District 41 in Portland. Pleased to testify in support of LD 1423 as a co-sponsor and as a family physician. I thank Representative McCray for introducing it, as well as the other co-sponsors. This bill is important to me because helping people quit tobacco use and helping them avoid starting is the single best way to reduce avoidable disease and preventable death in this state. I recently saw Justin, a 30-year-old patient of low income of mine, in my primary care clinic. One of the chief medical issues he has is dependence on tobacco. At one point, he was smoking 2.5 packs per day, mostly triggered by stress. We've delved into his smoking many times, and he told me that he indeed would like to quit. It just costs too much money, he exclaimed to me one day. He said that he would rather spend that money fishing with his son. So now we've worked on this a lot, and he's now down to just 1 pack a day, fortunately, but looking forward to ultimately quitting. And he's made very clear that the price of cigarettes has been a key motivator for him. Tobacco is poison. It kills Mainers and makes life awful along the way. Quitting smoking can add as much as 10 years to life expectancy. And of course, you know about the awful diseases. I must acknowledge the story that Representative McCray just shared, and others. Tobacco is indeed the leading cause of preventable death. So as cigarette prices increase, cigarette sales drop. It follows the laws of microeconomics. Just like my patient Justin said, household finances affect people's interest in tobacco cessation. In other words, higher taxes on cigarettes means less poison being sold in Maine. Less emphysema, cancer, strokes, heart attacks, heart failure, frail and vulnerable newborns, less suffering. Below and attached in my testimony are some graphs that really illustrate this point. And this kind of gets at what Representative Bickford's good question was about what happens when the price of cigarettes go up. We can see very clearly with data over the last several decades that cigarette sales go down when the price is up, and so does youth smoking rate. So people don't start smoking, or in their early times of their lives when it's more expensive to. I won't belabor those graphs more unless the committee has questions, because being mindful of time. In addition to the human suffering, you will also hear today about how states that increase tobacco taxes pretty much always gain more revenue, even as tobacco sales fall. I really thank you for your diligent attention to this crucial matter. I'd be happy to answer any questions that I can.
Great, thank you, Representative Zager. A question from Representative Gramlich.
Thank you, Senator. I believe Representative Kryzak was ahead of me.
Yeah, Representative Kryzak, do you have a question? I think his hand might be up from before, perhaps. But
okay. Thank you, Senator. Thank you, Representative Zager, for bringing the medical perspective to this committee. I think it's really important. You did say there was a correlation between the increase in the price of cigarettes, of tobacco products, and a correlation with sales, which I think did lend itself to Representative Bickford's question. But could you, perhaps it might be anecdotal, or you may know some more hard data with correlative data concerning the decrease of tobacco use in terms of cessation? Wouldn't that also impact the price of sales in terms of the fact that people quit smoking cigarettes, so therefore are no longer buying them?
You're asking me what the mechanism underlying the graphs, the data that's.
Basically, if the argument is if we raise a tax on tobacco, it's going to adversely impact sales. My question is, if people quit smoking without a tax tobacco, won't that also impact sales?
Yeah, certainly would, and what a boon that would be for reducing suffering and lowering healthcare costs which we all bear. The thing about tobacco is that there's this economists would call it an externality. There's costs that are associated with the use of the appropriate use of the product that are borne by the people who are not just the people that are buying the product. And so this tobacco tax essentially would internalize the externalities.
Thank you, Representative Zager.
Question from Representative Bickford.
Thank you, Mr. Chair, and good morning. My question is, you made a reference to cigarette sales going down with an increased excise tax. Do you have data on roll your own tobacco, on the bags of tobacco with the boxes of, they'll buy boxes of wrap, or I don't know what you call it, where you have the cigarette paper to roll your own.
Yeah, I
Do you
appreciate
see that going up when the tax goes up. Do you see that change?
Representative Bickford, that's a great question. The data set that I looked at did not look at tobacco by pounds or by weight. It was by industrially rolled cigarettes. So I don't have an answer to your question, but it's certainly something that the committee could consider as it, if it wants to do something based on weight. Cigarette packages have a published weight. Could certainly include that if the committee saw fit. I think it's a great point that you raised. I'd be in favor of anything that reduces suffering and reducing tobacco. However, it's whoever rolls it, I think would be a very important step along those lines.
And the reason I'm asking is that cigarette sales may go down when you increase the tax, but I work in a store that sells cigarettes and alcohol and roll your own bags of tobacco, and people, when prices go up, they start rolling their own. So I think it might be a trade-off, maybe not. If we had some data, if anybody could provide that kind of data, it would be good.
Additional questions, members of the committee. Representative Kryzak, did you have a question? No. I think that's just from before, perhaps. So seeing no additional questions, thank you, Representative Zager, for being with us today. And we'll now hear from Allison Perrone-Dragg, followed by Annie Coates. Welcome. I think you're on mute. And also, just,
sorry about that.
I guess we just take this opportunity to, since we're going into testimony from the public, and there's so many people signed up to speak, we do ask folks to keep their testimony to 3 minutes if they can. Thank you.
Thank you so much. Thank you, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Allison Perrone-Dragg, and I'm the Government Relations Director for the American Heart Association. The AHA is the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke, whose mission is to be a relentless force for a world of longer, healthier lives. As part of that mission, we're working towards the tobacco endgame, ending tobacco use and nicotine addiction in the United States, which we believe is within sight. That is why we're here supporting LD 1423. Increasing tobacco taxes is a win-win. It has proven health benefits, and the revenue raised can be used to fund health and tobacco prevention program. Tobacco taxes are a proven way to reduce and prevent usage of dangerous and addictive tobacco products, particularly among young people and in communities that have been aggressively targeted by tobacco marketing. We are asking for the $2 tax because we need a significant tax increase. A small tax increase is easily offset by discounts, coupons, and buy one, get one free offers that tobacco companies use to keep people buying their products. Any tax increase will need to be significant to achieve public health benefits. We are also supportive of the tobacco tax being directed towards tobacco prevention treatment and other health-related programs. You'll hear that tobacco taxes are regressive, but what you need to remember is what is regressive is the harms, leaving some communities to suffer disproportionately from tobacco-related diseases, disability, death, and significant healthcare costs. By prompting more people to quit and cut back their use of tobacco products, raising tobacco taxes will reduce both the regressive harms and costs. It is essential to prevent children from using dangerous tobacco products such as cigarettes and e-cigarettes. Increasing the price of these products through taxes is one of the most effective ways to reduce and prevent tobacco use among youth and young adults. High levels of nicotine in cigarettes and e-cigarettes pose serious risks to kids, such as harming brain development and affecting memory and learning. From birth through the early 20s, brains are still being built and behaviors are being wired. We have a shared responsibility to keep these dangerous and addictive products away from children. And taxing tobacco products is a proven method of preventing and reducing youth tobacco rate. People who smoke are at greater risk of severe illness from COVID-19, so there is no better time to support and encourage people to quit than right now. Increases in tobacco prices can help reduce tobacco use and fund programs to help smokers quit. Smoking has been identified as a risk factor for severe coronavirus-related diseases and death. Efforts to help smokers quit, including price increases, will mean that smokers experience better heart and lung health almost immediately. Lastly, revenue from tobacco taxes can be used to fund programs that help people quit or never start using dangerous tobacco products. These programs will improve lives and lead to significant health cost savings. As people stop using dangerous tobacco products, public and private sector healthcare costs go down, more than offsetting any state revenue reductions from fewer tobacco products being sold. The American Heart Association supports increases in tobacco taxes because these measures save lives. Thank you for your time today, and I'm happy to answer any questions.
Excellent, thank you. 3 minutes on the dot. Appreciate that. Any questions to members of the committee? Representative Bickford.
Thank you, Mr. Chair. And really quick, do you know why, you may not, but why does the Fund for Healthy Maine spend so much on daycare and how that helps people quit smoking?
I don't know the answer to that. You'd have to ask the CDC staff on that question, Representative. We can certainly look into that. I think for us, it's really about ensuring that we are providing education so kids learn the harms of tobacco addiction, that we provide cessation so people who want to quit have the opportunity to quit. Maine has a really comprehensive cessation benefit across the board. We want to provide opportunity for quit line and counseling and local boards of health enforcement. So that's where the money that this program from this tax would go. So we want to make sure that if we're raising the price, that we're providing opportunity for that money to go back to the people that would pay that tax.
Okay, and just to follow up with all of your local stores around, I've heard a lot of references to children smoking. Do you have any data that shows that any location in Maine has sold or does sell tobacco products to children?
So I believe the Attorney General could answer that question for you in your work session. They're the ones that do the enforcement of that. But we do know that kids that are exposed, whether it's at convenience stores for marketing or vape shops, that they are receiving those products. They also get them from social sources. So it may be that older kids are also providing those products. But, you know, what we know is that if the price is too high, and Maine has not raised their cigarette tax since 2005, it's very low. It's the second lowest in the Northeast. We want to make sure that that really prevents kids from starting. If it's too expensive for them, they won't start. But I would go back to the Attorney General for that question on enforcement.
Thank you very much.
Any additional questions from members of the committee? Seeing none, thank you for your testimony today. Next, we'll hear from Annie Coates from Maine Health, followed by Hillary Snyder from the American Cancer Society. Welcome, Ms. Coates.
Thank you. Senator Chipman, Representative Terry, and members of the Taxation Committee. I am Dr. Annie Coates, and I am a pediatric pulmonologist and a board member of the Maine chapter of the American Academy of Pediatrics. I am here today to testify on behalf of Maine Health in support of LD 1423. The legislation before you today supports Maine Health's mission and vision of working together so Maine's communities are the healthiest in America, because increasing the cost of tobacco products will ultimately reduce the number of tobacco users in Maine at a time when almost 18% of adults in Maine are smokers, and nearly 30% of Maine high school students reported use of an electronic vapor product in the last 30 days. I care for hundreds of children across the state with serious pulmonary health conditions, and I am here today because I care for too many impacted by the harmful effects of tobacco and nicotine, which may start as early as prenatally. With 1 in 4 Maine high school students now using e-cigarettes, a rate that has nearly doubled in the past 2 years alone, something must be done. I would like to remind this committee that this isn't just a statistic. These are our children. 3 months ago, I was consulted on a previously healthy adolescent who was admitted to the Barbara Bush Children's Hospital Pediatric Intensive Care Unit in respiratory failure. Over the past year, he started smoking flavored e-cigarettes. His impression at the time was that he was inhaling just flavored water and that he wouldn't get addicted like his parents were to cigarettes. What he didn't understand was the extent of the harmful effect of e-cigarettes, and that they in fact had nicotine in them, which he had since become addicted to and directly contributed to his critical health condition. But the damage didn't just stop there for him. He had gone from being a good student to skipping school to smoke, which resulted in failing multiple classes. Furthermore, he developed a multitude of other daily symptoms, headaches, difficulty concentrating, abdominal pain, all which can be attributed to nicotine addiction. I could share countless similar stories, but you can make a difference. According to the 2012 report by the U.S. Congressional Budget Office, increasing tobacco product costs affect our younger smokers the most profoundly. The math is evident. If tobacco products cost 10% more, 4% fewer 19 to 39-year-olds would smoke. Additionally, the revenue from this tax could be employed to combat the new wave of youth nicotine addiction through combating youth vaping and e-cigarette usage, hopefully returning it to the level seen prior to vaping be introduced to our schools. This, in effect, would reduce our future adult smoking rate and curb healthcare costs for decades to come, as been acknowledged earlier today. Before I close, for individuals looking for support to quit smoking, vaping, or other tobacco use, I encourage them to contact the Maine Quit line at 1-800-QUIT-NOW for free support and coaching. This is evidence-based and effective. The phone coaching program quit rate is 36% for tobacco users that complete at least 4 calls on the multi-call program, compared to unassisted quit rates, which are generally reported at approximately 3%. As a pediatric pulmonologist, as a mother, as a resident of Maine who has dedicated my career to the health of our communities, please use your voice, your vote, and support this critical legislation. Thank you for the opportunity to testify today, and I'd be happy to answer any questions you may have.
Great, thank you for your testimony. Any questions from members? Seeing none, thank you for being with us today. We'll now hear from Hillary Snyder of the American Cancer Society, followed by Laney Graham of Freeport. We can promote Laney Graham. Welcome.
Good morning. Sorry. Can you hear me?
Yes, we can.
Okay, great. Good morning, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Hillary Snyder. I'm the Government Relations Director for Maine for the American Cancer Society Cancer Action Network. We would like to express our strong support of LD 1423. This bill would support efforts to reduce youth and adult smoking rates, lower healthcare costs for Maine individuals, families, and businesses, lower the burden of chronic disease, including cancer, improve the business climate, generate state revenue, reduce health disparities, and save lives. It would achieve these positive outcomes by implementing a proven public health best practice for preventing and treating tobacco addiction, increasing tobacco taxes, and using part of the revenues generated to adequately fund evidence-based tobacco prevention and cessation efforts. As you've heard, this is not just about tax policy, it's about proven best practice health policy. In 2021, more than 10,000 Mainers are expected to hear the words, "You have cancer," and nearly 3,400 will die from the disease. Cancer affects nearly everyone, but it doesn't affect everyone equally. One of the main reasons for this is tobacco use. Tobacco use is more prevalent among people with lower incomes, lower educational attainment, as well as racial and ethnic minorities, LGBTQ individuals, and individuals with a mental or behavioral health condition. Since tobacco use remains a leading preventable risk factor for cancer, it is also a major driver of cancer disparities. Smoking is responsible for an estimated 30% of cancer deaths in Maine, equivalent to more than 1,000 cancer deaths annually. Smoking is a known cause of cancer of the oropharynx, larynx, lung, trachea, bronchus, stomach, liver, pancreas, kidney, cervix, bladder, colon, and acute myeloid leukemia. Maine has the 6th highest rate of smoking-related cancer cases in the nation and the 11th highest rate of smoking-related cancer deaths. This is not a metric for which we want to be leading the nation. Tobacco use costs Maine $811 million in healthcare bills each year and approximately $262 million in state Medicaid costs. Nearly 7 Maine adults die prematurely each day from their own smoking, and most of them are paying for a decision they made as a kid. 95% of adults who smoke start before age 21. Many new users will become addicted before they are old enough to understand the risks and ultimately will die too young of tobacco-related disease. While Maine and the nation have made tremendous strides in reducing tobacco use, declines in smoking rates have slowed in recent years. In recent years, overall youth tobacco use in Maine has skyrocketed, with nearly 1 in 3 high school students using some form of tobacco product in the last 30 days. More than 1 in 15 Maine high school students smoke cigarettes, with a high of 1 in 8 in Washington County. Tobacco use trends in Maine are described in more detail in my written testimony. For these reasons, it's absolutely critical we take steps to accelerate progress in tobacco prevention efforts. Preventing kids from ever picking up their first tobacco product and incentivizing and supporting people to quit will be critical to our efforts to finish the fight against cancer. I don't want to repeat what's already been said. So increasing the cigarette tax by $2 per pack would generate nearly 48 million in new annual revenue, decrease youth smoking by nearly 20%, and generate $3.4 million in savings to the Medicaid program over the next 5 years. This policy proposal will result in even more revenue as the Maine statute ties all tobacco taxes together so as not to create loopholes in our tax code, and will generate general fund savings through reduced government expenditures on tobacco-related illness. In addition, raising all tobacco product taxes will help reduce health disparities, especially those related to socioeconomic status. This bill dedicates a portion of annual revenue to increased funding of the state tobacco prevention control program in order to bring the funding levels of that program in line with what the US CDC recommends for Maine to spend. Despite the incredible cost effectiveness and significant return on investment in state tobacco prevention programs, Maine's tobacco prevention and cessation program was significantly underfunded until 2019, when the Maine legislature took action, nearly tripling funding by bringing it up to $13.9 million per year. $8.9 million in program funding was passed as part of the biennial budget of that you passed earlier this session. However, the program needs $7 million per year more to bring it up to what the US CDC recommends it spend for Maine, $15.9 million. This amount pales in comparison to the estimated $42.8 million the tobacco industry spends annually to market their products in Maine. The evidence is clear. We must do more. Pass LD 1423, and it will be a triple win. It will save lives, save healthcare dollars, and generated much needed revenue. And I'd be happy to answer any of the questions, including the ones you didn't have answers from before, because I can answer them.
Great, thank you. Question from Representative Terry.
Thank you, Mr. Chair, and thank you, Ms. Schneider, for being here today. I love asking you questions because you always have the answers. I have two questions. One is, in states that do have the higher cost for cigarettes, whether it's via taxes or anything else. I think taxes is pretty much what it is because the cigarette manufacturers don't charge very much. Are there lower cancer rates in those states than we see here? It seems to me like we have pretty high cancer rates.
Yes, and there's also lower youth use rates. So as Allison from the Heart Association said, Maine has the second lowest tax rate in the whole Northeast. And we definitely have one of the highest youth use rates in the whole Northeast. We do also see lower cancer. There is evidence around tobacco control policies because there are no silver bullet policies. You know, there are evidence-based policies that we promote, and states that have more of those see lower tobacco use rates and lower tobacco-related cancer rates. And one of the reasons why we've made such progress in this country on reductions, especially in lung cancer incidence and death, is due to policies around raising taxes, smoke-free and tobacco-free public places and workplaces, and adequately funding tobacco prevention and treatment programs. And I can provide more details on that for the work session.
Okay. Actually, I have two other questions. Is that okay, Mr. Chair?
Sure, go ahead.
One is, actually, we'll just go with one for now. Several years ago, one of the big pharmacy chains contacted me because of my business. I have a granola business. Contacted me asking if I would be interested in supplying their stores with granola because they were getting rid of cigarettes out of their stores. They have since done that. There's no other cigarettes. There's no cigarettes sold at that stores. Do you know if that's the case with most pharmacy chains? You know, this one was CVS. You know, it could be any one of them. Do you know if they're still selling cigarettes, and if they are not, if that's affected their business?
Yeah, so CVS made a national decision a few years ago around they were no longer going to sell tobacco products. They believed that it was, that as they were building themselves as a healthcare business, that they could no longer sell a product that resulted in so much illness and death. And I can provide that. There actually was a journal study that was put out, I think in the past year, around they actually believe their decision, because of the magnitude of their business in this country, has resulted in a decline in tobacco use rates. And I can share that. Hannaford has also made an announcement this year that by the end of this year, they will stop selling tobacco products in all their stores. The other thing I will say is there is quite a bit of literature in actually convenience store industry literature that talks about how the convenience store industry is an industry that has not modernized as much as other industries have, and how there is a movement to modernize their business to sell healthier products and move them to go along with public demand and the raising concerns around tobacco related illness. And I can provide some examples of that for the work session as well.
That'd be great. Thank you very much.
Did you have any other questions, Representative Terry?
No, I'm good.
Representative Carmichael.
Thank you, Mr. Chair. Ms. Snyder. I was wondering if we can't have it for today, the work session is fine, but can we get some ideas of how we can prevent unintended circumstances from this, like guaranteeing that low-income families, the kids in the low-income families don't suffer because of the parents' addiction. And, that happens in so many other cases where parents have addictions, whether it's to drugs or cigarettes or whatever. They make sure that they get them the money to provide for their addiction, but children suffer, and that's really a concern that I have with this.
So thank you for that question. So one of the things that you should know, that you may not know, is our organization and other national public health organizations would not put forward tax proposals if we did not have strong tobacco treatment benefits. Because of the Affordable Care Act, nearly everybody in America that has private insurance has access to 100% coverage for tobacco treatment. And our Medicaid program in Maine, due to policies taken by the legislature, has one of the strongest, most low barrier programs for tobacco treatment as well. We have 100% coverage of tobacco treatment in our Medicaid program with no cost and no barriers. You've heard from Dr. Coates about the Quit line, which actually through some of the funding allocated to the tobacco control program, which yes, is live and well, and doing lots of great work in this state. They modernized over the last couple of years the Quit program. So it's not just a 1-800 number, but it also has a live chat benefit. It has a text to quit for youth. So there are a lot of resources out there. I will say that we as an organization believe more can be done and more should be done. We should be promoting as a state our tobacco treatment benefit even more to Medicaid members, so they are aware that they have that coverage, and doing everything possible to help those who want to quit. And so that is one of the ways, and that is also why this bill, a small portion of the revenue goes to adequately fund that program that can provide not only prevention resources in communities, which include youth empowerment, which is like those things that are like after school programs. They do get some of funding from this program through youth empowerment, and also treatment. So we share your concern about helping families, especially families that are addicted to tobacco, and ensuring that we know that kids who live in families where there are tobacco use are more likely to use tobacco. So we want to stop that cycle of addiction.
Additional questions?
One follow-up, if I could, sir.
Sure, go ahead.
I support all that. I think it's all great. But my concern was more with the parents who choose not to quit and spend the extra money, the extra $2 a pack. Maybe some people smoke a couple packs a day. That could have a significant impact on a family's budget. I don't want to see a child go without milk or cereal or other necessities because we've imposed a tax that takes that away from them.
So I would answer that in a couple ways. One is, as I said, we do have evidence that people who are lower socioeconomic status want to quit as much as people who are higher socioeconomic status. And we know that they make quit attempts. In some cases, there are studies that say make quit attempts more. And so, as I said, we need to help people, you know, and anecdotally, I'll say I have met very few tobacco users who don't want to quit. There are some out there. I know that that is true, but I don't think that people are looking to die of tobacco related illness. And then I would just say on the other side of that, I have not seen evidence in the literature that states that low-income people don't buy food for families because they're buying tobacco products. And so I would welcome to view that literature and that data so I could explore it and bring it to our national organization to explore as well.
Could we, if you have any of that information, could you bring it to the work session?
Information on the first part of that I was saying?
On all of that you can. I think it's all pertinent and
Sure.
important.
I'll be happy to provide you lots of information.
Thank you.
Thank you. Any additional questions from members of the committee? Go ahead, Representative Collins.
Yes, thank you very much for your very informative presentation to us. Just real quickly, I know that when I grew up in a little town in northern Maine, I remember our last days of our senior year, we did these outings outside of the school on someone's property, private property. And I think, you know, most of us were 18. And I would say that, I don't know, I think like 60% of the kids who were 18 in my class were smoking. You know, it was like such a high rate in this small rural part of Maine. And since then, I thought with everything going on that that really kids wouldn't be doing that anymore. But when, you know, still 1 in 8 teens are smoking in Washington County, that's alarming to me. And I'm just wondering, you may have said this, I'm sorry if I missed it, but what is causing kids still to smoke in such high areas, especially in some of these rural areas?
Yeah, I would say it's by purpose. The tobacco industry spends, as I said, $48 million in Maine alone marketing deadly products. And we know that that kids who live in rural communities, especially, we have this data for Maine, I can provide it to you for the work session. We have county data on the Maine Integrated Youth Health Survey. And we know that kids who live in rural counties will report that they see tobacco advertising regularly more than kids who live in Cumberland County. We also know that from national studies that the tobacco industry spends more marketing through advertisement, through the stuff that Allison was talking about, couponing, point of sale marketing in low income communities. And so what we know is that they are a very brilliant industry. They know how to market their products in a very targeted fashion. And they know they market them. There's evidence that came out through the Tobacco Master Settlement, has come out through other lawsuits where their marketing materials are disclosed that show that there are very targeted planned marketing campaigns to any population that the industry perceives as vulnerable. So I will say the other reason why I believe that tobacco use rates for our youth are higher. Like, as I said, we have one of the highest youth tobacco smoking, combustible cigarette smoking rates in the Northeast, is because we haven't passed a cigarette tax in over 15 years.
Additional questions from members of the committee? Seeing none, thank you for your testimony, Ms. Snyder. We'll now hear from Lanny Graham, and then following her, we'll hear from Laura Harper, if we can promote Laura Harper from the Campaign for Tobacco-Free Kids to follow Lanny Graham. Welcome, Ms. Graham.
Good morning, Senator Chipman, Representative Terry, and members of the Taxation Committee. My name is Lanny Graham. I'm a family practice physician and former Chief Public Health Officer for Maine. I'm a member of the Public Health Committee of the Maine Medical Association, and this tax was identified as a top priority for that committee. I am here from Freeport supporting LD 1423. I have testified before 4 committees in this legislative session about more than 15 public health bills. Public health has been my life because I know it saves lives and prevents injuries. And this bill addresses one of the most serious public health epidemics Maine has ever faced. You just heard from a professional provide erudite testimony with footnotes which supported this bill magnificently. I'm going to try to give you what I see as the big picture. I have fought tobacco epidemic my entire life. There is likely no person in this state who has not been touched by this epidemic, but the epidemic continues. Why is that? Public health attempts to prevent diseases, whether it's immunization, substance use disorders, firearms, it is all public health. But sadly, the disease prevented is hard to picture. And when there is a lag time between exposure and the appearance of illness or death, the chance of neglect is high. If there are other factors affecting the appearance of illness, genetics, or other contributors such as cholesterol, the chance of neglect rises. And when you have an industry with a customer base at stake, the challenge is greatest yet. The tobacco epidemic has been driven by all those factors. We only began to get a handle on this epidemic when the industry was sued and had to admit that it consistently lied to its customers and that the costs of use to the states and to people far exceeded the benefits. That situation continues, with youth being at high risk thanks to the industry's latest invention of flavored products. This bill reaches 2 excellent goals. First, raising the tobacco tax will absolutely suppress youth tobacco addiction, making a huge commitment to the future of Maine. Furthermore, though tobacco taxes are correctly viewed as regressive because they hit the poor the hardest, I hate that fact, but a complementary fact is that the majority of poor smokers would like to stop smoking, and this money could help them do just that. In fact, a 2015 survey indicated that the majority of adult smokers, 70%, would like to quit. We can help them. Second, Maine is just now beginning to emerge from the COVID pandemic thanks to the amazing work of our Governor, Commissioner Dr. Shah and his team. But this was not without backbreaking work for months and months. We have been lucky with these leaders, but not smart in our ongoing commitment to public health. Since my own tenure, the Maine Public Health has been challenged by being underfunded. In this, Maine is not unique. Public health is very poorly understood and always gets a pittance of what is devoted to healthcare. But Maine has an additional challenge by having a very limited public health infrastructure. The biggest lesson we should have learned from the COVID epidemic is that we need a strong public health system. I am thrilled that this bill will address the tobacco epidemic, but even more thrilled that this bill could help rebuild and strengthen the public health system in Maine. It's so essential. Thank you very much for your attention and support for public health in Maine.
Thank you, Ms. Graham. A question from Representative Perry.
Yes, thank you, Mr. Chair. Thank you for your testimony. Seems like we set up the Fund for Healthy Maine, had a lot of money in it, that we did a good job protecting it. I've kind of lost track of what's gone on with that the last 10 years or so, but I know every day on TV I see commercials, anti-smoking commercials, the tobacco helpline, and resources available. What is the current status? What's missing? What more could we do with more funding?
Well, the trouble is, as was presented very well by Hillary Snyder, is that this product is continuously marketed and very ferociously. So we need to try to balance that. It's kind of like David and Goliath. We're David and they're Goliath. And the continuing new ways of recruiting, especially youth, with these flavored products and so forth, has made it even more difficult. So we do need additional funding to help. I mean, it's an addiction. So as you well know, I mean, we've seen it killing people in Maine for decades. And so every step we take to try to help people get off this product is useful, and it can't be done cheaply. I wish it could, but it can't.
I'm just wondering, as we move forward, anyone who testifies in support, that's my main interest, is what is missing? What more could we do? What tools are missing? What would we spend the money on? Or is it simply the added cost that we're hoping will convince people that it's finally time to?
I think it would be a good idea to have.
I just have felt like over the years we've been pretty well funded.
I think it would be a good idea to have the representative of the department of the Maine CDC for your work session, because they can tell you very specifically the way the money is being spent.
Thank you very much. Any further questions from members of the committee? Seeing none, thank you for your testimony. We'll now hear from, we had Laura Harper signed up, but I believe it's Betsy Sweet that's here to speak on behalf of the campaign for tobacco-free kids in place of Laura Harper. So we'll hear from Betsy Sweet, followed by Rebecca Boulos, if we can promote her next from the Maine Public Health Association. Welcome, Ms. Sweet.
Thank you, Senator Chipman and Representative Terry, members of the committee. I am Betsy Sweet. Laura Harper is in another committee. It's one of those days where we have to be 15 places at one time. So, but I will love to share her testimony with you. I am Betsy Sweet, and I am the founder of Moose Ridge Associates. I live in Hallowell, Maine. And today we are testifying on behalf of our client, the Campaign for Tobacco-Free Kids. For more than 20 years, the Campaign for Tobacco-Free Kids has fought to protect children and save lives from the #1 cause of preventable death, tobacco use. We are the largest organization in the nation focused entirely on reducing the impact of tobacco on our nation's health, especially through reducing youth initiation and use of all tobacco products. We are passionate and experienced public health advocates with a proven track record of leading and supporting successful policy advocacy campaigns. Based on a comprehensive review of evidence, the Surgeon General has called raising prices on cigarettes one of the most effective tobacco control interventions, because increasing price is proven to reduce smoking, especially among kids. However, the cigarette companies that have opposed tobacco increases by arguing raising cigarette prices would not reduce adult or youth smoking. But the company's internal documents, disclosed in the tobacco lawsuits that have already been referenced, show that they know very well that raising cigarette prices is one of the most effective ways to prevent and reduce smoking, especially among kids. And I want you to think about the fact that Maine's tax on cigarettes has not increased in 15 years. The current $2 per pack tax, which put us ahead of New England back then, is now the second lowest in the Northeast. This is nothing to be proud of. Maine kids are paying the price for our inaction. Maine needs to now take action now to raise the price on cigarettes, and this will significantly reduce smoking rates, especially among our children who become our addicted adults. We urge you to vote ought to pass on LD 1423. And I'm happy to answer questions. I'd like to just say two things. One is to Representative Bickford about the question about loose tobacco. Last year, maybe it was the year before, you passed a parity bill so that in fact, loose tobacco is taxed now at the same rate as packaged tobacco, as cigarettes in a package. So that is not, people are not, they may turn to rolling their own, but they're not going to save any money doing so. And the second thing, to Representative Perry's question, as someone who helped start the Fund for Healthy Maine and has been an advocate for it for the last 20 years, the money dedicated to smoking cessation in the Fund for Healthy Maine has really gone like this, really up and down. And because we also do other things with that money in terms of childcare, in terms of vaccinations, there's a community health structure. There's a lot of things that go into public health, which is what we have amazingly and wonderfully saved the Fund for Healthy Maine for. But there are new things. And again, there was a downward slide for a long time in terms of the amount of money that went to tobacco cessation. There are some really new and innovative programs that we're not doing. One of the ones I'm most interested in is a whole smoking cessation program for young people via texting. We are working with this in terms of mental health, looking at suicide and mental health support via a texting program, which is proving across the country to be incredibly effective. And so again, this is a new idea, it's a new place. So when you ask what more could be done, that's one. Another thing is to make it much more accessible, the helpline much more accessible. You know, when people call, they get a lot of help. And, you know, addiction is related to a number of issues. You know, usually the addiction to whatever substance it is the surface, and what's underneath it is something else. And so we don't have those kind of connections. And so I think that's a place where we can go. But, and I think, you know, just more of it is really important, because we got to, you know, what do they say? People have to hear something 24 times before they retain it. So we're far from that in terms of our public advertising and, you know, tobacco-free kids stuff that we can do. With that, I'm happy to stop and answer any questions.
Questions, members of the committee? Seeing no hands up, I guess I would just ask, so we've heard about the Fund for Healthy Maine and what goes into that, and how, you know, there's been some discussion about how much goes to smoking cessation versus childcare and other things. Is just, you know, raising the tax on tobacco and cigarettes alone, whether that money goes into Fund for Healthy Maine or goes for other things and what it's spent on, is that sort of less relevant than the fact that raising the price on the product it does drive down smoking rates? I mean, that data, I believe, shows that in the past, when we've raised the tobacco tax, the cigarette tax, that it has brought rates down, and because we haven't raised it in 15 years, the rates have crept back up. And so just bringing the price up alone through the tax has an impact on smoking rates, let alone the benefit of what that money's used for. Would you agree that that's the case?
100%. I mean, raising the price is the number one thing you can do to prevent new smokers. And it is also one of the number one drivers of preventing, I think, as Representative McCreight said, people who are currently smoking, to get them to quit. So even if that money didn't go anywhere, the thing that we're doing, what I love about this bill is that it's a win-win, in that we also say, okay, and if you want to stop smoking, if you're one of those people already smoking, we are going to help you too. And we're going to have kids understand it. And I know that you're going to be voting on the flavored tobacco bill eventually, all of you. And, you know, I just know from my own children who grew up with me as their mother, like Miss Health Queen, you know, when they started vaping, the advertising for them, they said, Mom, this is just strawberry flavored water. There's no nicotine in this. And they were these are smart, great kids. And they are now, both of them, struggling with addiction to the vaping, because of the flavors, and because they were told that, or they believed, I don't know if they were told, but it was marketed to them as something that didn't really include nicotine. So it's just the marketing, as somebody said, I think, is ferocious, and $45 million a year just in Maine. And so this is, as you said, Senator Chipman, this is the number one effective thing we can do. And we haven't done it in 20 years.
20 years, wow, it's longer. I thought it was 15. That's been a long time. So what we did last year was an equalization, but that didn't raise the tax on cigarettes at all. It was just to bring the tax of the untaxed, the tobacco products that weren't taxed at the same rate as cigarettes up to the same rate as cigarettes, correct?
Absolutely. And that was cigars, you know, and bulk tobacco, that kind of stuff. So yeah, so this would take everything and raise everything up.
Okay, great. So I don't think there's any other questions from members of the committee, so appreciate your testimony. Good to see you.
Yep. Hello?
Yep, go ahead. You have sorry, Representative Collins, I didn't see your hand. Go ahead.
It's okay. The sunlight is streaming through my house, and I'm kind of like, my screen's kind of blurry from the sun, so you probably didn't see me. But anyway, thank you, Ms. Sweet. I was just going to say, I don't see in this bill anything about vaping, and that's becoming such a huge issue with kids even starting at younger ages, and a lot of kids start just smoking cigarettes. And is there anything that you're working on towards that end as well? Or did I misread this, that it is included?
Sorry, you didn't misread it, but vaping is, the vaping pods are classified as tobacco products. So this would apply to them as well. And then in the Health and Human Services Committee, we are working very hard on banning flavors from tobacco because of the incredible effect it has on kids. So this would go across vaping products as well.
Okay, great. Thank you.
Seeing no additional questions, appreciate your testimony today.
Thank you.
We'll now hear from Rebecca Boulos, and then following her, we'll go to testimony in opposition, beginning with Anthony Scott. And at this time, I'm going to hand the virtual gavel over to Representative Terry.
Thank you, and welcome, Ms. Boulos.
Thank you. Good morning, Senator Chipman, Representative Terry, and distinguished members of the Joint Standing Committee on Taxation. My name is Becca Bolas. I'm a resident of South Portland and Executive Director of Maine Public Health Association. MPHA is the state's oldest, largest, and most diverse association for public health professionals. We represent more than 500 individual members and 30 organizations across the state. Our mission is to improve and sustain the health and well-being of all people in Maine through health promotion, disease prevention, and the advancement of health equity. I'm here today because MPHA supports LD 1423, which, as we've been talking about, will increase the excise tax on tobacco products by $2 per pack, and it allocates a portion of the revenue to the state's tobacco prevention and control program and to Maine CDC's efforts to research, identify, and reduce health disparities. This bill is important for protecting public health. Maine's next generation is rapidly becoming dependent on tobacco products, and we see disparities in use among youth by race and ethnicity, sexual orientation, and gender identity. And I have statistics on that in my testimony. As you were just discussing, we've also seen an explosion in e-cigarette use here in Maine. From 2017 to 2019, there was a near doubling in youth e-cigarette use from 15% to about 29%. And we saw some of the greatest increases in rural areas, including in Piscataquis and Oxford counties. And I have those statistics in my testimony as well. Data also show disparities in smoking prevalence across income strata, such that as income increases, smoking prevalence decreases. And the reason for these disparities is because the tobacco industry targets these groups with lower pricing, larger signage, tailored cultural marketing, flavorings. More than 15,000 flavored tobacco products are on the market right now, and increased retail density. The subsequent costs on our health and our healthcare are significant. And again, I will reference please reference my testimony for those figures. This bill will prevent youth from starting to smoke, and it will encourage current smokers to quit. It is an evidence-based strategy to achieve those goals. And as you've heard, it will also generate more than $47 million in new revenue that we can use to address tobacco use among youth and also address health disparities in Maine. There are a couple other points that I want to make that we haven't talked too much about. The first is that data show that tobacco use increases the risk of having more serious illness from COVID-19. And we've also seen disparities among the incidence of COVID-19 along racial and ethnic minority populations. And we see similar disparities among populations at risk for lung cancer, including people with lower income and those who live in rural areas. In 2019, MPHA received funding from Maine Cancer Foundation to conduct a public opinion poll about a range of tobacco-related issues. And what the data showed was that overwhelmingly, Maine voters support a tobacco tax. In fact, 70% of respondents supported using tax revenue from an increase in tobacco tax to prevent youth from starting to smoke or use other tobacco products, which is exactly what this bill would do. If I may, I'm going to kind of deviate from my testimony to answer some of the questions that came up earlier from the committee. There was a question about sales at convenience stores. I just want to comment that the retail environment is an important one for tobacco companies because it allows them to advertise directly to consumers at the point of sale. And so part of their tactic is to enlist convenience store owners and retailers to come and oppose bills like this. A 2020 report from the convenience store industry was presenting data on the amount of revenue from cigarettes or from tobacco products. And what it showed actually was that prepared foods and packaged beverages were actually a greater share of profits at convenience stores. So while 34% of sales from this report were from tobacco, only 18% of profits were from tobacco. Conversely, 35% of profits were from packaged foods and 19% were from packaged beverages. I don't have that in my testimony, but I will share that report with you. The two other things I want to just flag for you are that we have prepared a history on the Fund for Healthy Maine, and I will share that with the committee. And on Monday, all legislators, I hope you received it, we sent out a report from Maine's Tobacco Advisory Council, and I'm happy to share that report again, but it gets to what Representative Perry was asking about on what else can we be doing and what should we be doing. So both of those reports I will share if you don't already have them. I think that answers the questions that were brought up, but if I missed anything, I'm happy to take other questions.
Thank you very much for your testimony. Are there any questions for Ms. Boulos? Seeing none, thank you so much for being here today. We appreciate
Thank
it.
you.
We have one more person testifying in favor of this bill, and that is Edward Miller. Welcome, Mr. Miller.
Thank you very much. Good morning, Representative Terry, Senator Chipman. I'm glad that I got in on the proponents. I was a little nervous there in the waiting room, but my name is Ed Miller. I'm a resident of Hollowell and a retired public health professional with more than 40 years of experience and involvement in tobacco policy in Maine. I worked for 13 years as the lead tobacco prevention person at the Maine CDC, followed by 20 years of this as the CEO of the American Lung Association here in Maine. I'm here today as the chair of the Maine CDC's Advisory Council on Tobacco Prevention and Control to speak in favor of LD 1423. The Advisory Council was established in statute in the 1990s to provide advice to Maine CDC's Tobacco Prevention and Control program and to ensure coordination with other public and private organizations. But we also had another role, which is to report annually to the governor and the legislature with recommended proposed legislation to further the purposes of the program. While the council was dormant for a number of years, the administration has reestablished it, and it's my pleasure to serve as its chair. As Becca just mentioned, we will provide you, have also recently provided you with a copy of our 2020 annual report. Support of LD 1423 is consistent with 3 of our 6 policy recommendations: to fully fund the Maine CDC Tobacco Prevention and Control Program, to raise the price of tobacco products, and to create more equitable health outcomes by addressing communities disproportionately impacted by tobacco use and tobacco industry marketing. Quite simply, raising the tobacco price of tobacco products is the single most effective strategy to prevent youth from beginning to use tobacco and motivating the nearly 70% of current smokers who want to quit to give it another try. This is not something we ask you to believe on faith. I was there in 2005 when we last passed a tobacco tax increase. The results were startling. We had one of the worst smoking rates in the country among young people. And we also saw that drop 60%, a combination of the tax increase and an effective and well-funded tobacco prevention and control program. In addition, the Tobacco Helpline saw record numbers of people calling and trying to get assistance to quit. Now, this is one of the reasons why the price increase has got to be significant. Small increases or incremental increases of 25 cents or so don't do anything. The tobacco industry eats that cost, comes out with 2-for-1 marketing, all kinds of other things to get around it. It's that significant increase in price that drives quitting and prevents kids from beginning. And again, congratulations to this legislature for equalizing the tobacco product line around taxes, because that removes a significant incentive to go elsewhere. In my decades of experience in tobacco policy, I've heard countless doomsday predictions from the tobacco industry and their partners, like you will probably hear today. Back in 2005, when the tobacco tax was proposed to be increased, the industry predicted mass smuggling and armed gangs would threaten law and order. Obviously, that didn't happen, but we're likely to hear that over and over again. I find that an insult to the law enforcement community in this state. Some of their more dire warnings were made about the very smoke-free laws we wouldn't consider overturning today. Their claims when these proposals were being debated seem ridiculous today, but here are a few. If we banned indoor smoking, they claimed the following would occur. There would be an end to public participation in town meetings. Juries would be unable to deliberate. Workplace productivity would tumble. Grocery stores and the malls would lose customers. Restaurants and bars would go out of business, and tourists would find other places to vacation. I urge you not to be fooled by their arguments and to pass LD 1423 as an effective strategy to address the increasing epidemic of nicotine addiction among our youth and to help those smokers who want to quit. Thank you very much. I appreciate your consideration today.
Thank you very much, Mr. Miller. Question from Representative Gramlich.
Thank you, Representative Terry. Hello, Mr. Miller. It's good to see you. I know you've been doing this work for a really long time, and I'm really looking forward to you being a full-time constituent of mine. I know that Ms. Schneider spoke about the healthcare costs, I was curious about getting a little bit more information around how this would offset in terms of, you said 800, I think you said $800 million in healthcare costs as a result of tobacco use. And I didn't know, with all of your decades of experience, if you had any additional data that would lend its way to our doing some analysis around how that would offset, how those costs could be decreased if we had less folks addicted to tobacco.
Sure, great question. Thank you. I think when you think about and you think about the cost decreases, a lot of times the legislature has to deal with an expense now and a savings down the road. And in some of these cases, you're talking about 20 plus years of someone who starts that may not get heart disease or cancer for 20 years. But I think it's important to also focus on the fact that there are some significant early gains that we can get. And some of those could come from pregnant women who smoke. And if you look at the data here in Maine about pregnant women who are main care recipients, their rate of smoking during pregnancy is significantly higher than those who are not Medicaid main care recipients. A focused effort on that particular population literally could recoup significant savings in a very short period of time. The cost of a premature infant, an NICU visit by a newborn, those are significant costs. So it's both a combination of short-term and long-term, and some of those long-term costs are very significant. I mean, someone who has a major stroke and is incapacitated and needs significant care, those are very high costs on a per person basis. So I think Hillary Schneider has probably more detail on it, but I think it's important to realize not everything we're talking about saving here is 25 years down the road. There are some early wins in this as well.
Thank you.
Any other questions for Mr. Miller? All right, seeing none, thank you very much for your testimony. Glad I'm keeping an eye on this list. It keeps changing. That concludes all of the folks that are here to speak in favor of LD 1423. We'll now start the list of those speaking in opposition, and we will start with Carl Abramson. And I apologize, I didn't promote anybody quickly enough. So Mr. Abramson is in cyberspace. Following Mr. Abramson will be Thomas Bryant.
Thank you. Can you hear me?
We can. How are you?
I'm good. Thank you. Thank you for allowing me the opportunity to testify before you all today. My name is Carl Abramson, and I'm here on behalf of Americans for Tax Reform, urging you to oppose LD 1423.
Mr. Abramson, do you have a video on your end?
I do not. It's not working at the moment. I'm sorry about that.
No problem. No problem. Go right ahead.
Thank you. This bill seeks to double the tax rate on cigarettes, cigars, and smokeless tobacco, as well as life-saving reduced harm tobacco alternatives like e-cigarettes and vapor products. It would have disastrous consequences for public health throughout the state of Maine and would do nothing to reduce smoking rates among disadvantaged populations. If the goal of this bill is to decrease smoking rates, then raising the tax on e-cigarettes and other vaping products goes against every principle of sound policy. Evidence has conclusively proven that e-cigarettes are 95% less harmful than combustible cigarettes, and they're more than twice as effective at helping smokers quit than other methods like nicotine patches or gum. As such, vaping has actually been endorsed by dozens of the world's leading public health organizations as safer than smoking and an effective method of smoking cessation. Extrapolating from a large-scale analysis, if a majority of cigarette smokers in Maine switch to vaping, Georgetown University Medical Center estimates that more than 27,000 premature deaths would be avoided. This would save lives and it would transform futures. When considering raising the tax rate on e-cigarettes, I urge you all to look at the mistakes that were made in Minnesota when they imposed a vaping tax in 2010 and then raised it in 2013. Researchers at the National Bureau of Economic Research, which is a nonprofit, nonpartisan research center, studied the impact that Minnesota's tax rate had on cigarette consumption and smoking cessation, and they found that Minnesota's tax prevented roughly 32,000 adult smokers from quitting the deadly habit of cigarette use who would have quit in the absence of that tax. They also found that if e-cigarettes and combustible cigarettes are taxed at the same rate across the country, the number of smokers who quit by the year 2030 will be reduced by 25%, which is roughly 2.75 million Americans. In addition to raising the rate on e-cigarettes, LD 1423 would double the tax rate on combustible cigarettes. Cigarette taxes are incredibly regressive, so they disproportionately impact members of disadvantaged populations, and 72% of smokers are from low-income communities. Survey data has consistently demonstrated that tobacco tax increases have no statistically significant impact on smoking rates in households earning less than $25,000 a year. Doubling the tax rate on cigarettes would be incredibly cruel as members of these communities struggle with the costs of the COVID-19 pandemic. You must understand that if they could quit, they would. Instead, LD 1423 would take more money out of their pockets at a time when they need it most. Additionally, tobacco tax hikes promote black markets and illicit smuggling, and the State Department has determined tobacco smuggling to be a threat to national security because the exact same multi-million-dollar crime syndicates that smuggle tobacco also engage in human trafficking, money laundering, and they use their profits to fund terrorism worldwide. Small increases in projected revenue, and I should acknowledge that few tobacco tax hikes actually meet their projected revenue, should never ever come at the expense of human lives. Bills related to public health must be evidence-based and they must be driven by data. This bill is not, and as such, I urge you to reject LD 1423. Thank you for your time and attention.
Thank you very much, Mr. Abramson. Questions? Seeing none, thank you for your testimony.
Thank you.
The next person up that we have on our attendee list is Kyle Feldman. Welcome, Mr. Feldman. Let's see. I have two Kyle Feldmans on the list, so I'm going to try the other one, see if that helps. There we go. Give it a minute. Mr. Feldman, are you with us?
I am. Can you hear me now?
Yes, we can. Welcome.
Awesome.
And if you have a video, we'd love to see you.
You got it.
There we go.
Good afternoon, everybody. Thanks so much for having me on. To the Maine Committee on Taxation. My name is Kyle Feldman. I'm a Vice President, National Convenience Distributors. NCD is a full-line convenience store distributor in the Northeast, selling grocery, frozen, refrigerated food, beverage, school supplies, health and beauty products, general merchandise, as well as tobacco and cigarettes. NCD is one of the largest privately held companies in the Northeast. Over the last 100 plus years, we have grown to over 25,000 customers, which include hundreds of customers in Maine. In addition to all of this, we are also a large tax collector in the state of Maine. This background is necessary for you to understand, and so you realize I am not a fly-by-night individual wanting my voice heard, or we as an organization are not only worried about revenue. Convenience stores whom I service are struggling. According to data from the National Association of Convenience Stores 2020, fuel sales were down 15.4% year over year. The same study showed transactions inside the store were down 12.9% compared to 2019. As we begin to rebound from the COVID-19 pandemic, there could not be a worse time to add additional constraints to the convenience retail channel. Every day I get the opportunity to interact with convenience store owners, many of whom are first-generation Americans, and one thing I constantly hear is, when will it end? When will local, state, and federal governments stop attacking their business models? LD 1423 is just the latest in the barrage of attacks on the business they work so hard to create. These stores work tirelessly to ensure that they are complying with all regulations around tobacco, food service, fuel sales, human resources, lottery, and countless others. If enacted, LD 1423 will put additional pressures on these owners and will do nothing to actually reduce tobacco use. If you don't believe me, I encourage you to look at New York. The state of New York has a tax rate of $4.35 per pack. That is comparable to what you're proposing. According to the McKinnock Center for Public Policy, New York ranks first in the nation in cigarette smuggling, with an estimated 53.15% of all cigarettes being smuggled into the state. The smuggling, because of a high tax in New York, has cost the state an estimated $1.2 billion a year. Just 2 weeks ago, 2 men in Maryland were arrested after investigators caught them smuggling more than 8,000 packs of unstamped cigarettes. What does Maryland have in common with New York? They just raised their cigarette tax to $3.75 per pack. There are literally hundreds of stories just like this, and I'm happy to share more with you at your request. It is illogical to increase our tax to $4 per pack, while states within driving distance like Delaware and Virginia have taxes of $2 per pack and 60 cents per pack, respectively. Criminal enterprises are anxiously awaiting the governor's signature on this bill. I leave you with this. Where there is a will, there is a way. Your options today are to vote yes on LD 1423 and knowingly increase dangerous criminal activity around cigarette smuggling in Maine, or vote no on LD 1423 and support convenience store owners who, like many other businesses, are just beginning to get their legs underneath after a tumultuous 2020. Thank you so much for hearing me. Please feel free to contact me at any time.
Thank you very much for your testimony. Are there any questions for Mr. Feldman? Seeing none, we really appreciate you being here.
Thank you so much. Have a great day.
Thank you. Next up is Brian following Mr. Foten handcuffs.
There's a driver on extension 1230.
Good morning, and good to help you. Is my camera on?
It is not.
Oh, here we go.
There you go.
Great, thank you. Good morning or afternoon now, Madam Chair and committee members. My name is Brian Foydick, and I testify on behalf of the National Association of Tobacco Outlets, a national retail trade association with many stores in Maine. On behalf of our Maine retail store members, we urge you to oppose LD 1423, which doubles the tax on cigarettes and other tobacco products. With Maine set to receive over $1 billion in federal stimulus funds because of passage of the American Rescue Fund, there is no need to consider raising taxes, including the proposed tax increases on cigarettes and tobacco products in LD 1423. Maine has also received over $1 billion in tobacco master settlement funds. The fiscal reality is that no additional revenue from cigarette and tobacco products is needed. These significant tax increases will encourage legal adults to find lower cost alternatives, with one option being buying tobacco products over the internet, a second option being crossing the border into New Hampshire to save over $22 per carton because of the tax differential, and a third option to turn to illicit sellers who already fill the demand for lower priced tobacco products throughout New England. Even if you believe increasing taxes is generally a good idea, this is not the time to think about further tax increases on the products that retailers sell. Retailers have struggled the past year. These kinds of tax increases may well be the last straw for many retailers, as their businesses, already severely impacted by large sales losses due to COVID-19 and stay-at-home directives, will lose even more sales and customers to cross-border sales, smugglers, and illicit marketers. This will raise the likelihood of employees losing jobs and stores weighing whether they can survive economically. It's time to support your local retailers, not to financially burden them with large tax increases. Finally, just as the last bill before this committee was a tax on the highest income Maine residents, this bill is a tax on Maine's poor. Increases in tobacco taxes negatively impact those residents least able to afford it. According to a 2019 analysis, 38.1% of Maine smokers reported income of less than $15,000 annually. Over 2/3 earned less than $25,000 per year. With more limited incomes, these adults will likely change their buying habits to find less expensive sources for their preferred tobacco products. Your consideration of our concerns in opposition to LD 1423 is sincerely appreciated. Thank you.
Thank you for your testimony. Are there any questions? Seeing none, thank you so much for being here today. We appreciate it. Next up is David Hancox. Following Mr. Hancox will be Chris Jackson. Welcome, Mr. Hancox.
Thank you. I'm David Hancox, and I was the Director of State Audits in the New York State Comptroller's Office. I've written and taught on issues focused on assessing government programs and policies such as the bill before you now. While R.J. Reynolds has compensated me for my time preparing these comments, the opinions expressed are my own, informed by my years of auditing government programs and policies. I've also submitted written testimony. While an increase in the cigarette tax might appear to offer a quick injection of cash to the state's coffers that affects only a small percentage of the state's residents, in implementation, such a tax is not good public policy. A recent study by the Thomas Jefferson Institute of Public Policy shows cigarette excise tax increases rarely generate new income to the taxing jurisdiction. And a cigarette tax, as has been mentioned, is a regressive tax that consumes a more significant percentage of the income of lower wealth citizens who are more likely to be smokers. What is certain is that increasing the price of cigarettes and all other tobacco products will result in a rising rate of individual cross-border sales, as happened the last time Maine doubled the cigarette tax. Today, a carton of cigarettes is $7.40 cheaper in New Hampshire than in Maine. A $2 per pack increase in Maine's cigarette tax will drive that price differential to $27 a carton, a nearly 60% increase. But the more insidious problem, as been mentioned, is the illicit tobacco trade driven by criminal groups and terrorist organizations. The black market for cigarettes is very lucrative, and the penalties for getting caught are significantly less than for other crimes. LD 1423 invites a smuggler to make tens of thousands of dollars by driving just one van load of cigarettes up I-95 into Maine, and as much as $1 million in profit from a truckload. The loss of a significant portion of the legal tobacco sales in Maine may cost your state jobs. Tobacco sales drive retail sales of other goods at small grocery and convenience stores. National data indicate that for every $8 spent on cigarettes, tobacco purchasers spend an additional $7 on non-tobacco products. Retailers will be forced to cut costs, wages, and even jobs. Some small businesses won't be able to cut enough and will fail. Finally, a doubling of the tax on all tobacco products ignores the benefits of making less risky tobacco products more acceptable to Maine's current smokers. If LD 1423 passes, Maine will have the second highest tax on vapor products in the nation, and the average tin of smokeless tobacco will cost more than a pack of cigarettes. Decreasing consumer acceptability of these products limits the benefits to your citizens of the science on tobacco harm reduction. That cannot be in their best interest, and I'm sure that cannot be your intent when considering the increase in cigarette taxation. So please consider all the unintended consequences of this proposed tax increase on your citizens. Thank you for your time, and I'll answer any questions you may have.
Thank you for joining us today, Mr. Hancox. Are there any questions? Seeing none, thanks very much for being here.
Thank you.
Next up is Chris Jackson. Following Mr. Jackson will be Kevin Colangelo. Welcome, Mr. Jackson. Nice to see you.
Hi, Representative Terry. Nice to see you as well, and Representative McCrade and other members of the committee. I am Chris Jackson. I'm a resident of Bodenham, and I'm here today on behalf of the Cigar Association of America in opposition to LD 1423. I'll be very brief. I didn't submit any written testimony as I wasn't sure we were going to offer much testimony today, but I'm glad I did sign up. I wanted to mention a couple of things and happy to try to answer any questions if there are some from the committee. It should go without saying that the Cigar Association is adamantly opposed to youth usage of cigars, and its member companies have adopted practices to curb usage in adolescents, such as working with retailers to use the We Card services while tailoring advertising to adult audiences only. And these practices have been successful as youth usage rates are now at an all-time low. I mean, simply put, kids really don't smoke cigars. That's one point I wanted to make. The other point I wanted to make is, we've heard multiple times today that there hasn't been a cigarette tax increase in 15 years. But that ignores the fact that just in 2019, the legislature passed a tax increase on cigars and other tobacco products. The ink on that law is barely dried, as it just took effect last year. It also, as you've heard, paired cigars and OTPs with cigarettes. So a doubling of that tax now is it's simply unwarranted, and it's not necessary. So I want to make those 2 points, and then I'll close with a brief anecdote. recently I was in a cigar retail store in one of Maine's lovely downtowns, and I talked to the purveyor, and this piece of legislation came up, and I told him, you might want to get involved, and he sort of shook his head and he said, it just might be the incentive I need to, retire and close up the shop. And this is a store that's been on this particular Main Street for almost 30 years. Now, some people testifying earlier today, they may say that's playing on, your worst doomsday fears. I'm just simply relaying a story from one retailer who's thinks, enough is enough, and it's just simply not sustainable from his perspective. Happy to try to answer any questions, and I just wanted to get those points out to the committee. And thank you very much for your time and patience today.
Thank you very much, Mr. Jackson. Does anyone have any questions? Seeing none, thanks. It's good to see you.
Nice seeing you guys. Thank you so much.
Next up is Kevin Colangelo, followed by Christopher Jackson. Thank you for differentiating between Chris and Christopher. I don't know if that was intentional. Mr. Colangelo, you're up. Mr. Colangelo, are you with us? Silence. Okay, well, maybe we can try to get him to work magic on his computer. And in the meantime, we'll hear from Christopher Jackson from Shapley. Welcome, Mr. Jackson.
Good afternoon, representatives, members of the Taxation Committee. One day I may be as well versed as the Mr. Jackson before me. Today you may hear a little bit more of a raw emotional testimony. I am a small business owner in the state of Maine. I have several tobacco specialty stores, and it's been a bit of a 1-2 punch. Yesterday, the Health and Human Services Committee, as you heard, is proposing a bill to knock out all flavored products, tobacco products across the state. So immediately about 80% or more of the products that specialty stores are going to be, it's not looking good for it, essentially. So we already pay an astronomical 43% tax on vaping products as it is. It's become tougher and tougher for the middle class workers of Maine to obtain these products. And quite frankly, we hear stories of them just traveling down out of state, cross state lines, and purchasing their products at a much lesser rate. Essentially, it's affecting the people, those north of Augusta and then some. So the problem with 1423 is it's a very unjust, large blanket tax that is far too broad in my eyes. There is no breakdown of this bill, which would distinguish the differences between vaping products and their components versus tobacco products. I've heard a few people talk about rolling tobacco today, and it is taxed per ounce. So just like a pack of cigarettes may be taxed $2, there's no difference between a, say, inexpensive pack of cigarettes and a big name brand. It's $2 a pack, plain and simple, versus if I pay $100 on a device, I then immediately pay $43 Maine state vapor tax before I even sell that product. And now we're looking at even doubling that. So you'll hear from many people, this past year was quite a struggling year for many people. And on top of that, we dealt with that 43% tax. So now we're looking at doubling that again. And I hear a lot of hypotheses and estimates on how much money that the state will get from gaining increased tax. And quite frankly, with a large chunk of these products looking like they're going to be taking off the market, those numbers aren't going to be reached. There's other ways to prevent youth tobacco preventions. And right now, this bill is missing the mark in just about any way. If you take a look at New Hampshire, they have a very clear, definitive way of taxing their products. They tax their closed systems products per milliliter, and then their open bottles of liquid by 8%, as to where we are already at 43%. This is a serious issue here, and quite frankly, I hear a little bit too many hypotheses and things of what we think and money we're going to get and allocate towards other things, when in fact, at the end of the day, is we do have healthier alternatives that we can provide for adults. And unfortunately, we're going to increase those prices to a point where they're just going to cross state lines. So this bill is missing the mark. And I'll leave on this. As far as preventing youth access to this by increasing the products, the only consumers you truly are harming are the middle class working Maine adults that purchase these products, because the youth, they have very few bills. They don't have the mortgages, the health insurance, and the bills that the adults have. So if they have to save an extra day's worth of lunch money or money that they got from mowing the neighbor's lawn, that's what they'll do. I was 14 years old and obtaining tobacco products, combustibles, and it didn't stop me. I'd save my lunch money for a couple days and then have one of my friends go purchase those products. So I think it's a failed policy. And right now, the last thing the state of Maine needs to do is push more business to other places. So I'll end with that and answer any questions you may have.
Thank you very much, Mr. Jackson. You were quite elegant.
Oh, thank you.
Representative Bickford.
Thank you, Madam Chair, and good afternoon, sir. My question is, do you believe that if Maine really wanted to address the smoking problem, they would just ban tobacco?
Well, I would assume so, but I mean, we have a huge alcohol problem throughout the country, let alone the state, but we don't ban the alcohol. I believe there's a huge substance abuse issue with the state of Maine. And it does start with gateway drugs such as marijuana. And quite frankly, you can go to any corner and purchase marijuana. But for some reason, marijuana, alcohol are acceptable. And I have a hard time believing that they're acceptable because maybe some members of the committee or people we may know use those products and they don't have issues with them. So they don't feel a need to try to regulate them more. So taxation of this rate's higher than any of the alcohol or marijuana taxes right now. And I'd be pleased to hear some examples of anything else that you're taxing to this degree.
The reason I'm asking is I just want to know if you believe that this is just a cash grab by the state.
Of course it is. It's a cash grab by the state. I believe the marijuana thing is a cash grab by the state. I believe other things are just cash grabs by the state to allocate money towards other things. And I see failed policy here, and I see that money that does get taken from taxes such as this or increased other taxes aren't being appropriated to the correct organizations or things as they should be. Just like in any other government, unfortunately, money seems to sift through the fingers pretty quickly in organizations.
And are you aware that Fund for Healthy Maine actually pays for daycare expenses?
I am aware of that, and I don't know. I don't see how that relates. I'm not a psychologist or a professional, but I see the ball being dropped there, and that's probably just one of many if you dive down into the heart of this policy and see where money is truly allocated.
Great, thank you.
Thank you.
Representative Perry.
Thank you, Madam Chair. Thank you, Mr. Jackson, for your testimony. Just a question as a business owner, what's tougher for you to deal with, an excise tax or a sales tax?
Well, it's the tax that we're paying on these products essentially. So when we purchase a product at a wholesale value, we pay that tax. And as of this past year, it's the 43% tax that we're paying before I even sell that product and get it off my shelf. So it's been extremely difficult, especially during the time of a pandemic. People want to be out less in public as much as they can. So paying a price that high on a device or a product, 43% before we even get it off the shelves, it's pretty straining. And we've done our best and stayed open throughout the pandemic, keeping many employees employed, earning a living and taking care of their family. But it's certainly that 43% tax is the biggest hurdle to get over.
I mean, when excise taxes, you lay the money out up front and it sits on your shelf until you sell it. The sales tax, you don't remit it until you've collected it. So I would think excise taxes are pretty tough to absorb.
That is correct. Yeah, it's been pretty painful, especially over the past year. So this doubling the tax now couldn't come at a worse time. I don't think there's any good time for a tax like this, but especially right now.
Any other questions for Mr. Jackson? Seeing none, thank you very much for your testimony, and we'll give Mr. Colangelo another shot. See if he's with us.
Can you hear me now?
Can, yes. Nice to hear you.
Okay. Thank you. Sorry about that. I was in a conference call. Hello, tax committee members. Thank you for the opportunity to speak today. Again, my name is Kevin Colangelo. I work for the Rusty Lantern chain, and I'm writing to you as a resident and a small business operator in Brunswick, Maine. So our business operates 18 stores across Maine, New Hampshire, Massachusetts, and employs around 150 Maine residents. I'm disappointed to hear that the Maine state legislature is considering doubling the excise tax on cigarettes from $2 to $4 per pack and doubling the excise tax on smokeless tobacco and all other tobacco products. I urge you all to oppose this measure. Our state legislature is already considering a flavor ban on all tobacco products, causing millions of dollars in revenue loss as we speak. Rusty Lantern employees are all required to watch the No Butts retailer training program even before getting on the register. We also, on a monthly basis, test all of our employees for the correct policies for checking IDs to prevent the sale of tobacco to minors. Rusty Lantern takes this seriously and continues to train our employees at all levels to help prevent this from happening. Maine small business owners have struggled to keep their doors open during this prolonged economic slowdown. Not only have gas and in-store sales been impacted, but I've also had to invest additional safety measures, resulting in unforeseen costs, negatively impacting our bottom line. This extreme tax hike would jeopardize a significant portion of our revenue and, quite frankly, could force my business to close its doors in some facilities. LD 1423 will also drive our current business across the border to the neighboring state of New Hampshire. This impact would be devastating to our bottom line. My convenience stores are very important to the state of Maine. They employ a very large amount of people from Ashland to Kittery, Maine. When you drive the taxes up, people will find other sources like neighboring states with less taxes or buying from a van who pays no taxes at all. This tax hike on cigarettes, smokeless tobacco, and other tobacco products would hurt Maine small businesses, and the current economic crisis has already hit us all very hard. Please do not forward with such a tax increase. I urge you all to vote against LD 1423. Thank you for your consideration, and if you have any questions, I'd be happy to answer them.
Great, thank you. Representative Perry has a question.
Thank you, Madam Chair. Thank you, Mr. Colangelo. How much would $2 more per pack or $20 per carton increase your inventory costs throughout your chain of stores? Money you'd have to put up front.
So, good question. So currently we probably have about 300 cartons per location. So you're looking at a $6,000 inventory adjustment. That is a huge investment when you look at the number of stores across the state of Maine. That for us is very, is hard to swallow. And, you know, when you look at the amount of money we make on those categories from a retailer, it actually diminishes that to a smaller percentage across the board. So we would not be very interested in having that approach.
And then I did want to do a follow-up if I could. What if it's not too personal information? What is the profit margin on a pack of cigarettes in a store like yours?
We average probably about 15% across the board. But keep in mind, the actual profit when I sell it out the door is about 5 to 7% based upon the manufacturer rebate, which I don't get back for 4 to 6 weeks. So I'm weighing out that money substantially and not getting it back for 4 to 6 weeks.
Can you run your business on a 15% gross margin?
I can't pay the bills on any facility unless my gross margin averages 32% per facility.
Thank you.
Thank you.
Any other questions for Mr. Colangelo? Seeing none, thank you very much for your testimony. We appreciate you being here.
Thank you.
Next up is Michael Madden, and following Mr. Madden, Dr. Madden, sorry, will be Jessica Harrigan. Welcome, Dr. Madden.
Great, thank you very much for having me. Excuse me, my name is Michael Madden, and I'm a family doctor and former chief medical officer of a multi-state Medicaid company. I've been practicing medicine for over 36 years and have worked extensively on issues like opioid addiction, HIV, and smoking. I also can identify with Representative McCreight, as I too lost a parent to smoking-related illness, which is why I am passionate about finding ways to help adult smokers quit or find safer ways to deal with their addiction. Although Reynolds has compensated me for my time in preparing this testimony, the opinions expressed are my own. I've submitted detailed written testimony that I urge you to review, as the data presented may be new to you. I speak in opposition to LD 1423, which would result in a doubling of the tax on all tobacco products, including smokeless tobacco products and e-cigarettes. I urge you to consider reflecting science-backed tobacco harm reduction policy in Maine's tobacco tax structure. Non-combustible tobacco products present an enormous opportunity for tobacco harm reduction, and a 100% increase in taxes imposed by the state on these products disincentivizes their use among Maine's adult cigarette smoking population. Harm reduction is a public health principle employed to mitigate deadly health risks, such as methadone for opioid addiction and condom use to decrease HIV cases. While not reducing risk to zero, harm reduction substantially improves safety and saves lives. Smokers die prematurely not because they consume nicotine, which is not a carcinogen, but because of how they consume it in a combustible form. For example, moist snuff users experience significantly lower risk of disease than smokers. And leading health authorities have agreed that vapor products may substantially reduce smoking's harm. A yes vote on LD 1423 would double the taxes on all tobacco products in Maine. This means that less hazardous smokeless tobacco products will be in fact more expensive than a pack of combustible cigarettes. And a tax on e-cigarettes jumps to 86% of their wholesale cost. This would be the second highest tax rate on nicotine vapor products in the nation. A risk-tax tobacco tax structure that levies the highest taxes on the more dangerous products, combustible cigarettes, and the lowest taxes on the less dangerous products like vapor and moist tobacco would reflect the science underlying true tobacco harm reduction. A body of evidence from leading health authorities indicates that vapor products are 90 to 95% less harmful than cigarettes, and decades of scientific research have established that oral tobacco products pose substantially fewer health risks to users than cigarettes. Some may take the position that LD 1423 will reduce youth use of tobacco products. However, education and enforcement of both state and federal law prohibiting the sale of tobacco products to those under 21 are the proper tools to address youth access. And it appears they're working. Fewer than 5% of teens report daily smoking, the lowest level ever measured. And despite an increase in 2018, teen experimentation with vaping, any use of vapor products in the last 30 days dropped by 1/3 in 2020. The implications of raising tobacco products are complex. You must vote no on LD 1423, a broadly sweeping tax increase that ignores the science of tobacco harm reduction. Thank you very much. Happy to answer questions.
Representative Kryzak.
Thank you, Madam Chair, and thank you for being here, Doctor. You were talking about a lot about the science of that you checked into smoking and everything. Could you explain to me why the president came out with banning the menthol cigarettes as opposed to all cigarettes, if that's what he was looking for?
I have to be honest with you and tell you, I was not privy to the policymaking choice related to that. I do think that across the board flavor bans are a bad idea. It would be very exciting if it was only pertaining to combustible cigarettes but didn't apply to vapor or moist snuff. I mean, that would be a great way to move people, I think. But I was not personally privy to the thought process the president had in that.
So there is no science saying that combustible menthol cigarettes are worse than just regular tobacco cigarettes? I just trying to find out. I'm curious why.
No,
you picked that one thing.
menthol cigarettes are not more dangerous than non-menthol cigarettes. They may make it easy. It's a smoother flavor and may make it easier for some people to start, but they're not necessarily inherently more dangerous than other combustible cigarettes. But combustible menthol cigarettes are definitely more dangerous than menthol vapor products.
Okay, thank you.
I have a question, Dr. Madden. Did you say that 5% of kids reported smoking something?
Yes, that's the lowest level. They do it. The National Youth Tobacco Survey measures the rate of kids who smoke or vape or other things on an annual basis. And it's shown a steady decline for many, many years now, and currently is at the lowest percentage ever at 5%.
So, and that's nationwide.
Nationwide. I don't have specific Maine data, just have the national data.
So the marketing cost, or the marketing price, I should say, in Maine, we've been told is about $45 million from the tobacco companies to market, generally speaking, to children, because that's where the habit starts. So Maine has quite a high rate of marketing, and our numbers for children smoking is a little bit higher than that, I believe. And I think that that's a big chunk of why we're attempting to do this. So do you know then on a nationwide level how those numbers are so far down? Because we do know that there are several other states that do charge taxes higher than we do. It makes it more difficult for kids to smoke. So, like,
the great success story on smoking rates for adults and kids is a reflection of better education and recognition that these are dangerous products. And so, but I think the exciting news about those trends is that they are continuing to go down despite the valid concern about the rate of youth vaping. A lot of people have said vaping is a gateway drug to cigarettes. Doesn't make sense if the rate of youth smoking is lower than it ever has been.
Okay, and we've seen evidence on the news, if nothing else, about the fact that vaping is indeed not the greatest thing for your lungs, especially young lungs. There was a story on the news this past summer of a boy who got COVID, who he was vaping, got COVID, and had to have his lungs replaced. There's evidence all over the place that vaping is in fact not good on your lungs. It leaves coats of oil on your lungs that are not good for you. I'm a former smoker myself, so I know that I can feel the difference between smoking and not smoking on my lungs. So I guess I would like to hear how that's working in the medical community.
We'd be happy to share with you for your working session some additional data on the real story about the relative risk of vaping and smoking. As unfortunately, the news often likes to tell bad news. And I also caution you against paying too much attention to a single case, but encourage you to look at scientific studies more broadly. There's no doubt that youth probably did have damage to his lungs, but I would suggest that it wasn't the vaping that did it, it was the COVID that did it. And it's not really clear, and there's not good scientific evidence, frankly, that vaping does substantially increase your risk of COVID. Anything going in the lungs may, but again, my point is not that vaping is risk-free. My point is that vaping is much less risky and much safer than smoking cigarettes.
Yeah, And my final question for you is, you know, like occasionally I'll take my kids to the doctor. I'm thinking of one time in particular where they needed, one of my girls needed steroid inhaler because she was having a hard time breathing. Her allergies were really over the top, and it was a very expensive medicine. And our pediatrician gave us a coupon for that. Would it be something that would you know, vaping coupons be something that doctors would be interested in being able to hand out to their patients that are trying to quit? Is that something that would, because that would, we would be able to put the tax in, and then those that are, you know, in need of it for medical assistance would be able to take that out?
Well, it's important to point out that they are not currently approved as a smoking cessation tool, okay? However, the New England Journal had an article a year or so ago that it doubled the quit rate for the people who vaped versus those who just use other nicotine products. So that, and happy to give that to you for your work session too. But so it's probably jumping a little bit ahead to have physician coupons for vaping versus other nicotine replacement products until the FDA were to approve them as a tobacco cessation tool. However, smokers are voting with their feet. And in many cases, about 30 to 40% of smokers' last quit attempt was to use vaping as their quitting agent.
Yeah.
But it's a fine line between an FDA-approved product versus what the smokers are doing on their own.
My
Different
mother is
than
one of
near
those.
beer for somebody who has an alcohol problem, or other ways that people move their own cessation attempts forward.
Yeah. My mother is one of those folks, and the stroke that she had was really the straw that broke the camel's back on her quitting.
Right. Well, there's no doubt, you know, combustibles are dangerous, and that's why, to me, it's very important to get the word out that vaping is much less dangerous than combustibles.
Right. Representative Perry.
Did you call on me, Madam Chair?
I did.
My computer froze. I wanted to follow up on what you had to say, Madam Chair, because it seems like early on in vaping, there was a lot of stories and concerns about significant damage being done to young lungs. And it seems as though, I don't know what goes on in these vape shops with these little jars and stuff, but it seems like Juul and Vuse is kind of what the market has settled on. In early on, it seemed like it was stuff, cheap stuff, bulk stuff coming from China or kind of non-regulated places that was they were using some sort of mineral oil or something in it. Has that largely been cleaned up? And if Juul and Vuse and whatever become too expensive, is there a risk that people would go back to these problematic vapes?
One thing that hasn't been said today is that all of the products are now under review by the FDA in the PMTA process. And so any product that has not submitted data to the FDA by last September has to be taken off the shelves, and the FDA has taken action against a number of companies that were still promoting products but not submitted that information. So in the very near future, the FDA is going to rule on all the vaping products about whether or not they provide a net public health benefit. So in some ways, you know, things like flavor bans and things may put your state at conflict with what a product the FDA has approved as having a net public health benefit. So to answer your question, has the issue of if you want to call it black market or illicit or poorly constructed vape products been eliminated? To a large extent, yes, in real stores, but certainly not on street corners.
Thank you.
Representative Collings.
Yes, thank you, Dr. Madden, for spending some time with us today here in the Taxation Committee. I just wanted you, if you can, to confirm some things that I have read that through the Surgeon General, that 9 out of 10 people that smoke started smoking before 18, and 80% of those people would smoke the top 3 cigarette brands that were advertised. And then the last part about the smoking from the Surgeon General is that they have stated that office has stated that when tobacco prices increase, it is a useful deterrent, especially for the very youngest kids. It has some effect on young adults, but it has a greater effect on even younger people. Do you agree that is accurate?
Okay, you asked about three things there, so I hope I hit them all. Do most people begin their smoking habit when they're young? Yes. Frankly, just like most other habits we begin when we're young. But yes, most people do begin their smoking habits when they're young. Do tax increases decrease smoking rates or smoking initiation? There certainly is some data about that. I think what's being discussed now, though, is whether we've reached the ceiling on that strategy. And I don't think anybody has the clear answer to that at this point. But I would strongly encourage you to think about, as I said in my testimony, not making a blanket increase. Increase the taxes on the more dangerous products, combustible cigarettes, but don't touch the tax on the safer products like moist snuff and like vaping. And that would be, I think, a very progressive and a very smart strategy. And to reinforce that, you should know that encouraging smokers to vape instead of smoking cigarettes as a tobacco harm reduction strategy is the stated policy of the health world, public health world in England and in New Zealand. So there are progressive government entities that are encouraging tobacco harm reduction with vaping. I don't know if I got all your questions.
You did. Can I have one more follow-up question, please?
Yes.
Madam Chair, thank you. Yeah, I wanted to go right to vaping here. Some recent data, later in 2020, I don't know if there's anything more recent, you know probably better than I, did a comparison between 2017 and 2018, and they said there was an alarming increase of young people vaping. And it stated that it jumped up from about 11% to 20% in that time, and that well over 3 million high school students are reported to be vaping, and that could be increasing. They also, it was stated that to some extent, there's been some studies that vaping to some extent is more harmful than the traditional, cigarette smoking, especially with blood flow to the heart and so on. So if people are stating that vaping might be a good way to reduce smoking cigarettes, are you concerned about the growing rate, though, among young kids and some of the effects it may have on the heart and other systems?
Let me address youth first. Yes, there were significant increases in the rate of youth experimentation with vaping. And that appears perhaps to have peaked in 2019. The 2020 National Youth Tobacco Survey data showed that the rate of youth vaping, any vaping in the last 30 days, fell by a third between 2019 and 2020. So still a concern. And you should know that Maine and the federal government, that was the reason they increased the age at which you could buy tobacco products to 21. I would strongly encourage you to focus your efforts on aggressive enforcement of the 21 law if youth access is a big deal to you, as well as education, because there's no doubt young people should not use these products. Very definitely true. Related to the relative risk of vaping versus cigarettes, there really is not any credible evidence out there that I have ever seen, and believe me, I read this literature all the time, that would say that vaping is worse for your heart or certainly worse for your lungs than combustible cigarettes. The Royal College of Physicians in England says that it's 95% safer than tobacco cigarettes, than combustible cigarettes. So there really isn't good credible evidence that vaping is more dangerous than cigarettes. Is it more dangerous than air? Probably, but there's no evidence that it's more dangerous than cigarettes.
Any other questions for Dr. Madden? What air? That's what I want to know. Where?
Well, that's a good point. Yeah, I should qualify that. You're absolutely right. Stay away from Los Angeles air. Yeah.
Any other questions for Dr. Madden? Seeing none, thank you for your testimony and for answering.
Thank you very much.
Appreciate it. Next up is Jessica Harrigan, followed by Jessica Harrigan is Christine Peters. Welcome, Ms. Harrigan.
Hi there. Thank you very much for your time.
Sure, if you have video, we'd love to see you.
Okay. Oh. Sorry, I'm new to this. I apologize.
That is totally okay.
All right.
Hi, welcome.
Thank you very much. Thank you, Chair Chipman, Chair Terry, and members of the Joint Committee on Taxation. My name is Jessica Harrigan, and I am District Manager for the Cigarette Shopper. I'm responsible for 11 of Cigarette Shopper's tobacco-only stores in Maine. My store employ approximately 40 employees. As most of our revenue is from tobacco products, doubling taxes on them would make it very difficult for these stores to remain profitable. In order to stay in business, we would need to cut back on staff hours, either by laying off workers or reducing their hours. For some location, that might not be enough and might need to close permanently, excuse me. Our employees need their jobs. They have bills to pay and families to support. Doubling the tax on one kind of legal product is not only unreasonable, but unfair. This almost feels like taxation without representation because the voice of our employees may not be heard. Moreover, LD 1423 will not have any impact on tobacco consumption in Maine. It will take sales from legitimate Maine retailers like Cigarette Shopper and shift those sales. Excuse me, I apologize. Shift those sales to New Hampshire, where cigarette taxes would be more than $22 a carton less, or to illegal unlicensed sellers who will give them to in New Hampshire or wherever else they are legal. Bring them into Maine and then illegally sell them to whoever has the cash to buy them, including kids. Taking revenue from legitimate Maine businesses and giving it to New Hampshire retailers or criminals sounds like a bad idea to me. It's not in the interest of my employees whose jobs would be in danger if this bill passes. Please support Maine businesses and oppose LD 1423.
Thank you very much. Are there any questions for Ms. Harrigan? We appreciate you being here so much. Thank you. And don't worry about the multitasking. We all do it. Oh, actually, sorry, there's a question from Representative Perry. There you go.
Thank you, Madam Chair. Thank you for your testimony today. It's not so much of a question, but 30 years ago, I worked in wholesale, and the wholesale I worked for is the same family that owns Cigarette Shopper, Ken's father. And we were told when cigarette tax went from $1 to $2, so the impact it was going to have on the wholesale industry. And quite frankly, that is what occurred that caused this consolidation to where we have one wholesaler basically to choose from today, and prices on everything has gone up on everything since we lost competition in wholesale.
Not a question.
Okay. All right. Thank you.
Very much for your testimony. We appreciate you being here. Next up is Christine Peters. Following Ms. Peters will be Anthony Scott. Welcome, Ms. Peters.
Hi. Good afternoon. Thank you for allowing me the chance to testify today. My name is Christine Peters, and I am the Chief Operating Officer for the Maine Smoke Shops. We are an employee-owned company that sells tobacco products. We have 17 stores throughout the state of Maine, and we employ over 80 employees. We train all of our employees to check IDs. We are an adults-only location. So a person under the age of 21 is not even welcome in our stores. They can't buy a candy bar, they can't buy Pepsi, they're not welcome in. We ID at the door, so we're not advertising to minors in our locations. And I'm speaking to you from a former smoker myself. I haven't smoked in a year. I quit during the pandemic. And my mother lost her life at 54 to lung cancer. I have 2 adult daughters that do not smoke because I educated them very hardly not to make the same mistakes and choices that I made at 15 when I stole my mother's cigarettes when she was sleeping. I was not targeted by the tobacco companies. I made a bad decision and followed what my friends were doing, and I stole my mom's cigarettes. And I want to speak to you from my employees and from my customers. A lot of my customers this week have told me that it doesn't matter how much you raise the taxes on cigarettes. They will travel to New Hampshire. They have relatives that live out of state that will have their relatives send tobacco products through the mail, even though you're not supposed to. They will do it. I've worked for this company for 20 years. We saw in 2005, we actually had a store that was in the White Mountains, and we had customers that were from our Portland location, our Scarborough location, our Augusta location, that would make the trip to our New Hampshire location once a month to buy their products for themselves, their neighbors, their relatives. People were buying them online. They would open PO boxes and have them shipped. There was a lot of that going on. My regular customers told me they were doing it. They would stop by to buy the occasional pack of cigarettes when they used to buy their carton of cigarettes from me. And they apologized, but they were not going to pay your taxes. Our customers also feel like they're discriminated against. As you know, nicotine is an addiction. They feel like there's other things that could be focused on, like the opioid addiction. And it's always the smokers, it's always nicotine that's targeted. I know that business will be driven to New Hampshire. I know that you'll be told otherwise, that it won't, but I can assure you that it will. Again, in 2005, we saw it happen. And it will affect many, many businesses. So I'm asking you guys to look at other ways to gain revenue and not pass this bill. Stop targeting people that smoke. They're tired of it. Thank you.
Thank you for your testimony. Are there any questions for Ms. Peters? Thank you very much. We appreciate it. Next up is Anthony Scott, followed by Mr. Scott will be Jonathan Scher. Welcome, Mr. Scott.
Hey, good afternoon. Senator Chipman, Representative Terry, and the members of the tax committee. My name is Anthony Scott. I'm here representing Portland Smoke and Vape as an owner. So I want to start today. I've heard a lot about the cigarettes and how it hasn't been taxed since 2005. And to separate a little bit, I'm more concerned over the vape industry and how the tax increase will affect our businesses as well as vape customers and discouraging them from using a safer alternative. So if the objective of this bill is to decrease youth use and get people away from smoking cigarettes or a harmful product, then increasing the tax across the board on vapor products as well from 43% to 86%. Some of these devices are far too expensive for people to begin vaping. And a lot of the more expensive devices actually have far less nicotine, and they contain a different type of nicotine than what is traditionally found in Juul pod or Vuse pod, which is a salt-infused nicotine, which spikes your nicotine levels and mimics what a cigarette does. And that's typically something that's targeted by these groups that are running campaigns against the vape industry. Right now, we're also, the state is proposing a flavor ban. It looks like, well, it was passed through, and recently, I believe it was yesterday, the governor office put out a proposed budget to give $32 million from the general fund so that they can get rid of flavored tobacco. It just seems irresponsible that we're sitting here today and talking about increasing taxes on an industry that you don't need our money. Now you need our money to help fund the state. We were all here during the pandemic, work in the stores, frontline workers, whether you consider us essential or not. We were here. we paid our taxes. We contributed to the fund. We paid our payroll taxes. I have employees that their livelihoods depend on their jobs. And not only that, we gave tax money to the state, and now you want to increase the tax on us because other businesses are opening their doors now. It just seems unfair. We paid our fair share, and I'd like to reiterate that just last year, it took effect January 2020. The vapor industry just started a 43% tax, where that was the first time they've been taxed. It's a new tax. And then a year later, another tax is being proposed to double that. What other industry has had to sustain something like that to increase their, it affects our bottom line. We have to pay for that product ahead of time, the tax on that product to get it in our door. And now it just seems like this is a way to suffocate the vaping industry. And you're going to basically put the whole market in big tobacco. We're not big tobacco. Vape shops, they're not big tobacco. And if that's the target of this, then this bill doesn't do what you're looking to do, or whatever the sponsors of this bill are trying to do. I ask that you take a look at maybe separating out vape products from cigarettes, because if you're going to increase cigarettes to deter people from doing it, let them have an option to vape on something that's less harmful. Don't increase the tax on the vape products, and give them an alternative that's safer for them. I welcome any questions, and thank you for your time.
Thank you very much for your testimony, Mr. Scott. We appreciate it. Are there any questions? Seeing none, we appreciate you being here. Thank you. Next up is Jonathan Scher, followed by Mr. Scher will be Mike Sherwood. Welcome, Mr. Scher. I hope I said that right.
You did. Nicely done. Thank you, Chairwoman. Nice to see you, and nice to see the members of the committee. Thanks for taking the time. I'm John Scher. I'm the Executive Director of the New England Convenience Store and Energy Marketers Association. So I've listened to most of the testimony this morning. It's funny, it actually sounds a lot like a health committee hearing with everyone attacking or defending tobacco or vape. And maybe that's to be expected given this particularly polarizing product. But I do want to try to target my comments to more of a tax issue in the particular policy. That said, I think a lot of the remarks I was planning on making, you've heard. So I just want to touch on a few of the ones that I consider perhaps most important, at least from my perspective. According to the National Association of Convenience Stores, there are over 1,000 convenience stores in Maine that employ over 16,000 people. And while I don't know where every single one is across the state, I would be willing to bet that there is at least one in every single one of the communities that you represent. And for reference, 89% of the cigarette sales are made through convenience stores. So, and again, nationally, these products, tobacco in general, not just cigarettes, but tobacco in general, represents about 1/3 of the sales. So we're talking about something that's fairly significant. We're also talking about something that really targets, and certainly the vape and the vape shops, needless to say, but really targets one particular channel of retail more than any other with respect to how it would impact retail. The Mackinac Center for Public Policy is really kind of the authority on this issue in terms of tax and the tax burden. In their report called Cigarette Taxes and Smuggling, they identify New Hampshire as the #1 export state in the country. And so this bill would make the tax rate for at least cigarettes more than double what it would be in New Hampshire, which really creates a very attractive incentive for people that are either willing or able to go to that state and pick up the product. So for anybody that suggested that that isn't going to happen, it's just not really based in fact. It's just too much of an incentive. LD 1423, as you know, doubles the tax rate for all tobacco products. But youth aren't using tradition. I heard somebody, I think it was the doctor who spoke earlier, he spoke to this, that youth are really not using traditional tobacco products in significant numbers relative to vape. The National Youth Tobacco Survey that he referenced reports high school youth report using cigarettes in the last 30 days at a 4.6% rate. And he was right. It's the lowest in, I think, ever, certainly decades. And moist smokeless is at a 3.1% rate. Vape is at 19.7. And I'm not pointing that out because I think the vape tax rate should be doubled. I don't think it should. I'm doing it to demonstrate that if the effort is to reduce youth initiation, you're painting this tax paints with far too broad a brush and really would impact adults disproportionately. As it relates to tax revenue generation, Maine already collects north of $140 million a year from tobacco revenue, and appropriately, to your credit, funds tobacco control programs at over $15 million a year. So if the state really wishes to dedicate more money to tobacco control, you've already got the funds to do it. You don't need to collect more to do it. You've got plenty of money to throw at tobacco control or any other new types of programs. And the last thing I want to say is, I heard about somebody earlier, just before me, in fact, I think mentioned that tobacco is an addiction. And I find it ironic, and I have to point this out to you, I find it ironic that when it comes to things like purchase, use, and possession laws that would kind of target youth that are using these products illegally, frankly, those are frowned upon. But when it comes to taxing people to use those same products that they may be addicted to, we look at it through a very different lens. And I just think that that's ironic, and, to be perfectly frank and respectful, a little hypocritical. So happy to answer any questions.
Thank you very much, Mr. Chair. Looks like we have a question from Representative Perry.
Thank you, Madam Chair. Just a quick question here. I'm in the convenience store business, and I think your numbers are likely spot on, with tobacco being about a third of the sales. But I would say those tobacco sales actually drive about half the sales, because the things they buy when they come in for tobacco, they're not likely to stop in for if they didn't need the tobacco. Do you have any numbers to back that up? And that's my anecdotal guess. Do you have any exact numbers on that?
I don't have them off the top of my head, but I can assure you that what you're referring to is the market basket. And as you well know, the tobacco customer is among the most loyal, one that comes in every day in some cases. And when they're in, they're buying, and they're very loyal, staunchly loyal to their stores. And so when they come in and buy that product, they're often buying other products to go with it that are taxed. And so if we're pushing those customers outside of the regulated market because it's just far too expensive, we potentially push away other taxable products. And it does damage to the store that may be paying property taxes and all sorts of other labor-related taxes. So it definitely has a multiplying effect, and I'm glad you pointed it out. Thank you for the question.
Representative Kryzak.
Thank you, Madam Chair. Thank you for being here today. Did I understand you to say that we already have a lot of money in forced cessation programs? Is that from the settlement from the tobacco companies?
So two parts to that question. Just on tax-related revenue from the sale of all of the products that we're talking about, the state collects, I think in the latest census, a little over $140 million. And the number where I got the $15 million from is right from the American Lung Association website that gives grades to various states. And in fact, most states across the country get an F because they dramatically underfund tobacco control. I mean it when I say Maine really deserves a pat on the back, if not more, for the work it's done in funding these programs. Last I looked, they were funding over $15 million, and some of it may come from the settlement money. It's hard to know with how the state commingles those dollars. The bottom line is, though, that the American Lung Association, and I think it's actually the CDC, recommends 12% of revenue go toward tobacco control, and they are right on the money. And I heard somebody earlier testify that maybe that was just in the last 3 years or several years, so it hasn't been forever. And that may be true, but you've got it right now, and I don't see any reason why the state should change. In fact, more should do it.
Thank you.
Any other questions for Mr. Chair? Thank you very much for your testimony. We appreciate you being here.
Thanks for your time.
Next up is Mike Sherwood. After Mike Sherwood will be Axel Wallingford. Welcome, Mr. Sherwood.
Hi. Can you hear me?
We can. We can't see you if you want to switch your camera on, but you don't have to.
I won't be able to because I'm just stepping away from the cash register to kind of give you a little bit of testimony today.
No problem.
Good afternoon, everyone. My name is Mike Sherwood. I'm a resident of Old Orchard Beach, Maine, and I am the owner of 2 stores, Norway and Biddeford Smoke Shops. I have worked the last 40 plus years in the convenience store smoke shop field. My Biddeford location is a 30-minute ride to the New Hampshire border, and my Norway location is a 40-minute ride to the New Hampshire border. My customers will make that drive to save $24.20 a carton versus New Hampshire pricing. And that includes a difference in tax and the sales tax. I just want everybody to think about all the local stores near the New Hampshire border that would greatly be affected. I know it would be devastating to my locations, and I'm sure would hurt any stores that are close to the New Hampshire border. Additionally, this is going to cost my 2 locations $60,000 automatically in carrying costs. So the inventory level in my stores cost to me that I'm going to have to invest in is going to go up $60,000 when this tax goes into effect. Also, this bill would increase the tax of rolling tobacco that our customers currently use to make cigarettes. These folks already are scrimping by, and the reason they make cigarettes with rolling tobacco is they can't afford the current tax on cigarettes. So you're going to double the cigarette tax, you're going to double the rolling tax, and these poor folks can't afford it right now. I urge you not to pass, and I appreciate your time.
Thank you very much, Mr. Sherwood. I appreciate you also multitasking. Any questions for Mr. Sherwood? All right, seeing none, thank you very much. And next up is Axel Wallingford. Welcome, Mr. Wallingford. Maybe. Mr. Wallingford, are you with us? All righty. While we're waiting for him to come on, I think we have been here for multiple hours at this point. We've got 3 more bills to go. I think it would be a benefit to all of us if we take a 15-minute walk around our houses or outside, grabbing a bite to eat, etc. Mr. Wallingford, are you with us? No, looks like not. Representative Perry, do you have a question?
Yes, thank you, Madam Chair. How many more people do we have in the queue on this bill?
This was the last one. Mr. Wallingford was the last one.
Oh,
Yeah.
I see. Okay.
It looks like we have somebody raising their hand. Perhaps Mr. Scott will bring him in. Hi, Mr. Scott, are you with us?
Yes,
Excellent.
thanks for the opportunity to speak. My name is Brett Scott. I'm the owner of Smokers Haven. I have 12 locations and employ over 100 employees. I wanted to raise one of my concerns. I certainly don't agree with the entire tax increase, but the part that I especially see as problematic is to do with the vaping side. And part of the reason is that Maine just implemented a tax last year of 43%. Now, I know I hear people talk about black market and all that. I don't see that as much of a problem with the cigarettes because there's a tax stamp on cigarettes, okay? You have a way of identifying if those taxes have been paid or not, okay? But with a vape product, I took 3 identical bottles of juice here. You cannot tell which one the tax has been paid on, which one has not. And when you're talking 86%, and we're hearing margins be discussed of 15%, 30%, okay? Now, for someone like myself, who we have millions of dollars in inventory, we have to make sure that we have tracking systems in place and all of our systems and processes are tracked. It's very easy to audit us. We have a very clear paper trail, and that doesn't matter whether it be sales tax, the tax on these products, our business profits, all of that. We have that all in place. But when it comes to somebody that doesn't have that and when I have a competitor down the street that's running a regular register, and he decides that he's going to put a store in a different state with a substantially lower tax, and he's going to go buy that product through his store over there, and then he's going to take it to his other store. He's going to take the cash from the customer, and he's right next to me, and he's selling this product for my cost. He's making that 86% that's supposed to go to the state. And he's not even paying a profit tax on that for his business, and he's pocketing the sales tax. He's making a fortune. He's getting rich because he's able to skirt the law, and we're not. This product does not belong being taxed yet, okay? It's too early to do it. You need to have the right type of systems in place so that the honest business owners can actually make a living and have a competitive market to compete in, okay? I'm against the whole tax, but I don't even want to go there. Something that hasn't been discussed. This is a problem. Can you see how lucrative this is? Okay, open one of these stores and run a register and don't have any tracking systems in place. You can make a fortune in Maine, and you can undercut the guy beside you and make him look like a fool. So my problem is that before you go and put an 86% tax on this and put us honest guys out of business, please call SICPA. They're the company that handles the tax stamps for the cigarettes in a lot of these states, and get something in place that tracks these items. So when your agents go in, the Department of Revenue goes in, you can make sure that this tax has been paid, because otherwise we don't have a fighting chance. Any of us that want to do things by the book, and that to me is the black market that you're going to see. I'm not looking to go on a rant about any other criminal enterprise, any of that. This could be somebody, and this happens already. Okay. In New Hampshire, 65% on OTP on pipe tobacco. You know what people used to do? They used to go down to Pennsylvania with a minivan, loaded up with tobacco. They come back and make a fortune. I've experienced it. My family's been in the tobacco business for 20 years. My father was in tobacco distribution. New Hampshire raised the tax 65% on OTP. He sold his company. He got out of business because we recognized that we weren't competitive in that market anymore, because there were trunk slammers running around selling this product, and they were making a fortune and we were making peanuts. You need to have the right type of tracking systems in place before you start talking about raising the tax to 86%, making it extremely lucrative for the guy that isn't afraid of prison or jail. Because for us honest guys, all it's going to do is put us out of business. So, does anyone have any questions?
Thank you very much, Mr. Scott.
Thank you.
Any questions for Mr. Scott? Seeing none, we really appreciate you being here. Thank you for bringing that up. That concludes those speaking for and speaking against. We have nobody in the queue with testimony neither for nor against. So this closes the public hearing on LD 1423. And again, I think a good, let's call it a 13-minute break. We can meet back here at 1:30, but give everybody a chance to walk around, stretch their legs, get a fresh glass of water, more coffee, etc. Avery, would you mind putting the screen up for a couple minutes? And we'll all meet back here at 1:30. Thank you so much, everyone. Hello again. Did you get to stretch your legs?
I stretched out and took a little rest.
Oh.
I have a bill coming up. I know it's public hearings and we've already started, but at some point I've got a bill in another committee sometime the next hour or so.
No problem. No problem. If we see you disappear, we'll know where you went. All right. Our next two bills are Representative Collins' bills. So we'll wait till he gets back to get started.
So did you say we have 3 more bills?
3 altogether. Yep. 2 of them are our own committee member. So I'll remind everybody that's here that we get to have him for the whole entire work session, no matter what. So as far as questions go, just remember that we get to really grill him.
Sounds good. Do we have a long list of people on these 3 bills, or?
Not too terribly long. Certainly not as long as the ones that we just had. So all together, looks like probably all together we've got another, I don't know, dozen or so people speaking. So we should be okay. Yeah.
Oh, that's good.
Yeah.
I apologize that I couldn't shut off my mute. I don't know what happened. I went into agriculture and I couldn't unmute there, but it unmuted the tax meeting for some reason. And then all of a sudden it came on because I had 2 different devices going. So I don't know how that happened, but.
I don't know either. And I have control over who I can mute and stuff, but I couldn't mute yours either, which is really weird.
And then they were trying to let me into ag and they couldn't let me in. So I won't try to do 2 committees at a time. And again, I'll just make sure I check out of one before I check into the other.
That's the way to go. All right. So let us restart. We'll start with LD 1382, an act to invest in mains, roads, and bridges. And that is, of course, sponsored by our very own Representative Collins. Representative Collins, take it away.
Oh, good afternoon, fellow committee members. If you all vote for my bills unanimously, I won't even talk at all, if that's a deal you want to make.
Yeah, right.
Hey, I'm trying to be generous with your time, Representative Kryzak. So for the public listening, I'm Representative Benjamin Collins. I represent House District 42, part of the city of Portland. I am a member of the Taxation Committee. So I just real quickly go into this. What this is proposing is something that I really was educated a lot on when I was on the Transportation Committee last session. And we dealt with the huge challenge of funding our roads, bridges, infrastructure. Most of the bids that come in to do projects on our highways and other, public works, that was under the jurisdiction of the Transportation Committee. A lot of the bids that come in, more than half of them are way over the budget. Some of them are almost double what the budget is. So the cost of labor and definitely the cost of products and goods has gone up substantially, and our budget has not gone up that much for fixing our infrastructure. I understand, again, we hear in this committee and every committee, well, all this money is coming in to the state, so every problem in the world is solved. Well, actually, it's not. Right now, with the money we get, in the general fund and money that comes from the fuel tax to help fix our roads and other infrastructure, we're just so short, and every year we have to rely on bonding. We vote for bonds to cover the most basic infrastructure work for our state systems. I know we recently heard a bill from one of our colleagues, I believe Representative Sebra. He was looking at ways to get more money into the highway fund, I believe, to help our roads. So, I mean, it's a concern that a bipartisan concern that we all have, especially people who served on the Transportation Committee. What I remember from last session, there were several bills that looked at raising the fuel tax or bringing back the indexing. Several years ago, sometime after 2010 anyway, we got rid of indexing, and it has cost us hundreds of millions of dollars that we could have used for fixing our roads and other infrastructure. What struck me, though, was there were people that represented Maine's trucking industry and transportation industry who were very adamant that they didn't think that indexing would solve the problem. They thought that, in fact, it would not be enough, that and indexing can go up and down to different levels every year. It wasn't stable. So they suggested that if we do something, we just have a set amount that we would do in the upcoming years to help us capture more revenue to fix our roads. And some of the rationale from the trucking and transportation industry was that they were saying it was documented that their cost of repairs far exceeded what they would pay in extra fuel tax if it was a minimal increase. So that's where a lot of the impetus for this bill came from, was my desire to really do something to help us have a better infrastructure in our state. Now, if you go anywhere around the state, and I have over, the last couple decades for different work projects, when you ask people all over Maine, Maine's a rural state, so almost any place you go is rural. You say, especially people way far out from Portland and Augusta, way on the edges of Maine, like, what are your biggest issues? You'll always hear them say broadband, and the second is our roads, our infrastructure, and just how terrible certain roads can be. And despite the good work of Department of Transportation, we have excellent staff that, under great pressure, do a great job keeping up the best they can. Even with the bonding we do, we're basically just patching things up. We're just putting Band-Aids on things. We're doing the bare minimum. And Commissioner Van Note last session said, even what we get from bonding, even what we get in the current budget for roads, it's not enough. And the money we do get, again, it's doing the bare minimum just to keep us on the road. But we should actually every year be spending hundreds of millions and more if we're really going to tackle the whole problem. So this is a huge issue. And every year we go forward, the cost of labor is going to go up. The cost of goods and products are going to go up. So instead of just trying to just patch things up, just try to scrape by on bonding, which we pay interest on, even though I know rates are low. I mean, we're still paying money to go out to bonds. We're paying interest on that. So I just think that this is a problem that the people in Maine want us to solve. We've always just kind of deferred, kicked the can down the road. We never wanted to take it up. And I would say that what my bill does is very reasonable. It, over a course of, I believe, 4 years, would increase to a very small degree the fuel tax. And one thing the transportation industry told me was, they said, don't do it in a disproportionate way where you're going to increase more for diesel than the other fuels. So I didn't. I put it, flat. So it's the same tax for everybody. I didn't want to target one group more than another. So I think if my memory's correct on this bill, I don't have it here in front of me, it would be, it would go up to 4 cents extra per gallon. The next year it would be 3 cents, the year after 3 cents, and then 2 cents. So that's what the increase would be over the next 4 years, I believe. And I also want to note that the Transportation Commissioner Van Note stated last session very clearly that when they do reports and studies, the cost of fuel goes up and down based on factors not due to taxes, due to environmental issues, due to shortages, natural disasters, politics, trade wars, different things on prices between different countries and OPEC and all that sort of stuff that goes over my head. But anyway, that factors based on demand and other factors, the cost of fuel goes up and down, but people pretty much, regardless, are going to fuel up. So for example, someone like in my case, if I have a car that's only takes the most expensive fuel I have to put in my vehicle, if I got to go, well, we don't have to go to Augusta too much these days with the pandemic, but whenever you have to travel somewhere, you have to get gas, you have to get gas. Most people in this country have at least one car. They have to travel for work or to go to the store and whatnot. And so it was noted that there's no correlation between the price of the fuel that people will stop buying it. So if someone's, used to paying $2.50 a gallon, all of a sudden over a couple months, it goes up to $3.15, they're still going to go and get that fuel. It's not going to curb their purchase of fuel because they need it. We rely on our cars and the fuel to get around. That's just a fact. So if that's the case, I see no reason that people, when they go to gas up, if they're used to paying more or less, they're not even really going to notice that much if they're going to pay 2 cents 1 year more or 3 cents more. So I just thought it was something fair, and it was something that could capture a lot of money. And again, to quote exactly what some of the main transportation and trucking industry said, is that this is something that's reasonable. And if we just went to putting indexing back, it's not enough. By getting rid of indexing, it may have cost us hundreds of millions, but they said that if we would have just added 3 cents a year or so, that, by 5 or 6 times, that would have been the increase in additional revenue. So it was at the testimony. It was from the testimony of some of the main transportation industry that I came up with this concept. Some people suggested I have a very high rate to get what the real need would be to fix our roads completely, but I wanted to do it moderately. I didn't want to be excessive, adding, 20, 30, 50, 60 cents, but I thought 2 cents or 3 cents would be something that customers could absorb. And the other part to this is to even go another level, to be fair, is that there is a component of this bill that people under a certain income, when they do their taxes, can get a little bit of money back. And it was estimated that, people might pay, an average person might pay another extra $100 a year on fuel with this tax. So we did put that $100 in there to give back to people who might be lower income that might be adversely affected by this. So I've spoken long enough, but that's why I submitted this bill. And I do want to just remind the committee one more time, the cost of fixing our roads and infrastructure is going up at exorbitant rates, and we have to find some way to deal with that. Just even doing bonding every year, which we pay interest on, isn't even coming close to covering the real costs of keeping our state going, our economy going. And we can't have a good investment in our future economy if we're not investing in things like our roads and bridges and infrastructure. So thank you.
Thank you, Representative Collins. We have questions from Representative Kryzak, followed by Representative Carmichael.
Thank you, Madam Chair. Thank you, Representative Collins. And I'm glad I didn't take you up on your offer because I've got a lot of questions, if that's okay.
Certainly.
The first one, since you're on the Transportation Committee, can you explain to me, they only get the funds from the gas tax and then some from the general fund? I always was under the assumption that they got all the toll money too, but that's not the case.
They get, and I think I don't know if the analysts can explain this all more. I'm trying to remember all of the sources. There are more sources than the fuel tax. There are some of the funds from the turnpike that somehow, I believe, funnel into the Department of Transportation. The Transportation Committee, for some of their work, they do their own budget separate of appropriations. So and I'm trying to recall all the sources. If Julie or someone doesn't have all that available by the work session, Representative Kryzak, I will get the full report. I'll probably send it to you before the work session about where all that money comes from. But I do know that we have limited options to get a substantial amount of money more. and there are some ways I pursued getting more funds. And there, I just ran into a lot of roadblocks. So this was one way which I knew was consistent, where I knew based on volume, more of an using like a theory of elasticity, just getting a lot of people to pay a little bit could help. I wanted to be least intrusive into, I didn't want to overtax people. So I really worked hard to try to get the smallest rate possible, which I thought wouldn't really impact people that much. I didn't want to go to a very high, 60 cents or something a gallon. I wanted to keep it minimal so most people could afford it. And I know that some people really, even paying $100 extra a year really hurts them on really limited incomes. That's why I wanted to have some component of fairness where, when they do their taxes, they might be able to get that $100 back. So I tried to cover the bases the best I could. So.
Thank you. The other question I have is, when I was selectman, we used to get $80,000 a year for paving from the state, and to take care of our own roads, and then of course from taxes from the town, we put in more into the budget. So we put in an average about, $200,000 a year into paving. So this money from the gas tax, would that 80,000 have come out of that from the transportation department, or does that come out of some other fund?
I can't answer that completely. I don't remember that, how that part would flow, Representative, unfortunately.
Okay. One more, if I may, Madam Chair.
Sure.
I have a transportation business, and I've got 5 vehicles that are on the road most days. But because of the pandemic, none of those, only my personal vehicle, moved for 10 months because of the scope of my business. So that's 10 months that I wasn't paying all that taxes, plus everybody that was staying home. So do you think that we're going to be in more of a bind this year because of not getting all those gas taxes?
Yes, I think it definitely has an impact, and I wish I had reviewed it before giving this testimony, but I can't remember the report that was given earlier about the last quarter or whatever reporting period it was about the collection of fuel taxes and how much it was down. I wanted to say at one report I saw it was down, but not as much as we had thought. But I'll contact Commissioner Van Note's office to get the most over the past year or so, and then also the most recent report, so we can review that as well to see how, I do know that some federal money should be coming that can help address this, but that's not dealing with the overall structural problem. And again, I think even that money that may come and be spread over how many years, it will cover a lot, but I don't think it would even cover all the work that we really have to do, just based on the fact that Maine is a small populated state, but we have so many miles. It definitely is a challenge to get to all of that. And another challenge is, I remember being on the transportation committee, is that just to the staff, like they have a challenge having staff people to compete, because private industry can pay so much more than professionals can be paid to work for the state. So having enough people to always be out there to go out and do the work, and also there can be a delay, like people will complain about, they need repairs on the roads, but the process of working with the town and the state and, getting it planned out, and by the time it's implemented, it can take some time. So there are several factors that also goes into when we actually can fix like a road that might, really need some work. So.
Thank you.
Representative Carmichael.
Thank you, Ms. Chair. Thank you, Rep. Collins, for the bill. My concern is, my philosophy has always been every penny that we take out of the economy tax-wise, the private sector can't use to rebound. So I was kind of wondering if it wouldn't be possible, like you kind of alluded to earlier, to use some of the federal money, where it's a one-time expenditure and this is a one-time money, to do some of these big road projects and make the investment that way rather than burden the taxpayers at a time when they probably, well, some of them can't afford it. I know there's some people that's doing fine, but that would be my concern, I guess.
Yeah, yes, Representative. And so a couple things. First is, yeah, when I put this bill in, it was just based on an ongoing issue. I wasn't foreseeing how much money the federal government would be giving us and what it would be going for and how it would be implemented here in Maine. And so, I mean, that's great. And I'm hoping moving forward that the federal government more money will flow down to us for our infrastructure. I hope that's a trend that continues. It isn't just limited to, a year or so. But regardless of that, I think that a lot of this money is temporary. I can't guarantee we're always going to get these infusions. And I think some things that are going to remain constant is the cost of labor and the cost of goods are going to continue to go up. And at some point, we're going to have to find a way to cover that. And so, and again, the idea I got from this was from the, I didn't want to just propose something without hearing from some people that are really use the roads every day, but it was, people that represent Maine's truckers and the transportation fleet had encouraged this to be looked into. And I remember a couple of years ago, I said, well, why don't we just go to indexing? That'll get us, money back. And that seems logical. And they said no, that they didn't think that was stable and consistent. So, and I think the thing I think the issue about, money staying with businesses or not, I think that for a lot of people that have lots of trucks out there on the road, they were really frustrated by the conditions in certain areas, that it was causing them so much damage and so much money to repair, that they said in a lot of cases, they thought a very modest increase in the fuel tax overall might be cheaper for them than just the amount of repairs that they have due to the wear and tear from Maine roads. And that's for business. As far as, the average consumer, people that are still really struggling, that's why I tried to get a good sense about maybe what the average increase would be in cost because of this. And that's why I come up with, about $100 should cover most people that really, are in an income bracket that's really hurting them. And so we try to get back most of what they would lose from that increase, 2 cents or 3 cents a year, depending on the year, when they gas up. So
I have a couple more, but I can save them for the work session.
That would
Thank
be
you.
so great.
give me a call anytime too, if we can.
Thank you.
Representative Perry.
Thank you, Madam Chair. Thank you, Representative Collins, for sponsoring the bill. I'm going to get to a question. I'm going to talk just a little bit first. I see Maria Fuentes is in the queue, so she'll be able to answer every question that anyone's asked. But my recollection is that all tolls fund the Turnpike Authority, which is a stretch of road from New Hampshire to Gardner. None of that goes to the rest of the roads in the state of Maine. If you're getting money from in your town, that means your town's big enough to be part of the urban compact, which means the state will give you some money. You're expected to pay the rest with your car registration fees, and you take care of your projects. If you're in rural Maine, the state just does it for you. But gas went up 6.8 cents last week. It's gone up over $1 in the last year, and that's just one of those things, right? But 4 cents to go directly back in our roads, there's always an argument that we're going to crush the economy with that 4 cents. We had a deal back in 2010 to add 10 cents, I think it was, to the gas tax, and the road builders and anyone who built roads or paved roads was entirely behind it, because that money goes directly into these companies' hands working on our roads. And at that time, it was the truckers who ended up squashing the deal. And we needed the 10 cents then. Since then, gas indexing has been repealed, and that was at best keeping us even, not even really. So there hasn't been new revenue in At the time, we looked into going up on licensing fees and registration fees, which we seem to be low in as far as other states go, but that amounts to 1 or 2 pennies. And is a lot of money out of a poor person's pocket all at once. So I would congratulate you and agree that the gas tax is the fairest way to go, the smartest way to go. It's beyond needed. And my question is, seems like this gas tax always goes to the Transportation Committee. I don't ever remember hearing a gas tax bill and tax. How did we get it over here?
I would also like to know that question.
I think the Transportation Committee might have heard enough from me the last 2 years that they wanted you to deal with me this.
All right.
This session. I don't know.
Any other questions for Representative?
I'm not sure.
All right, seeing none. Oh, sorry, Representative Kryzak.
Should we send it back to the Highway Commission?
They won't let us. We tried.
Oh, you tried?
It's good to get our brains working in a different function every once in a while, Ted. Representative Collings, thank you very much for presenting this to us. Next up, speaking in favor of this bill is James Mile from MESEP. Welcome, Mr. Mile. 2 days in a row. Holy moly.
I know. Normally, my colleague Sarah gets all the fun with this committee, but I get to see you twice. I was also surprised that it was before you, so there we go. But good afternoon, everyone. I am James Mile, and I'm a policy analyst at the Maine Center for Economic Policy. We're in support of LD 1382 for a lot of the reasons that you've just heard from Representative Collings. There is a big shortfall in the highway fund that's been there for at least the past decade. After issuing bonds of, the latest estimate from the DOT is that even after the regular issuing of $100 million in bonds every year, so after that borrowing, there's still a $230 million shortfall in the transportation budget, which is pretty huge. And this bill would not close all of that, but it would go a long way to helping that. One of the reasons why we're really supportive of this bill is the inclusion of the fuel tax fairness credit. I think it is worth pointing out and worth noting that gasoline taxes tend to be regressive taxes. They tend to, so they can put more burden on lower income Mainers who, really have no choice but to drive to work, especially those who live in rural areas. And I think the addition of the fuel tax fairness credit really helps to balance that out. I think one reason, I'll submit written testimony as well that I'm reading from now. I haven't sent it in to you guys yet, but you will have it. I did some analysis on the proposal, and it does seem that the $100 tax credit would slightly more than cover the cost of the tax increase for the lowest 20% of households in Maine. So households with income below $20,000, which is about the poorest fifth of the state, they would actually see their tax burden go down slightly under this bill. They would save about $3 a year, even with the increase, because $100 would offset that. And then it would sort of go up sort of gradually from there. With the highest earning households would pay an extra $175 a year. Middle income households would pay something like an extra $94 a year when the taxes are fully phased in. Representative Collings has already noted that we have this big structural gap and it's having a real impact on our roads. I think something to bear in mind is sort of the cost of that. The American Society of Civil Engineers in its 2020 report estimated that the combination of sort of repairs from damaged roads, delays from congestion, and then damage from crashes costs Maine motorists about $1 billion a year when you add it all up between the time and the expense of fixing those. And those are costs that really do fall heaviest on our lowest income friends and neighbors. We know from other data that about 1 in 3 Mainers cannot afford an unexpected $400 expense without taking on some debt. And a car repair is precisely the kind of expense that can really damage people's finances and send them into a real amount of financial stress. So the failure to fix the roads is having real consequences, especially for low-income Mainers. So one reason to increase the gas tax, especially in this more equitable way, is to take that burden of repairs off low-income Mainers. I think something else to bear in mind that you guys may be less aware of in the taxation committee is that one reason why the gas tax is particularly helpful in a state like Maine is because we have so many out-of-state visitors using our roads. When we fund the roads through things like bonding, Paying back those bonds primarily falls on Maine residents, whereas the gas tax is something that we can shift some of that burden onto tourists. Our estimate is that about 60% of gas tax revenue comes from residents, about 23% comes from tourists, and 17% comes from sort of freight transportation and business shipping. So it helps to sort of spread the cost of repairing the roads to some of the folks who are using it, like the visitors and truck transportation as well. So that's the summary of my testimony. As I say, I'll send in a written version to you guys as well. I noted that from some of the questions from before that I can maybe help to answer for some folks. It looks like from the Revenue Forecasting Committee that the pandemic did decrease gas tax revenues. It's about, I think we're looking at about $20 million below where we should be for the regular gasoline tax, and about $3 million below for what they call the special fuel taxes, which covers some of the freight transportation. So down about 10% from where we would have expected it to be. And I think a couple of other things I noted. One was that our estimate for how much the state has lost just by not indexing the tax is about $223 million over the last decade, because the gas tax hasn't kept pace with the price of inflation. So we would recommend in this bill that not only do you have the increase, but after 2024, you reinstate the indexing so that the value of the gas tax doesn't keep going down. Similarly, I think if you did that, it would make sense to index the value of the fuel tax credit as well, so that the value of that credit wouldn't be eroded. And I know you guys in the taxation committee have a lot of experience with sort of working tax credits in the way that they have a proper phase out and that sort of thing. So I think that would also be something to watch out for. You wouldn't want to create a cliff where a couple of dollars extra a year meant that somebody didn't receive the credit at all. But I know that you guys on the committee and your analysts can easily figure that out to phase it out more gradually. So those are the notes that I made, and I'm happy to answer any questions if there are any.
Thanks very much. Sounds like you answered the ones that we were going to ask already. Any other questions for Mr. Mayo? Seeing none, thank you very much for your testimony. We really appreciate it.
Thank you.
Next up is Maria Fuentes, who is speaking neither for nor against. Welcome, Ms. Fuentes.
Thank you so much. Representative Terry and distinguished committee members, my name is Maria Fuentes, and I'm speaking today neither for nor against LD 1382 on behalf of Maine Better Transportation Association, which is a statewide coalition made up of members who plan, design, build, maintain, and use Maine's transportation infrastructure. There's all sorts of evidence that Maine isn't making the critical investments to our system that we really need, not only for our people, but for our economy. So we really want to thank Representative Collings for putting this bill in. A couple of things we wanted to point out. The Maine section of ASCE in their most recent report gave Maine a C- for bridges and a D for roads. And then TRIP, a Washington, D.C. research group, actually, you already heard this from the prior speaker. I guess they did a study and they found that Mainers or drivers spend an extra $1.3 billion annually on increased operating costs due to rough roads, congestion, and crashes. But just a few things. In 2018, the fatality rate on Maine's rural roads was more than 3.5 times higher than on the other roads in the state. Our roads are ranked 10th worst in the country. And in terms of our bridges, they're rated the 7th worst in the country, with 13% of them being structurally deficient. I will say, though, that that's an improvement from a couple of years ago when we were 6th worst. Meanwhile, the state is spending less money on its road and bridge system. In the 1970s, the state spent 26% of all revenues on transportation, and today that number is less than 10%. In the last session, you heard from Representative Collings, I think, that the legislature created the Blue Ribbon Commission on Transportation Funding, and they worked hard on looking at the needs of our system and also the funding issues. They unanimously agreed that the funding gap is $232 million annually, but only if you assume an annual $100 million bond issue. That's every single year. And their shortfall is actually down from earlier estimates, due largely to DOT and the Transportation Committee, back when Senator Perry served on it, making some really difficult cuts. The agency had to cut nearly 20% of its workforce, which is dramatic, really, for a reduction for any agency. They've also scaled back the number of miles that they are able to improve through a prioritization program that they instituted several years ago. DOT reclassified our roads so that fully 1/2 of main roads will never receive anything other than a coat of skiddy mix, or we call it light capital paving now, every 7 years. Recently, the DOT had to add even more miles to that program. But the commission was not able to reach consensus on exactly how to fill that gap. There was strong, though not unanimous, support for increasing the fuel taxes. And like the representative said, they were interested in doing it incrementally. There was even stronger support for having the general fund contribute more to the highway fund, recognizing that the transportation sector contributes significant revenues to the general fund. So as such, we do hope that the legislature will consider using more of the money that's come in, either through the revenue forecasting or from the relief funds to make up part of the whole. But in conclusion, I just wanted to say that the highway fund is cratering, like many of our roads, and increasing fuel taxes should be part of the funding solution. But we also believe it should be a component in a much more comprehensive package, looking at other revenues in tandem, not only for highways and bridges, but also for transit. And so that's why we're speaking neither for nor against. And we understand that at this time, with people trying to recover from the pandemic, it's a hard time to increase. But thank you for the opportunity to testify on this bill, and as always, for your legislative service. And I'd be happy to answer any questions.
Thank you so much for your testimony. We really appreciate it. And your knowledge is fantastic. Thank you.
Thank you.
Representative Perry, you have a question.
Yes, thank you so much, Madam Chair. Thank you, Maria, so much. Your expertise is a treasure to the state of Maine. And so I want to,
kind.
well, it's true. And that you, not, okay, but at any rate, so you remember the crisis we had with the Verona Island Bridge, where we didn't take care of it. It was no longer passable. We spent millions, if not tens of millions of dollars to shore it up. It was shut down for a period of time just to get a little more time out of it until we could build that beautiful new bridge. And I was over that beautiful new bridge last weekend, and it's starting to show its age already. And that's got to be a $200-300 million asset to the state of Maine. And it was a nightmare when that bridge was out of service. Are we at risk of allowing such a beautiful, expensive asset like that bridge and others start to deteriorate just so we can spread 7/8 of an inch of tar all over?
Well, thank you for the question.
Try and claim we're doing our job.
And I didn't mean to cut you off, but my computer's kind of going in and out. Thank you for that question. I will say this, DOT repeatedly gets really high marks for the way they use their money. There's a nonprofit group whose name escapes me right now, and they look at all the state DOTs and how efficient they are with their money in terms of, if they have too much administration or how, and they're consistently in the top 10. So, the reason I mentioned that the bridge numbers got a little bit better is because they know that, the bridges are safety lifelines, right? And so they have put more money into bridges as they've needed to. And what it's really, what has really been impacted is highway rehab, highway improvements, because we're not talking about building new roads here, right? We're just talking about fixing the roads that we have. And I think that would be a great question for DOT relative to the value, because I think when it was built, it cost $130 million, and that was many years ago. And you're right, it is a treasure. And thank goodness we built it when we did. But one more thing I want to say about that bridge, because that was such an emergency, for the first time, the legislature passed the Garvey bonds, which are federal grant anticipation bonds. So basically you're borrowing against future federal money that you're going to get because of the formula funds. And it was really controversial, but because it was an emergency, we had to do it, and the legislature passed it. Well, now we put a $50 million Garvey bond into every single highway fund budget, just because, whereas before it was used for an extraordinary project, now we have to use it to fix the bridges that you know need maintenance and rehab. So so hopefully that kind of answers your question.
Thank you very much. We have a question from Representative Kryzak.
Thank you, Madam Chair. Thank you for being here. Can you explain to me how we fixed the 3 bridges from Portsmouth to Kittery, one right after the other, where that funding come? Did New Hampshire pay for that? Did we pay for half of that?
Yes, I don't remember I don't know what the proportions were, but certainly somebody from DOT can be at the work session. But yes, it was a joint effort between New Hampshire and DOT or Maine DOT. And so there was also a lot of federal grants. Senator Collins and the rest of the congressional delegation, especially for the Mildred Long Bridge, they were able to secure federal grants to help pay for it. Yeah, those are obviously big, expensive projects, and they were done cooperatively with the 2 states. Actually, you had asked the question about turnpike tolls, and Representative Perry said correctly that the money stays with the turnpike, but there are some projects that the turnpike will contribute to. Many years ago, the turnpike used to give like about $8 million a year to the department so that they could just work on those roads that link to the turnpike. And then, you know, they have a lot of debt, so they stopped doing that. But what they do now is they have this really good cooperative arrangement. And I do know that they negotiated some help from the Turnpike Authority on that Mildred Long Bridge. But yeah, the tolls do go to their capital improvement projects at the turnpike.
Okay, so do we get more federal money because there was 2 states involved?
Well, yes, but you know, yes, there was federal money from New Hampshire and federal money from Maine, and there was some, you know, state gas tax money as well. And I don't remember if you had asked the question about the monies that go to the towns, but that's part of the DOT has their own kind of revenue sharing program, and so they send 9% of their budget back to the town. So if the highway fund grows, then the money to the towns grow as well.
Okay, thank you.
Any other questions for Ms. Fuentes? Seeing none, thank you again very much for all of your expertise. We really appreciate that.
Thank you so much.
You got it. We have nobody else to speak in favor of or against, or neither for nor against for LD 1382. So that closes the public hearing on that. And we will jump right into LD 1424, also sponsored by our very own Representative Collings. Representative Collings, take it away.
Okay, so I'm assuming this is the estate tax bill. I forgot all my LD numbers, so.
It is.
Okay. All right, great. Well, thank you. And for members of the public just tuning in, I'm Representative Benjamin Collings. I represent House District 42, part of Portland. I am a member of the Taxation Committee. I'm presenting a bill on reforming the state estate tax. I've been having some technical difficulties. Can you all hear me still?
Yes, we can.
Okay, just want to make sure. Because you all keep freezing up, but I can hear you. So what this bill would do, and let me, before I start, just remind people that may not know, is this is a bill that was submitted in the 129th session, which was the last session prior to this 130th session. And it was another one of the casualties of the COVID where it went away. Just the bill died when we adjourned early. And so my original bill was amended by the Taxation Committee in the 129th session. And in essence, this bill is the amended version from the 129th. I did make a small change to it regarding indexing, but so I'll explain the bill real quick. What it would do is I think around 2011 or 2012, I think maybe 2011, the estate tax rates or the law was changed. Originally, the estate tax, there was when it started being assessed in Maine, it was if you had properties over about, I think, $500,000, then it kept going up to about $1 million, then it went up to $2 million. It's when you had properties over those amounts on different years, it was different amounts. The estate would be assessed the estate tax. In about 2011, that was jacked up to about, I think, the starting point was more like about 5.6 million, and then it's continued to increase. So what my bill originally did last time, and what it still does, is it takes it back to that $2 million rate, which it was before that change in about 2011. And I can't really, I can't say in all certainty how much extra money we would get back. Collected varies depending on how many estates qualify. So, but it could be anywhere from $10 to $20 million a year were some estimates. And so anyway, the estate tax here in Maine, there's a federal estate tax. In Maine, we have a state version. So I don't believe we have an inheritance tax. So the estate tax is levied on the estate, not the individual who inherits it. So basically, if you currently inherit an estate worth more than 5.6 million, or maybe it's closer to 6 million now, it keeps going up, the estate would have to pay a tax. And depending on rate, I think it's about 8%. And then if it goes over to so many millions, it might go up to 10%. And I think that the top rate you'd pay on a very large estate would be about 12%. And I think that would be the maximum amount. So federally, the estate tax has been around a lot longer, and it has gone up over the years to recently being around 6 million to about 3 or 4 years ago, going up to, I think it wasn't until it wasn't until an estate was valued at over 11 point something million that it would be assessed an estate tax, or 22 million per couple. So that threshold went way up recently. So people that inherited large estates up to 11 or 22 million on the federal level would pay nothing. So anyway, the estate tax really was championed by a Republican president, Teddy Roosevelt, about 100 years ago, when the amount of wealth, the disparity in wealth was just, the gap was growing. And he was very concerned about the concentration in wealth in the hands of a few people. And just like the founding fathers didn't like the power of the monarchy controlling the colonies, a lot of people like former President Teddy Roosevelt said, we don't like a few people, a few very wealthy people having all this power and control and passing their wealth and power and prestige on to other members of their family. So that's why there was a big movement from Teddy Roosevelt to really do something big with the estate tax back in those days. In, I would say, the earlier to mid 2000s, the second President Bush was in office, and he made a move to completely wipe out the estate tax. This was based on some think tank groups and some billionaires and people who just wanted to get rid of it. There was a big fight in DC on that. And up until that point, mostly some of these groups and some very wealthy people were pushing that. I was involved with an effort. They sent people from every state. One was an organizer, which was me. The other was a person that inherited lots of money and would be subject, to the estate tax. And I unfortunately wasn't a person inheriting a lot of money. I just was the organizer for Maine. But what we did was we went down to DC. They obviously had me go talk to the main delegation, Collins and Snow, who did agree to a compromise with the estate tax and not getting rid of it completely or having such a high threshold to start. And as well as them, I spoke with people all over the country and Congress, including some people much more conservative than I am, including some people from Congress down in Georgia, who at first, when we started the conversations, didn't start out too good, but in a spirit of compromise. And once we got through the facts, and once members in Congress heard how many people were there that were inheriting huge estates and wanted to, out of patriotism, give money back to our country, a compromise was made. And so I hope that members of this committee from all parties could work in that spirit on a compromise to try to get some more money that could go to many good causes in the state. I would say that the compromise, the amended bill from last session, towards the end of last session, before we had to adjourn prematurely, the biggest argument against this was going from about 6 million back down to the $2 million level before the estate would be assessed that tax. People said that this would really hurt people in the logging industry, the fishing industry, and the farming industry. And I disputed some of that, but just to even give greater protections above and beyond protections that specifically exist for farms, we did make an exception there, where instead of starting at 2 million, we started the rate closer to 4 million. So I believe it would be $3.8 million. And I don't know if she can make it, but Representative McDonald, who is a lobsterman, said that that's a very reasonable rate. I spoke with Representative Alley, who's also a lobsterman. They said that that's a reasonable rate, that most people, individual operators, wouldn't have estates larger than that to pass on. If you do, you're a larger fishing company and you're probably reinvesting your money into those businesses. So the amendment from last session was to include more money to just give greater protections for the few people that would need them in those kind of iconic Maine industries. The biggest change I put in this year, I think might be the only change, was while asking to put the rate back to 2 million, the last proposal from the last session didn't have indexing. I included indexing, so that amount would continue to climb over 2 million, just to be fair to the when you're valuing an estate. Lastly, I'll just say that when you talk about who actually pays the estate tax, federal or state, it is like a percent of a percent of a percent of 1%. I mean, it is so few people who pay this. The average estate tax is a large amount nationally or in a state. It's people that inherit, huge amounts of money. The people really trying to get rid of the estate tax have been backed by really billionaires who really want to avoid large estate tax. I mean, they're the ones that would really pay a significant amount. Almost anyone else in this country is never going to pay an estate tax. There aren't small businesses going out of businesses because of estate tax. When an estate is planned, all the considerations are taken. There are so many methods and different ways you can defer different assets and shield them. Some estate planners and lawyers are hired so that once someone inherits an estate, the estate will cover the tax, the person inheriting will not. And every effort is made to lower that, so that really it would be, it's someone who's getting just around a $2 million estate. It's going to be a low number to begin with, but the estate originally probably would have been much more, but they've done so many different tactics to lower it towards that amount, so more wouldn't be owed on the estate. And when I was in DC working on this, there were so many lawyers and estate planners that went through all the different methods that you can use to shield assets. And the last thing I'll say is that oftentimes money is shielded on taxes so that the taxes aren't paid on different assets and income. And then they're transferred to an estate. And if there's no estate tax, and I mean, it's just money that's being shielded and transferred to others. So I'll end there. I know we've been working a long time, so I could go on and on talking about all the technicalities and the different stories of this, but I'll answer questions. And if there's more data requested, I'll make sure to have that for all of you before the work session. Thank you.
Thank you very much. Representative Carmichael, you have a question.
I do, and I'll save most of it for the work session, but I have a transportation business that someday I'll pass on to my kids that presently work in it. So I'm kind of concerned about singling out other industries that would get an additional break. I think taxes should be more fair, more evenly distributed. I'm not saying that nobody should pay them, but I have a problem with just because I'm in transportation and somebody else is in agriculture, fishing, or lobster, then my family would have to pay a higher tax on what I leave behind. So have you given thought to making this a more evenly distributed tax, I guess you'd say?
Yeah, that's a good point, Representative Carmichael. And originally, I felt that my proposal was fair as it is and really didn't impact many people. And again, with estate planning, there's ways you can structure your business before you pass it on to family members that really takes away a lot of these liabilities of an estate. And there's so many ways to do that where it wouldn't be a huge impact to whoever would take on that estate. And so I thought it was fair, but there was a lot of testimony from business advocacy groups that turned out people in these kind of iconic main industries that a lot of the focus was on them. Especially they were talking a lot about the farms and the loggers and to some extent the people in the fishing industry. So because of that, some legislators and senators said you should really do more to protect them. I'll go back in my notes, sir, and find out exactly the unique circumstances where they felt that there should be extra consideration for those industries as opposed to the others. And you bring up a good point, and I will research that and talk to some people, and I'll get back to you in the committee on. I don't recall all the technical reasons, but I'll do the best I can to recover that and at least explain to you. You have the right to know why it was proposed for certain industries as opposed to others.
Thank you. I'll have more for work session. Either that or we'll talk.
Yes.
Okay, next.
Great. Any other questions for Representative Collings? All right, seeing none, we will start our testimony in favor of the bill, starting with Sarah Austin, followed by Ann Danforth. I think Sarah is just coming over from cyberspace, so apologies.
I'm first.
You're first.
Okay. Well, thank you, Representative Terry and members of the Taxation Committee. My name is Sarah Austin. I'm a tax and budget analyst at the Means Center for Economic Policy and here to testify in support of LD 1524. The estate tax paid only by the very wealthiest is a critical tool for reducing inequality and investing in the things that create shared prosperity. But over the last decade, Maine's estate tax has been hollowed out, delivering a massive tax break to the ultra wealthy while funding for our schools, communities, and healthcare has fallen behind. Mainers experienced dramatic economic inequality. Between 1973 and 2015, the top 1% of Maine families captured 42% of all income growth, leaving just 57% of the remaining income growth for the bottom 99% of Mainers. That income inequality is correlated with wealth inequality. Wealth inequality is 10 times more concentrated than income inequality. Wealth for the poorest 10% of Americans has actually declined over the past 5 decades. And racial disparities in wealth today are as stark as they were in 1963. With white family wealth 7 times greater than Black family wealth and 5 times greater than that of Hispanic families. It's important to be clear about what we mean by wealth. While income is money coming into a family, wealth is a family's assets, things like savings, real estate, and business, minus debt. Both are important sides of families' financial security, but wealth cushions families against emergencies and gives them greater means to move up the economic ladder. A staggering 60% of household wealth in the United States is owned through inheritance rather than direct labor. If our economy were a level playing field, all Mainers would have equal access to the foundations of success. Instead, the generational dimension of wealth means one generation is passing its wealth inequality onto the next in a snowballing fashion that has contributed to things like white families owning more wealth than Black families. These inequalities make some families unable to access what they need for economic security, such as safe housing, quality education, and good paying jobs. We all know that income inequality and wealth inequality are a problem. Our state's estate tax exemption is making it worse. After several rounds of estate tax cuts, the carve out for millionaire and multi-million estates in Maine is more than 5 times larger today than it was in 2011. Currently, Maine's estate tax applies to estates worth more than $5.9 million for individuals or $11.8 for joint estates. At this exemption level, just over 20 Maine estates pay any tax at that level. LD 1524 would bring Maine's estate tax exemption back to where it was in 2015. That is $2 million being completely tax-free and having that 8 to 12% tax on anything above that, and would generate about $16 million per year. Past estate tax data that many filers owning a state hold could also be residents from outside of Maine. The millions generated by a strengthened estate tax could be invested in education, housing, and infrastructure, strengthening those pillars of our economy and helping put prosperity within reach of all Maine families, not just those at the top of the economic ladder. Conversations about the estate tax inevitably turn to questions about who pays. The reality is that most Mainers are lucky to earn $2 million over an entire lifetime, let alone have $1 million estates to pass on to their heirs. Inequality grows when our tax system is tilted in favor of the wealthiest, as it was when lawmakers cut the estate tax several years ago. That inequality harms economic growth. Our economy suffers from declines in labor productivity and consumer demand when access to education, healthcare, and capital is limited because of inequality. At the same time, concentrated wealth typically yields unbalanced political power, leading to policy choices that favor the wealthy at the expense of investments that support economic mobility and reduce poverty. The Organization on Economic Cooperation and Development recommends increased access to education and higher taxes on the wealthy to reverse the loss of economic growth that stems from inequality. A more robust estate tax is part of the solution. It's also important to note that this bill does exempt working farmland and heavy capital equipment of fishing, forestry, aquaculture, and agriculture businesses up to $3.8 million. For this bill, that would essentially keep the exemption amount for these businesses unchanged, as they would be allowed the $2 million exemption this bill would suggest, plus $3.8 million exclusion for working farmland and equipment for a total of $5.8 million, or roughly what the estate tax exemption is right now. So with that, I urge the committee to lower Maine's estate tax exemption. A more robust estate tax will improve economic opportunity and help fund needed investment in Maine's communities. So I'm very happy to take questions and find more data for the work session as needed.
Excellent. Any questions for Ms. Austin? All right, seeing none, I would just love to have you and your data be at the work session as well. That would be great. And perhaps to maybe focus on Representative Carmichael's question earlier of industries such as his. That'd be great.
Happy to do that. Thank you.
And Dan from Maine Equal Justice, welcome back.
Thank you. Good afternoon, Representative Terry and members of the Committee on Taxation. It's good to see you again. I'm Ann Danforth. I'm a policy advocate at Maine Equal Justice. We're a civil legal services organization, and we work to increase economic security and equity for Mainers. Thanks for the opportunity to testify in support of this bill. As I've noted in this committee before and just this morning, COVID-19 has exposed gaps in our safety net. So I won't repeat myself since I know you've all had a long day, but I will finish up on the same theme, that as we're looking to rebuild our economy following the pandemic, we have the opportunity to build something better and fairer. To this end, Maine Equal Justice has been working with people directly impacted by poverty, as well as advocates and other stakeholders, to begin to build a shared vision for achieving economic security for everyone in the state. While the group coalesced around the need for direct income supports, the group also agreed that in order for an income solution to be effective, it needs to target racial and economic inequalities, including the wealth gap that gets at disparities in assets and net worth. These disparities are particularly stark across racial lines, with white families more than 3 times as likely as Black families to receive an inheritance. And when they do, the inheritance received by white families is almost triple what Black families receive. An important first step we can take to begin to remedy this type of structural inequality is to adopt a tax code that increases taxes on the wealthiest, while putting those resources into supporting those who need it most. Thank you for the opportunity to express our support for this bill.
Thank you very much for your testimony. Any questions for Ms. Danforth? All right, seeing none, thank you very much. Next up is Jan Collins. Following Jan Collins will be Dusty Sprague. Welcome, Ms. Collins. Ms. Collins, are you with us? All right, we'll hold off.
Okay, can you hear me?
Yes, we can hear you now.
Okay, I'm sorry. I'm having trouble with my video. For some reason it stopped.
That's okay, we can hear you.
Okay, thank you. Probably better for you that you don't see me because I'm on a construction site. Okay. Greetings, Senator Chipman and Representative Terry and honorable members of the Taxation Committee. My name is Jan Collins. I'm Assistant Director of Maine Prisoner Advocacy Coalition and a member of Mainers for Tax Fairness. And I'm here to support LD 1524 and 1704, although I know you're not hearing me today. My father suffered from substance use disorder, alcoholism. When he was arrested and sentenced, my mother was left with the care of 4 children under the age of 5. We lost our apartment, transportation, and his income, our only means of support. We would have been homeless, but for my farmer uncle allowing us to live in a plywood trailer he hauled to county fairs. We had no running water and 2 plywood bunks to share between the 5 of us. My sister and I were tucked into either end of the top bunk, and my 2 infant brothers shared the bottom bunk with my mom. Our plumbing was an outhouse. When a parent is in prison, the whole family goes to jail. Any resources that might have been holding the family together are lost, and more often than not, the family on the outside is left in desperate poverty. It took my family decades to gain a solid foothold, and my father never did. What would have saved our family? A recognition that my dad suffered from a treatable medical condition. I try to imagine what my life might have been like if instead of jail and prison, my father had been able to enter treatment. What would it have been like to have a father in my life? Anyone would tell you Ray was a great guy, except when he drank. We have an excess of jail beds in Maine and not enough substance use disorder treatment beds, and not enough beds for people with mental health needs. We have an excess of jail beds in Maine, but not enough nursing home beds and not enough shelters for people who are homeless. We have funds to keep 29 children incarcerated at Long Creek, but not enough money to provide for juvenile emergency mental health beds. We have sheriffs vehemently stating that county jails are the largest mental health facilities in their counties with no resources to treat their mental health conditions, and still, we do not adequately fund mental health services. We continue to fund jails and prisons, but fail to fund programming and reentry services that would increase the chance of success upon release. It is time to reflect on the terrible toll on our communities the current taxation policies have taken on individuals and families. There are alternatives that would place us on a path to healing and vitality. It is time to change direction and taxation priorities. Stop cutting taxes for the wealthy and fund programs that ease pain and suffering and heal our communities. We have a choice. Thank you.
Thank you very much for your testimony. Are there any questions for Ms. Collins? Seeing none, thanks for sticking it out with us for all day. It's been a long one.
Thank you. I appreciate it.
Sure. Next up is Desti Holman Sprague from Maine Women's Lobby, following, sorry, for Mainers for Tax Fairness, apologies. Following Ms. Sprague will be James Parakilis. Welcome. Sorry about that.
No, it's quite all right. I can understand how you might be confused, taken aback by that. So good afternoon, Representative Terry, Senator Chipman, members of the committee. I am Desti Holman Sprague. Many of you know me as Desti from the Maine Women's Lobby, and indeed I am, but I am here today representing Mainers for Tax Fairness. Mainers for Tax Fairness is a coalition of 22 organizations, including my own, that represents teachers, healthcare providers, policy experts, workers, small business owners, advocates for kids and families, low-wage workers, and other groups like mine, which are fighting to improve tax fairness and build a stronger, more inclusive economy for Mainers. We are here in support of LD 1524 and when you get to it, to LD 1704, because we know that when all of us contribute our fair share to society, we can do big things, including the ability to make economy boosting investments that benefit all Mainers. I think that folks before me have spoken really eloquently about how the recent changes in our tax code have really reduced the funds available to our communities while contributing significantly to the rising wealth gap. So I will allow you to read this testimony, but know that I echo the folks who have come before me on that topic. I also want to echo the folks who have talked about racial inequality and the way that the estate tax really undermines our efforts to move toward a more racially equitable society. We really believe that this bill or these set of bills helps to address that racial inequity, because wealth taxes, such as the estate tax, are one of the most effective tools for addressing inequity on both of those fronts. After decades of cuts, we have really seen the results, and we know that now is the time to roll these back, to raise the resources necessary to make investments in our community to help all Mainers climb the economic ladder, even if they don't have economic family wealth. So thank you for listening. I hope you'll join us in supporting a more effective wealth tax and a stronger estate tax to make a stronger Maine. Thank you.
Thank you very much. Are there any questions? Seeing none, thank you so much for speaking today. We appreciate it.
Thank you.
Next up is Mr. Parakilis. Following Mr. Parakilis, I think we are done with folks speaking in favor of that are in the attendee room. If anybody else is here for that, you can raise your hand and we'll let you in. Welcome back, Mr. Parakilis. How are you? Oh, there's Sam. Great.
Thank you very much, Representative Terry, and to all the hardworking members of the Taxation Committee. My name is Jim Parakilis. I live in Lewiston, and I'm here to testify in support of LD 1524, Representative Collins' act to lower the main exclusion amount on the estate tax. I've come here today to tell you how I feel as a Mainer whose estate might or might not be taxed depending on how you set the exclusion amount. I know that if I were to die today, my estate would not be taxed. If you lowered the exclusion amount as proposed in LD 1524, my estate might be taxed. But of course, my wife and I do not know how our net worth will change by the time either of us dies. So my thoughts about how the estate tax will affect our estates is based on uncertainty. My wife and I are retired professors. We spent our careers being well paid by our employers, and we were able to put enough money aside to retire. Still, retirement brings financial uncertainty. You don't know how long you've got left, or how your income will hold up, or what financial strains your declining health may impose on you, and you're no longer able to add to your resources. But eventually you die, and in the twinkling of an eye, the uncertainty disappears. You no longer need any property, any income, anything at all. What a perfect moment for the government to claim a piece of what you own. This is the first moment in your life when it can tax you without fear that it will be causing you the slightest discomfort or anxiety. Of course, my wife and I would like to pass something on to our children, so let me add a word about that. We have 2 grown sons. We are quite ordinary parents in that we have tried to give our children every benefit in our power. I include monetary benefits in that, though I hope we have imparted some things that are worth more than money. In any case, they are standing on their own feet in every sense, and when we die, it shouldn't matter much to them whether they inherit every penny we possess or the state of Maine takes a reasonable share. Of course, their futures hold uncertainties too, but all the people of Maine face uncertainties, and not just about their own resources. They face the uncertainty of whether their local, state, and federal governments can provide the services and support they need, whether they are struggling or thriving. And as the state of Maine struggles to provide those benefits in the face of a pandemic and an economic downturn, it's clear to me that the state needs to look beyond the current crisis and any temporary infusion of money from the federal treasury and provide itself with a sustainable flow of revenue that draws fairly from those who are most able to contribute. So please allow me and others who have more than average resources to put those resources at the very moment we stop needing them toward helping our whole state and all its citizens along with our own offspring. Thank you very much, and I'm happy to take any questions.
Thank you very much, Mr. Parakilas. Any questions? Seeing none, we appreciate you being here. Thank you.
Thank you.
And next up is Representative Zager. I apologize, I didn't see you in there earlier. We would have had you testify right after Representative Collings.
Thank you, Madam Chair. I actually was trying to be in 2 places at once, so I just popped in when I could. So I appreciate your consideration. Representative Terry and honorable members of the Taxation Committee, 2 for 1 today, I guess. I am Sam Zager. I'm still honored to represent District 41 in Portland. Very pleased to testify in support of LD 1524 as a co-sponsor. I thank Representative Collings for introducing it and the other co-sponsors. My testimony will actually be essentially 2 graphs, which are included in my written testimony. The first graph looks at family income since right after World War II. Around 1980, the highest income families started to far outpace everyone else. Up until then, everyone was basically, all things were improving. Everyone was getting wealthier and quality of life improved. But around 1980, things really seemed to split. And the highest income families started to far outpace everyone else. And so the question is, why? I mean, did the richest families suddenly contribute more to our society and therefore earn a higher share of GDP? I submit that nothing magical happened in 1980, and something seemed, however, to structurally change. And it's getting more pronounced over time. The graph shows that pretty plainly. The second graph looks at the share of US national income that the top 10% has commanded over the past century. And Representative Collings in his testimony talked about President Theodore Roosevelt, and to provide a bit of historical context. As you look at this graph, this second graph, from World War II onwards, there was low inequality. That's income inequality, and it was stable. Certainly there were people who were more wealthy than others, but that was not extreme. And I certainly am not proposing that people shouldn't get what they worked hard for. But there are calibrations that can occur. Just as in the first graph, we see a change starting around 1980. In the past 20 years or so, the difference between the haves and the have-nots has gotten as extreme as it was in the 1920s and 30s. Those, of course, were the years leading up to and including the Great Depression. So I'm not an economist professionally, but clearly something is going on here, something structural is going on, and this committee has an opportunity to adjust the structure. LD 1524 would return the estate tax exclusion from currently around 5.6 million to 2 million, with exceptions for family farms, fishing, and wood harvesting businesses. These are reasonable. I do believe this is a reasonable measure to take steps towards greater fairness and sustainability. I really appreciate the committee's consideration. I know it's been a long day. Be happy to address any questions that I could.
Thank you very much for presenting your testimony, Representative Zager. Are there any questions? Seeing none, we appreciate you being here and sharing those graphs with us as well. I was looking through them. They're very thorough. That's terrific. Thank you.
Thank you, Madam Chair.
All right. So speaking next, we've got through all of our folks speaking in favor of. So now we will hear people that are in opposition of the bill. Going first will be Linda Caprara from the Maine Chamber. Following Ms. Caprara will be Chris Pinkham. Welcome, Ms. Caprara.
Good afternoon, Representative Terry. It's been a long day. This is the longest so far. And members of the committee, my name is Linda Caprara. I'm a resident of Winthrop and I represent the Maine State Chamber of Commerce. We are testifying in opposition to LD 1524. The Maine State Chamber of Commerce has always been on record for increasing the estate tax exemption amount or eliminating the estate tax altogether. We feel that the estate tax hurts businesses, Maine businesses, particularly smaller businesses and farms, and we are one of the ones who have said fishing and farming in the past. But that's not all. It's small businesses in general who work very hard to pass along assets to their children and grandchildren. And this would take away that opportunity and instead slap them with a massive death tax. If they can't pay the taxes up due, they may be forced to deplete any working capital they have in the business or sell assets or property to pay the tax. Ultimately, it punishes and penalizes success. Back in 2015, the legislature did take significant steps as part of tax reform at the time to increase the exemption amount in recognition of the penalizing estate tax. So they did reverse that back in 2015. We also feel that increasing this tax would encourage retirees to leave, taking their assets and domiciles out of Maine permanently. For these reasons and more, we urge you to vote against LD 1524, and I'll be happy to answer any questions. I'm actually at an appointment, that's why you don't see me. To leave.
Are there any questions for Ms. Caprara, or shall we let her get back to her appointment? Thank you for being with us. We appreciate you.
Oh, thank you.
Multitasking. Today is the day of multitasking.
Yes.
All right. Have a good one. Thank you.
Bye-bye.
Next up is Chris Pinkham from the Maine Bankers Association. Welcome, Mr. Pinkham.
Good afternoon, Representative Terry, and thank you to the remaining members of the Taxation Committee for surviving this long day and this long session. My name is Chris Pinkham. I'm a resident of Freeport. I'm president of the Maine Bankers Association. We represent the 28 retail banks in Maine and there are 9,000 Mainers who work in banks. We are opposed to this LD. And, as depository institution, Maine banks are responsible for safekeeping. In fact, the asset base for Maine banks is over $36 billion. As fiduciaries, our trust departments work with a lot of clients, helping them to maintain their assets, supporting their retirement years, and to give them guidance and sometimes courage to maintain their residency in Maine because of the other states and how they have adjusted their estate taxes. By keeping those funds in Maine and those individuals, we are better able to support the needs of the Maine economy. It's been discussed that Maine has a rich tradition of family-owned businesses, and some of those have been considered in the proposed LD. They were discussed as Representative Collins so correctly identified at the past session. They brought forward an amendment but there are many other types of Maine businesses. There are retail establishments, and as a resident of Freeport, I happen to know one very well. But there are the people in the hospitality industry. And as these generational shifts occur in families, Maine's tax policy is always a discussion point, including that potential impact of the estate tax. And while I appreciate all of the comments and statistics from the proponents, what happens is when people get together and they look and say, well, I really love Maine, I want to stay in Maine, but there are financial advisors, there are lawyers, in many cases, friends who have become snowbirds who recommend otherwise. We're concerned that this bill, if you were to pass it, it imposes more barriers to retaining that wealth here in the state of Maine. It discourages those who are considering transitioning their residency to another state for doing so only because of things like the estate tax. And one of the reasons we need these people to stay in Maine is because they're the ones, in many cases, that can generate new business opportunities, increase employment growth, or start new businesses. These are also people that are financial contributors to Maine's nonprofits, as well as to other organizations. So while I have listened carefully this year and in many years in the past, as we've discussed why Maine should change its estate tax numbers, I think there is a reality check that you need to consider. And that is, Maine is only one of 11 states that still has an estate tax. There are 5 states in the country that have an inheritance tax. Only Maryland has both. And in recent years, the trend has been for states to eliminate their state tax, recognizing that their citizens are very mobile and that they will actually move to other states where there are no estate or inheritance taxes. Tennessee repealed their law in 2016. New Jersey repealed theirs in 2018. Delaware repealed theirs in 2018. And New York has been raising its exemption levels. And this year, ironically, it's going to be at 5.9 million. And as Representative Collins mentioned, Maine is at 5.87 this year. We will certainly be at the work session, and we would urge you to vote against LD 1524, and I will be happy to answer any questions.
Are there any questions for Mr. Pinkham? I just have one, and I wonder if it's just maybe a typo on your testimony. It says that Delaware repealed its estate tax in 2018, and then it increased their exemption from
exactly.
That's
So
a typo?
thank you. That's a typo. And I made a note to mention that in the testimony, but somewhere over the last 6 hours, I think I just forgot about it.
It's totally okay. Okay, appreciate it. Thank you. So when you're reading testimony, just strike that last line. Thank you. Appreciate it. All right. Seeing no questions, thank you so much for your testimony. We appreciate it. We are done hearing testimony, but again, as always, please be sure to read the testimony that's on our website. Just a quick note, though, there is testimony from Rafael Macias, I think, that says on the website that it's speaking against, and if you read the testimony, you'll see it's actually speaking in favor of. He was here earlier, but I think he had to, as most of us have the rest of our day to get on with. So this closes the hearing on LD 1524, and we will open up our last hearing of the day. Senator Bailey's bill, LD 1638, an act to help seniors and certain persons with disabilities remain in their homes by providing the deferral of property taxes. Senator Bailey, thank you so much. I've seen you have been on most of the day, and we appreciate you sticking it out with us.
Thank you. I'm in that category of multitasking, so, but yes, I've been hanging out, and thank you all for putting in a very long day. Representative Terry and esteemed members of the Taxation Committee, my name is Donna Bailey. I represent Senate District 31, which is Saco, Old Orchard Beach, Hollis, Leamington, and part of Buxton. I come before you this afternoon to introduce and offer testimony in favor of LB 1638, an act to help seniors and certain persons with disabilities remain in their homes by providing for the deferral of property taxes. I apologize for the ringing phone. It should stop soon. This bill is the same as the amended version of my bill last session, LD 682, which was unanimously passed out of this committee in the 129th legislature. LD 682 was ultimately passed in both the House and the Senate, but was not funded off the table before the COVID adjournment. In the intervening years, not much has improved for our seniors when it comes to property tax relief. I still hear of seniors having to choose between buying food, medicine, or other necessities and paying their property taxes. Seniors who have worked their entire lives to pay off their mortgage in hopes of living out their retirement years in their homes are struggling to pay their ever-increasing property taxes. We're also facing new property tax valuations due to the booming real estate market, which will further complicate the problem for seniors on fixed incomes. I know you all know this already. The tax deferral program laid out in LD 1638 is modeled on a similar program that was in place in Maine from 1989 to 1991. It allows the state to pay the property taxes for those who qualify and obtain a lien on the real estate for reimbursement after the property owner or owner passes away from their estate. The property taxes paid by the state are repaid when the property is sold or the participant or her spouse passes away. The last of those in the prior program only recently passed away. It's my understanding that the repayment rate of the prior program was 100%. Allow me to repeat this. The repayment rate of the prior program was 100%. The current bill before you is the version worked out last session in collaboration with Maine Revenue Services and other stakeholders. It also incorporates the funding mechanism proposed in AFA as a table amendment before the early COVID adjournment, with the addition of the home program as the default if there are not sufficient funds in the property tax relief fund. I would also ask this committee to look at and explore alternative ways to fund this program, such as the soon-to-be-received Homeowner Assistance Fund within the Bureau of Consumer Credit Protection or similar, keeping in mind that any funds expended are temporary transfer of funds until the program becomes self-sufficient. If we are truly committed to finding ways to help our seniors be able to stay in their homes throughout their retirement years, we must find a way to help them pay their property taxes. I do not in any way believe this is the total solution to the ever-increasing property taxes that are forcing many elderly from their homes. It is, however, a concrete way to help and assist some to be able to remain in their homes. Also, it will at some point, as mentioned above, be self-sustaining once some of the monies expended are paid back to the state. I thank you for your time and your attention, and I'm happy to try to answer any questions you may have.
Does anyone have any questions for Senator Bailey? I just have one, Senator. I think I just heard you say that the last remaining person that was using that program recently passed away.
Yes, I think it was 2018.
Okay, and if I'm not mistaken, the former program, the program that ended, did have a sunset that I think, if I remember correctly, was a sunset because of budget. I think I could be wrong.
Exactly. Yeah, they had to stop admitting participants in the program because it was, again, the early 1990s, and budget constraints and shortfalls, they couldn't fund it any further. But the people who had already signed up for it were allowed to continue in the program.
And your bill has no sunset to it. We would like to keep doing this for our seniors.
Correct.
Okay, terrific.
Correct.
Great, thank you so much. Looks like Representative Kryzak has a question.
Thank you, Madam Chair, and thank you, Senator. I remember the bill from the 129th, but I can't remember, is there any interest charged when they pay it back?
There is a small interest amount that is designed to just cover the cost of the program. So the administrative cost, not to earn any money for the state, but just for the state to be able to break even on the administrative cost.
Okay, and there's no late fees attached to that? then?
No, no.
Thank you.
Any other questions for Senator Bailey? Seeing none, thank you so much for your testimony. We really appreciate it and for hanging out with us all day.
Yes, thank you.
Next up, speaking in support of the bill is a co-sponsor, Representative Fay. Following Representative Fay, we will hear from Mr. Delicata from Legal Services for the Elderly. Welcome, Representative.
Well, thank you very much, Representative Terry, and extremely intrepid members of the Taxation Committee. I'm Jessica Fay, and I represent the people of House District 66, which is parts of the towns of Casco, Poland, and Raymond. And I am here in enthusiastic support of LD 1638. Older Mainers are overwhelmingly prefer to stay in their homes in the communities to which they're connected. Our communities are where our families, our friends, our faith community, our favorite librarian, and shopkeepers who know what we like are located. Research shows that older people who have social connections are happier and healthier. I think we all understand that so well now because of COVID. For many older adults on fixed incomes, property taxes can be a significant barrier to keeping a home and remaining in the community that provides safety, health, and comfort. As part of the age-friendly initiative in my town, we did a community assessment survey to try to figure out where to focus some of our energy. And one of the needs that bubbled up was property taxes and affordability. The sense wasn't that they were too high. Raymond prides itself on being frugal and having the lowest property taxes possible. People who had been able to keep up while they were working and earning a living and who were now living off of Social Security were having trouble keeping up and were looking for some way to afford to stay in their homes. As a House co-chair of the Caucus on Aging, I have had the privilege of working on issues that impact older Mainers for a few years now, and one of the issues that always comes up is the topic of property taxes and the way that they impact older folks. LD 1638 provides us with an important tool for assisting lower income people and people with certain disabilities to remain in their homes without placing an additional burden on municipalities. And I think that's an important piece. This bill would allow more municipalities, and particularly ones with a smaller tax base, to offer property tax deferral program without impacting their own ability to provide services. For so many people, their home is their biggest asset and a source of pride and comfort. I'm certain that each and every one of the legislators here has heard a story of people in their community trying to figure out how to make ends meet so they can remain in their homes. This policy would provide a good solution, a piece of the puzzle, for those struggling to pay property taxes. And I thank the committee very much for your time. I'm happy to try to answer any questions.
Thank you very much. Any questions for Representative Fay? All right, seeing none, thank you so much for your testimony. We really appreciate it.
Thank you.
Next up is Leo Delicata from Legal Services for the Elderly. Following Mr. Delicata, it looks like Eric Jorgensen will speak to us in neither for nor against. Welcome, Mr. Delicata. It's the first time we've seen you this session.
Thank you very much, Representative Terry and members of the Taxation Committee. My name is Leo Delicata. I'm a lawyer with Legal Services for the Elderly. And for the third time, I'm appearing to testify in favor of this initiative. The last time and the time before that, the bill was unanimously voted ought to pass from this committee, but ended up dying on the appropriations table for lack of funding, and I'm hoping that the good senator will have better luck this time. In any event, I am not going to read all of this testimony. Most of what I have has already been said, except to provide maybe a few more details. One of you asked about the interest rate, and the interest rate really is modest. It's the prime rate rounded up minus 1%. And the eligibility criteria is really only age and limited income and assets. The applicants must be 65 years of age or older, or unable to continue employment by reason of physical disability. They must have $40,000 or less in aggregate income in the year prior to the year they apply. And an individual must have less than $50,000 in liquid assets, or $75,000 if more than one individual owns the home. That's the aggregate amount. So this is a program for people of modest means. One of the things that I think you could beneficially add, if the senator will let me suggest this, is I wonder about people who are eligible for a poverty abatement, and maybe they might not get the poverty abatement or even apply for the poverty abatement because of this program. And I think that it would be good if they simply got a notice on the application that simply said, if you think you qualify, you are also eligible for applying for a poverty abatement. So in conclusion, I just want to say that based on the proven performance of this program before it was suspended, we expect that this deferral program will seriously reduce the incidence of unpaid property taxes by individuals who are over age 65 or disabled. And as a result, it should make tax lien foreclosures and subsequent sales of homes that belong to this population a real rarity. So I hope that you voted ought to pass, and I'm more than happy to answer whatever questions you'd like to ask. Thank you.
Thank you very much, Mr. Delicata. Does anyone have any questions? All right, seeing none, thank you so much for your testimony. And
thank you.
Tenacity with the bill. Next up, speaking neither for nor against, is the Honorable Eric Jorgensen from Maine State Housing Authority. Welcome.
Nice to be here. Thank you. I trust you can hear me all right. Thank you for being here. It's nice to see my neighbor, Mr. Delicata, here as well. Senator Chipman, Representative Terry, and esteemed members of the Committee on Taxation. I guess it's just Representative Terry right now. My name is Eric Jorgensen, Director of Government Relations at Maine State Housing Authority. As with other bills that have brought me to you this session, to your doorstep, it's the Home Fund that brings me before you today. And as you likely know, Maine Housing is very protective of this resource, which represents the chief way that state funding supports priority housing needs statewide. The Home Fund supports all the areas that the legislature has indicated are most important, from support for the homeless to getting first-time home buyers into their houses, to production of new multifamily apartment buildings, to critical home repair for low-income families. It's used to match investments from the federal government and the private sector to achieve many of the legislature's explicit goals in a number of areas relating to housing. So LD 1638 proposes to use the Home Fund as a funding source for a program that provides property tax relief for seniors and disabled homeowners. It'll help people on fixed income remain in their homes, even after the property tax burden that would otherwise be unaffordable to them. That's a very good thing. We have no arguments whatsoever with the potential value of this program. We know it's a proven one. But what we must object to is this particular funding source being used for this or any type of statutory program. The Home Fund's lost more than $83 million over the past 15 years to legislative raids for special projects, budget balancing, and other needs. And we finally entered the first biennium in recent memory where the Home Fund's not slated to be tapped for some other purpose. And having it intact is important if we're to meet our housing goals for Maine. Maine Housing currently has the largest affordable housing construction pipeline in our agency's history, and that's due largely to legislative and gubernatorial action, like the establishment of the state low-income housing tax credit, the signing of the senior housing bonds, and the record balance in the Home Fund, 101% of which is currently committed for this year. We're really glad to learn that Senator Bailey's been considering some other sources of funding for this program. We urge her and this committee to fund it differently. As a general policy, we've always opposed any attempts to place any kind of statutory program within the home fund. And if we were to approve of this, we worry that every other program that people have wanted to add to that in the past would be back in play. More specifically, we're concerned that a carve out for a program like this has the potential to grow and consume more of the fund, which itself expands and contracts dramatically as a function of the real estate market. There's one more important distinction I'd like to make, and that's that this bill may be about housing affordability, but it's not necessarily about affordable housing. That's a subtle but important distinction. People who could qualify for this might simply be living in valuable, appreciated properties. Now, that doesn't make their plight any easier, but they do own a significant asset, while most of the people that Maine Housing serves have very low or non-existent assets. There was concern in our office based on that fact that this program would not meet the low-income parameters outlined in the Home Fund statute and thus possibly wouldn't even be legal. But I really want to conclude this on a positive note. This bill proposes a fund that will ultimately revolve as tax reimbursements are made to towns, but are ultimately returned when the beneficiaries of the program move or pass away and their houses are sold. This makes this an unusual animal within state government, as it does have the potential to be self-sustaining. While the details of this tax relief fund make it inappropriate for the home fund, at least in our opinion, it would seem that at this moment of significant general fund surpluses and federal money coming in, there will likely never be a better time to set a program like this up, a valuable program. And it's a program that will surely do a lot of good, and we hope it's successful, just not at the expense of the urgent work being completed using the home fund. So with that, I'll say thank you and appreciate your giving me the time to talk today. And I'll be happy to answer any questions you might have.
Thank you very much for your testimony, Mr. Jorgensen. Any questions? Seeing none, thank you so much. We appreciate you being here and sticking it out with us.
You've had a long day.
That's nothing, right? So let's see. That concludes the work session for LD 1638. Please, again, just make sure to read through all of the testimony. We've got a couple pieces of testimony there that are written, as are there plenty on the rest of our bills that we heard today. So we're in, we've got one more piece of, well, two, I guess. Julie, you have an amendment for us on something, I believe, that I think I saw in an email earlier, and we are scheduled for a work session for LD 1209, which we heard yesterday. That is the unorganized territory municipal cost, their budget. So 2, 4, 6, oh, wait a second, 2, 4, 6 of us. There are 6 of us here now. We need 7 to vote. I believe Avery is getting permission for us to vote without a senator at the moment, but we still need one more person to jump on. I'm leaning towards going through this quick work session with you, Julie, and then hoping we can get that one extra person on here within the next, say, 10 minutes or so, so we can vote this off and get it onto the calendar for next week. Representative Kryzak?
Yeah, Madam Speaker, I've been told that we cannot vote unless we do have a senator. I didn't know if Senator Pouliot had said he was not available today. I could try and contact him.
Yeah, he's not. He's out of town, I guess. And Senator Chipman and Senator Libby are both working. I think Avery was checking in with the Speaker's office and the Senate President's office. We can get permission to vote without a senator, but we still do need a quorum. So that's the big thing right now, is literally one extra body. It doesn't matter which one of us it is. So maybe I'll leave it to you all. And yeah, so we do have permission to vote, but we do need that extra person. So I'll kind of put it out there to the committee. Do we want to listen to Julie's analysis of this and then kind of hold off a bit and see if we get folks to come in? or do we want to put this off? Again, my preference is to get it done today so we can get these folks the budget that they need to get their work done.
Let's, if we can find one more person, let's do it.
Yeah. So let's see. I think we can, I think both Representative Collings and Gramlich are all testifying right now. So hopefully we can get through the work session perhaps and have them jump in for the vote. Representative Kryzak, do you have another question or thought?
Nope, I forgot to lower my hand.
No worries. All right, so Julie, let's get in.
Okay, sure. And I don't know if Avery can hear me on the phone, or perhaps Representative Terry also. Ms. Bodine, Nancy Bodine, the fiscal administrator of the unorganized territory, is in the attendees panel, and you can maybe promote her so she's available to answer questions. This is LD 1209, which you heard yesterday, an act to establish municipal cost components for unorganized territory services to be rendered in fiscal year 2021-22. As Ms. Bodine explained to you yesterday, the purpose of this bill, the statutes provide for this format and this context, that the fiscal administrator's office prepares a budget for the unorganized territory for municipal services and presents it to the legislature. It's then up to the legislature to enact this amount. It's essentially the budget making process for the municipal budget in the unorganized territory. Of course, it's unorganized territory. There are no municipal governments there, so they have no one to perform that function. The fiscal administrator's office performs a large part of that. However, because there's no government there to provide services either, municipal services are provided in the unorganized territory because they have things like children that need to be educated and roads that need to be plowed and voting stations that need to be set up and a place for people to pay motor vehicle excise taxes. So some of those functions are performed by the state. The state provides education services for the children in the unorganized territory. The State Land Use Planning Commission performs zoning functions in the unorganized territory. Maine Revenue Services assesses the property and collects property taxes in the unorganized territory. And the money that's collected goes into a dedicated fund, the Unorganized Territory Education and Services Fund, once it's been collected by the state tax assessor, and then is used to reimburse state departments for the services that municipal services that they provide in the unorganized territory, and to counties for the services that they provide. Things that they would provide would be more in the nature of road maintenance, snow plowing, trash removal, a variety of services. There's also, you'll see on the list, there's an amount to the state for forest fire protection services. The state has units that provide forest fire protection all over the state. If they provide more than a certain amount of the valuation of a municipality, the municipality is required to reimburse. It's that the municipality has an obligation to provide a floor amount, and once the costs of a forest fire go over a certain amount, the state will provide services or reimburse them. The same situation applies in the unorganized territory. Structural fire is something that's handled by the counties, usually by contracting with a nearby municipality, that if there's a fire in township township range is the other thing, that a town will send its fire department over to fight the structural blaze. Although fires being fires and firefighters being firefighters, if there's a fire, the firefighters, whoever and wherever they are going to try to do their best to put it out. So that can get a little complicated. This was a big issue 30 years ago and isn't anymore. I should stop talking about it because it's not really an important issue anymore in this situation. So you'll see on the bill, there's amount for the state agencies that provide funding. We pay for the fiscal, and the unorganized territory pays for the fiscal administrator, pays for its share of fire protection as a municipality would, pays for general assistance, which is works through the Department of Health and Human Services, pays for the costs of main revenue services, and pays for the unorganized territory costs of the Land Use Planning Commission. And each county with unorganized territory puts together its own budget. It has to have a budget separately for the UT in that county. It's separate from their general county budget. So the UT services are funded by the municipal cost component. There is also a portion of the taxes that get assessed in the unorganized territory that cover general county budget in the same way that municipalities are assessed a certain percentage of the county budget that the municipality pays as well, and the costs go into their commitment and become part of the property taxes that they collect. There's another part of the budget. Well, okay, so you add up those services and you get an amount which is $30.7 million approximately, 30.8 if you round it correctly. Then there are some deductions from that amount. The unorganized territory does get revenue sharing. It does get some miscellaneous revenue. I don't know what that miscellaneous revenue of $10,000 is. I'm sure Ms. Bodine can identify it. There's also essentially balance carried forward from surplus left over from previous years. Of course, there's an attempt to collect enough money to pay for the services. If there's extra money left over in the year, it's carried over and used for the next year's budget. So that amount is in here as well. There are a few other sources, some somewhat ancient provisions like land reserve trust interest. There are some provisions with regard to long ago established public trust lands that say that some of the money must be used for unorganized territory purposes. There are school and tuition transportation charges, tuition and school transportation charges, which is money paid to the UT for as tuition and school transportation charges, and special teacher retirement funding from the state, which is something that a municipality would also be eligible for as a portion of the state's share of education funding to fund a portion of teacher retirement as well, bringing you all down to a tax assessment before the county taxes are added, because I think we probably don't know what those are going to be yet, of $28,432,913. If you approve that amount, it essentially becomes the commitment, except for county taxes, for the unorganized territory, and will be used in the calculation of the mill rate, essentially, for the unorganized territory. So assessor determines the value of all the property. They look at what the commitment is. They determine what the mill rate needs to be against the valuation of that property to raise the amount of the assessment, and that becomes the mill rate for the unorganized territory. The county charges are assessed only against the individual county. So there is a different mill rate for each county with unorganized territory, because the people from Somerset County don't need to pay for the taxes for Oxford County. So it is separately figured out that way. The state is just apportioned by dollar valuation entirely. That's my explanation. Ms. Bodine might want to add something to it. I'm not sure, and you all may have questions. So that's it.
Excellent. Thank you so much, Julie. Does anyone have any questions for Julie or for Ms. Bodine? This seems like it might be an easy vote. Would anyone like to make a motion?
I will move ought to pass.
Any second?
Madam Chair, ought to pass is amended. Is it a fiscal note?
It is, I mean, we do put a fiscal note on it. Essentially sort of describes what I just said in 2 or 3 sentences, which says that this is money for the property tax in the unorganized territory. It's expected to collect, $28 million, and that it will be spent for services. And but it is a fiscal note, that there is an impact.
As amended.
Representative Kryzak, do you have questions?
No, just a point of order, Madam Chair.
Yeah.
I have no problem with the bill and I will vote for it, but I still have a concern that we don't have a senator here. I hate to see it not go through because we're not going by, because I've never seen anything that says that the speaker and the president can okay a bill without a senator. All I've ever seen is there has to be a quorum and a senator present to make any vote. So, I mean, if you want to go through with the vote, that's fine, but I just wanted to make that point of order.
Absolutely. Julie?
The rules do provide that if there is not a senator present, that the committee can contact the president of the Senate, and the president of the Senate can authorize you to vote without a senator present.
Okay, so this will be a legal vote then?
It will.
Assuming you have permission of the president of the Senate.
Avery,
Yes.
Okay.
on mic and tell us what happened.
I'm sorry?
Yeah, Rose asked the Senate president and he said it's fine.
Excellent. Thank you. We appreciate that. All right, so we have a motion made by Representative Matlack, seconded by Representative Gramlich. Ought to pass as amended. All those in favor? And that is unanimous of those present. Avery, you got that okay?
Yep.
Terrific. Thank you so much. Thank you, Ms. Bodine, for your presentation yesterday and for working with us so quickly to get this done so you guys can have your budget.
Oh, yes, and thank you for turning this around very much.
No problem, no problem. Thank you, everybody, for jumping in at the last minute too. I really appreciate it. Representative Hanley, it's good to see you today. Thank you very much, everyone.
Thank you. Good to see all of you.
Oh, good. Julie, we have one quick amendment to go through.
We have 2 actually, if that's okay. There was one that arrived late yesterday afternoon, so I got it organized and emailed it out to you.
Terrific.
Either last night or this morning. I'm losing track of when I do things.
All right.
Okay, so the one that we've had around for a while is LD 527. Oops. I need to push the share thing. I think I did get my share situation. It wasn't me yesterday. It was a hardware issue, although now I seem to have lost my things in the parking lot.
I blame my computer problems on my cat walking across the keyboard yesterday. You can use that if you like.
Thank you. Well, I thought that we had gotten my problem shared, but we don't. Rats. I should have done this morning.
Did you email it to us, Julie?
Did you say did I or could I?
Yes, did you?
Yes. LD 527, although I think that one went out a while ago. Let me email them to you right now. I think it'll just take me a second here. Okay, there's that one. Attaching 1195.
I think I can share it if you want.
Oh, that's a possibility, yes.
How's that?
I mean, if you TX.
Got that okay?
Hold on a second, I'm emailing. I just got to type amendments and press send. and you will have emails. Okay.
Can you guys see that okay? Yeah.
I can see it fine.
Yes, that's it. Although it's strange because I don't, thank you very much. There's something wrong with my computer. We figured it out yesterday and it was all set. But it's not working again. Anyway, okay, so this is the amendment for LD 527, an act to exempt main care Appendix C private nonprofit PNMIs from the service provider tax. I mentioned previously when you were scheduled, yesterday, I guess, when you were scheduled, that I was hoping to be able to explain it. And I have since obtained the information that I need from Luke Lejour, who's the fiscal analyst in OFPR, who covers DHHS and main care issues. What's happening here is that, actually, there's something quite interesting happening here, but the first part of this, as you can see, there are a variety of appropriations and allocations and deappropriations and allocations. The first part in here, the first initiative, is providing funding to offset the loss of funding based on the removal of the service provider tax from PNMIs. So what this first part is indicating is that the money in the service provider tax is the other special revenue funds, a dedicated account. There will no longer be the money, there will no longer be 9.2 million in FY22 and 12.3 million in FY23 will not be going into that fund from the service provider tax. It's a fund that's available to match federal funds for purposes of drawing down Medicaid funding. What the language above that is indicating is that that same amount of money will be necessary from the general fund if the same services are to be provided through Medicaid, because the state uses the service provider tax to collect Medicaid money. If it can't use the service provider tax, it's going to have to use general fund money for that purpose. That's what the first part of this is indicating. If we could move on to the next page.
Yep.
It's a little more confusing, but there are a couple of other things that are happening in here. And the really interesting part of this to me is that what Luke told me is that DHHS, when it's calculating reimbursement to providers like PNMIs, takes into consideration the fact that part of their expenses is paying the service provider tax. We heard testimony when this bill was heard that said that those weren't part of the reimbursement. But according to the information we received from DHHS, it is in fact part of their reimbursement. So if they're no longer going to be subject to tax, DHHS will be reducing their reimbursement rates by that amount. Don't need to pay the tax, they don't need as much money. That's what this second page is providing for. It's deappropriating $1.7 million. I'll just refer to the first year. From the general fund, the state share portion of the rates that are paid to them, and $3.1 million from the federal share of the money that's paid to the PNMIs. So their rates are going to go down. That's one category, which is payments to providers. I don't understand the Medicaid categories, but there are two different places where these rates are paid. The other is PNMI room and board. And in this instance, it's general fund money only. This is not something that there is federal funds drawn down for. So what this is doing is providing for those changes that need to be made as a result of the fact that there will no longer be private service provider tax collected on the Appendix C PNMIs. How'd I do?
Pretty good and also pretty awful. Good description, awful program. So Julie, and that's it, right? This is just the final totals on the end here.
Yes, that's right. This is just a chart that says the same thing.
So can you remind us what our vote was on this?
Oh, interesting. We'd probably be better off asking no, this is not the one. Well, at the vote that I have, which was the vote that you took at the work session, was ought to pass amended fiscal note only 7-0. So I assume that other members, I'd have to ask Avery how the additional 6 people voted.
I think that I seem.
Yeah, let me dig out the voting sheet real quick.
So, but it's most likely most of the people in this Zoom room at the moment anyway. So
you were going really fast that day. I don't even, all I know is the motion was made by Senator Pouliot and seconded, I think, by Representative Terry.
Yeah, I think so too. I hate this nonsense. It's crazy.
Yeah, it's unanimous.
Yeah. So everybody understands what we're sending to appropriations at this point, that it is an enormous cost to the state, but we still want to figure out a way to get rid of it.
Yeah.
Okay. We're still gonna try, guys. We're still gonna
Okay. You can really tell it's been a long day now.
Yeah.
My professionalism goes to the wayside after that. Sorry. Okay, so Julie, I'm going to stop sharing this screen and I can share LD 1195 if you'd like me to.
Yes, please.
Okay.
I feel like an Edward Gorey book, The Dwindling Party.
Sounds about right.
Yeah.
LD 1195 is an act to increase funding to qualifying municipalities by sharing adult use marijuana sales and excise taxes. So this is the bill that would provide that a percentage, 5% in this version. You had bills with different percentages, but this is 5% of the revenue from sales and excise tax on adult use marijuana would go to a fund that the bill creates called the Local Government Marijuana Revenue Fund that would provide funding or revenue sharing to municipalities where adult use marijuana establishments were located. So this is identifying that there is the bill, there currently exists something called, which you'll see in the middle of that first page, the Adult Use Marijuana Public Health and Safety Fund. That's something that currently exists, and 12% of the revenue, adult use marijuana revenues, go to that fund to assist with enforcement and regulation of adult use marijuana facilities. What this bill provides is that the amount going to the public safety fund is after the revenue sharing amount has been taken out. So under this bill, the revenue sharing fund percentage gets taken out. Then the percentage that goes to the public health and safety fund is on the amount that remains after the revenue sharing money has gone to its fund. So the amount going to the public health and safety fund goes down a little bit because it's the base that it's calculated off of has gone down a little bit by removing the revenue sharing funds. The second item there is identifying that $970,000 in 22, and that's probably about half a year, more or less, and 1.7 million in FY 23 would be going to the revenue sharing, the marijuana revenue sharing fund. There's an appropriation to revenue services for their $5,000 administrative costs. And then the next page is the total and the chart with the total following that page.
Terrific. Any discussion about this one, or can we send it on out? All right, I see no hands raised or hand waves. So I think we're good to go, Julie.
Great.
Okay. Anything else from anybody? I appreciate you all keeping your eyes open for this whole entire day and paying attention and asking great questions. we will see you all on Tuesday. We have nothing scheduled for Monday.
Yay.
Yeah, somehow or another that happened. Keep in mind though that we do have, in case of something coming up, we'll certainly give you all a call and see if it's possible to do. But I think that Monday we're safe.
Thank
All
you.
righty. Terrific.
Thank you, Madam Chair. You did a great job.
Thanks so much, Ted. Have a great weekend, everyone. We'll see you all on Tuesday.
Bye.
Bye.
Yeah.
Bye.